Hey, Rick Albers.
Hey, Randy, how are you?
Good. I have a question for you, and you might be able to help me with it. I got a call from a Georgetown resident regarding a Jake brake sign on the highway. I'm assuming that's going to be a CDOT thing. Is that correct?
Yes. Yes, that'd be CDOT.
What's that?
That'd be CDOT.
That's what I thought. I can't imagine we'd be putting anything up there.
Yeah, no, that's interstate CDOT stuff.
Yeah,
State
I'll get with them. Thanks.
Yep.
Good morning, Beth. Can you hear me okay? Well, it's 8:30. Maybe we ought to get going here. Although I guess I don't see George yet. I have kind of a strange view to my Zoom this morning.
Huh.
It's focusing on our county manager for some reason.
Are you using a stand-up?
I'm just using my Chromebook like I often do.
Well, I mean, are you using a stand-up desk now?
Seeing that I had knee surgery on Friday, I'm not standing up any more than I need to these days.
I didn't know that. I didn't know that was happening. What? Oh,
Not a big deal. I tore some meniscus when I was skiing up in Canada, so
Oh,
Had a little reunion with my good friend, Dr. Charles Gottlieb, who I think you're probably also familiar with.
yes, yes. Yeah, he did. He did my right shoulder the second time, and I think my left shoulder. I
I
can't
was
remember. It was some body parts.
I was at a fundraiser in Evergreen once, and my our mutual friend Rich Cardillo was the MC, and he was doing this game show where you, no matter how you guessed, you would lose and have to pay money. But one of his questions was, name the 7 people in Evergreen that Dr. Charles Gottlieb hasn't operated on yet.
Yeah, yeah. I was hoping to get some kind of a quantity discount.
Yeah, I was one of them until now I'm not. But anyway, I know that the first item on the agenda is an administrative issue. Maybe we can do that while we're waiting for George.
George is on now.
Hi.
Oh, all right. Maybe I'm just looking at the wrong view. Okay, gallery view. There we go. Back to normal. Sorry, everyone. Morning, everybody. We're all here. It's 8:32. Nanette, you're at the top of the agenda with some administrative approvals for marijuana licenses.
That's correct. They're just administrative items for the chairman to approve.
Okay, and you recommend approval?
Yes, on all 3.
Okay, that's good enough for me.
Thank you.
All right. The next is public comment. Anyone come here today to make a public comment, please raise your hand, and Beth will cross you over, and you'll have a few minutes to let us know what's on your mind. Looking over there, I think I'm seeing mostly county staff folks in the attendee list.
Mm-hmm.
So let's move on to the commissioner update. Who would like to go first? Closing
I
public.
can jump out really quick. I'll just do one thing because it's not terribly involved, but just back on the renaming stuff. We've had responses back from 3 of the proponents for 3 of the proposals. And the 2 we have not received are from the Northern Cheyenne and Mount Cheyenne Arapaho, and the person who put up Mount Sewell. The 3 who have gotten back can all make one common date they can all make is March the 1st. So I'm suggesting that we do that then. And I've got calls and emails out again as recently as yesterday to the other 2, and I'll keep trying to get them. And I'd give it a couple more days, and I think at some point we should call the schedule and get the word out and just let them know that if they can make it on March 1st, that would be best. And then we could do an evening meeting we could do an evening public comment session on March 1st if we wanted to, after those presentations, so they're fresh. And then plan on coming in for discussion and potential action on March the 15th. And then if the others can't make March the 1st, but can get something to us on another date, we can at least have them come in. And since those sessions are recorded, we can post those along with the other information so people can see the sessions, prior to, as they make public comment and prior to our meeting. And I just wondered how that schedule sounded to you guys.
Yeah, I'm fine with it. I think this is, like I said, this is a little bit different situation with multiple proposed names. So I'll have to sort of see how the process goes to figure out how I'm going to weigh in on it.
Yeah, fair enough.
Weigh in on it.
Same.
George?
I think that sounds great. After we made the decision 2 weeks ago to invite all these folks, I was kind of reflecting on the complications therein. But I think that giving them the opportunity and accommodating them to the extent that we can is more than enough.
Okay. And that's really all throw in right now. I will say on Floyd Hill, I talked with Kurt Kionka, who's the project manager for the Floyd Hill project, and he's actually not going to be the right person to lead that, but we're receiving some assurances from CDOT that some of the fire egress issues should be taken into consideration on the Floyd Hill project still, and so we'll be trying to make sure that the CSS project going forward, before it makes permanent that design, there'll be an ITF task force. There's a first meeting on the 24th, I think, and we're recommending out of our county transportation team that the first thing they take up is to do a transportation study, professional study of the actual likely impacts of that parking lot on congestion at that location during an emergency. And because that's the key element. And in order to be able to adjust that design if necessary. If there is shown to be a negative impact, as some of the folks are concerned, and it's a completely legitimate thing. It's been on their list of issues that just didn't get addressed during CSS so far. And so our intent is to make sure that that does get looked at and does get some attention. Because it's been an issue up there for a long time.
Thank you. I know we had talked about the need for egress in various quarterly updates as we discussed the Floyd Hill project. I don't think it had come into my mind. I saw the design with the parking lot. It hadn't come into my mind to be concerned about how that would complicate egress. It's worth looking into. We might find that CDOT's engineers have thought about that and can satisfy us, or we might find that we need to ask for a change.
Right. The project manager indicated, I think it had not been, I think our thoughts right now is that it has not been addressed in the design or the discussions of design to any significant level. There aren't any records of that, and it should have been, because it's been on our radar for a long time, and it's been on the project list since the beginning for about 3 years. So anyway, so they're going to take a look at it, and that's a good thing.
Anything else, Randy?
Nope.
George.
Okay, a couple things from me. First off, just a little bit of transparency and a shout out. I had a personal computer decide to work less well than I needed it to sometime in 2020, and was given a laptop, and just had it switched. They wanted to switch. So they switched my laptop. They gave me a monitor. Really like having these tools. It's really nice. And my primary motivation here is that David Prowse, who I just met, who's been on our staff for maybe about 6 months in our IT, was really good, really professional, just had everything figured out, and it went really well. So shout out to David Prowse and our IT team.
Thank you for sharing that.
The other thing that I have for you right now is related to the road and bridge sales tax. I received a phone call last week from a vendor that collects sales taxes for us. He did not notice that the sales tax rate had gone up, and was pretty upset that we had not sent a notification that the tax rate was going up. What I told him is that regardless of legal obligation, I'd like to be part of an organization that thinks about that and gets that done. I also told him I have optimism for better performance in the future, given that we have a finance director and that we have funded a PIO position. And then I asked Peter to look into it a little bit. When it comes down to, at this point, it looks like, and we reached out to Department of Revenue. We had no obligation to send a notice like that. And what that means is that there's really no recourse for those taxpayers or those tax collectors. The law, as we understand it, and Peter, correct me if I'm wrong, is that we really have no recourse. And so I wanted you all to be aware of that. I think it would be wise for us to ask Peter to just look into this, see if there's any kind of recourse that we can identify or offer, and then maybe report back to us in executive session in a couple weeks.
Can I ask a clarifying question? What kind of recourse are you asking about?
Yeah, so the problem is that the tax rate went up by 1% and folks didn't collect it. And so they're owing to
That
Department of
recourse.
Revenue and us. The person I talked to, the difference was $1,000. And so is there anything we can do to have them not be out that money, basically? I know, like, just from a policy perspective, not thinking about any law or legal context, I'd be fine with figuring out how to say the tax would be started to collect on February 1st or something and just wash. I don't think that's actually a legal option, but that's what's in my mind, Brian.
But yeah, we've already sent letters. We did send letters out to all entities in the county with respect to the sales tax. So they now know. We're getting phone calls. Maria's getting some phone calls. We put Maria's name and phone number in the letter and let them know they could call her if they have questions. And she is getting some phone calls. But again, we did alert all the business community.
Thank you for doing that. In the future, it'd be better if we did it before the first of the year. I know that was
Yes.
the intent and it didn't happen. And I think what I was understanding George to say, that if there is a legal option to, and I don't know that there is one either, I'm doubting it, but if there was a legal option to forgive their need to pay what they did not collect from the customers, then, personally, I'd be supportive of that. I realize there's complications because some people probably did collect it and some didn't. The bottom line is that money that was collected came from the customers, but it's a complicated subject. And if there's no way to do it, then there's no way to do it. But I think, isn't that what you were asking for, George, was to confirm that whether that legal capability exists for certain?
Yeah, just if we have any options, Peter, I know you've already dug into it. You've already asked around. And I basically just want to hold open a period of 2 weeks where we hear about this in executive session and talk about anything we can do.
So I will schedule this for an executive session in 2 weeks. I will do additional research. I understand what the board's concern is. I'll also discuss it further with Brian. You are correct, though. We don't have any legal obligation to provide it. Typically in the past, except for apparently last year, I believe, we generally do send letters. However, the Department of Revenue, just so you're all aware, make sure that every entity that that has to pay taxes is fully aware of their obligations. It's a commitment that they get when they get these licenses. The Department of Revenue also not only sends out newsletters and reminders, but it also does educational training on this type of thing. But that being said, I understand the direction from the board here. I will bring it back for executive session in 2 weeks.
And thanks. I was aware of most of what you said because George taught me a lot this morning. I've never managed a sales tax license or had one, so I wasn't quite sure what the process was, and he explained a lot of that to me, and I appreciated that.
Yeah, Randy he heard about this yesterday in a store, so he called me up to ask about it.
And so, not to belabor this, but someone like Amazon, who's a major taxpayer, they have processes for being updated when municipalities or counties change their tax rates. And so this is more a smaller mom and pop type of operation that we're talking about here in general. Is that right?
Yeah, I think so. It's your local businesses.
Yeah, it's a real shame. I mean, Amazon probably has it automated, right?
Yeah, that's what I was just thinking. And I was selfishly thinking about wanting to make sure we're collecting everything that we need to fund our road and bridge and to pass on to the cities. Okay, anything else, George?
That's all for me.
Yeah, I don't think I really have. I mean, I've been working and continuing to work with the Treasurer's Office, and we've partnered with New Mexico, and we're in discussions with the state of Delaware, who may want to join our program, which would be good news. Would essentially mean that we would reach break even sooner than we had projected, but we'll find out more as their legislature discusses this and probably puts their own legislation in place. And I see Sheriff, you're on the call. We haven't heard from you in a while. Do you have anything to add to our conversation? Any updates about fire danger or anything that you want to have a chance to put out there?
No, I really don't have anything to update. Fire bed, you guys are gonna approve the rescind it today. We've gotten enough snow and we still gotta be careful because there are some dry slopes out there that grass is pretty high, so. But other than that, I really don't have much to update.
Okay. Then Brian, I think you're up.
Yeah. I think you all saw the email from the chair of the Open Space Commission needing to reschedule our joint meeting. So I was hoping to get some dates from the three of you that might work, maybe up to 3 that we can then share with the Open Space Commission, give them some options for a new rescheduled joint meeting. So I assume we're going to look at any evening, Monday through Thursday in the next couple of weeks.
Yeah, my calendar's open, so if you want to start looking at some dates for that.
Do we want to go as soon as next week? Which
Next
would
week,
be
is
7th through the 10th.
any of them is good with me next week.
I'm scheduled the evenings of the 9th and the 10th. The evening of the 8th is open for me, although it may not be preferred by our friends on the Open Space Commission.
The 8th may not be preferred.
Just given the reason that the 7th was canceled and the proximity of the 7th to the 8th.
Yeah, Bob's traveling home on the 7th.
Oh, that's true. I forgot. I thought I'm sorry. Yeah, so the 9th and 10th you said are out. So let's just go to the following week then. So we're looking 14 through 17. Looks like now 14 through 16. You've already got a joint meeting on the 17th that night. So you got one night meeting on that week on the 17th.
Yeah, I can make any of those work. Yeah.
I see Dr. Cog on Wednesday, the 16th. That's Randy's assignment. I just have it on my calendar because I'm the alternate. And the 17th is out. The 15th is possible for me.
I have an EDC board meeting. No, that's been moved. Never mind. All right, so you say that again, George. Which ones didn't work?
I think the 15th is the only one that works that week.
Okay. Does that work for you and Sean and Randy? Does that work for you?
Yeah.
I think so.
So 15th is good. Following week, 21 through 23. I can't do the 24th. Actually, the 21st is President's Day, so we'll be looking at the 22nd and 23rd.
I can do both of those.
I think so. Yeah.
And we're talking like at 6 p.m. and later type of thing.
Yeah. Yeah.
Anything works that week for me.
Let's go out one more week just in case.
That last week of March, I'm open.
Last week of February.
First week of March.
First week of March. The 28th through the 3rd.
Yeah, I've got a JCMH board meeting on the 28th, but that's it for me.
Okay. First through
We
the 3rd.
were talking about maybe doing that.
Oh, yes. Public meeting on the 1st.
Yeah, right. I mean, it doesn't have to be that day. We're just in about the next 48 hours, I'm going to wrap it up. I'm going to give about 48 hours to those other 2 proponents and keep making phone calls. And if I don't get them, then, they'll just have to work with our schedule.
Yeah. Well, we've got 3 dates here, 15th, 22nd, 23rd. We use those 3.
Okay.
Well, that way we can reserve that first for the public meeting. All right. That's all I got.
Okay. Look back at the agenda here. What's next? Okay. It looks like do you have any other updates?
No, I'm good.
So we rightfully postponed our management retreat, whatever we're calling it. What's the story with that? Are we at the point now where we feel like it would be prudent to start talking about getting that back on our calendars?
That would be good. Yeah, we need to find some dates for that also. I mean, we can, I guess potentially we could do that when I meet with you each individually, or we could do that if you want to do it now, we can. CKR is here for the 9 o'clock.
Yeah, we can start early too. Okay. I mean, I don't know that that's super urgent, but yeah, I think it's probably time to get that on the calendar. Just having gone through that exercise we did for the open space, it's clear
Agreed.
that it might not be super easy to get all three or all probably
Yeah.
10 of talking about the entire leadership team on the same page at the same time in the same location.
Yeah. Okay.
All right. Kira, I see you've joined us. If you'd like, we can just get started a few minutes early.
Did Brian have anything else?
No, I'm good.
Okay, sorry.
Good morning, commissioners. Good morning, everyone. I'm Kiara Kunstler with Jefferson Center. It's nice to see folks again, first time in the new year. We do have two other people joining us, Kara Campbell and also Taylor Klepper. If we have time for Taylor to give a little update on some of the collaboration that we're working on with you related to housing. So just to let you know that, Beth. All right. Well, thanks again for having us join you today. As we all know, the pandemic, which is stretching on for 2 years now, has taken an incredible toll on the mental health and well-being of our communities. And we are noticing that. We are noticing the increasing complexity of the people that we're serving, the increased number of social needs for the people that we're serving, things like housing, rental assistance, benefits assistance, as well as just an increase in certain types of symptoms or diagnoses. So we're seeing a lot more PTSD, post-traumatic stress disorder, and anxiety disorders than we have seen in the past. So this pandemic is really taking its toll. It's also taking its toll during a time in which we are struggling very significantly with workforce. And I know that I'm not alone in those challenges. It is across all sectors right now. Within behavioral health, we struggled with workforce prior to the pandemic, and that concern has only increased during the pandemic. There has been a large influx of private for-profit providers, which is expanding the behavioral health opportunities out there. I'm thrilled that behavioral health is getting the interest and focus that it has been needing for many, many years. At the same time, the workforce just simply is not built up to support that growing demand. And those growing opportunities for employment are really moving people out of more nonprofit settings and more into private practice or private provider settings where folks are able to earn higher salaries, serve less acute individuals and families, and usually have fewer administrative burdens attached. So those are some of the unique challenges that we're facing at Jefferson Center as it relates to workforce. Right now across the organization, we have around 95 vacancies. 90 of those are clinical. To put that in perspective, we have around 670 budgeted positions. So that's a large gap in our service delivery capacity right now. Kara, when she joins, will give you a little bit more detail about the specific open positions for individuals serving Clear Creek County in particular. So in order to meet these challenges, we are working on a number of different initiatives. We're really focused on engaging our staff, our clinicians. They've been on the front lines throughout the pandemic, as many healthcare workers and first responders have been. And along with that comes burnout. So we're trying to support our team in every way that we can. Wellness is a big focus and a priority, as well as making sure that people have opportunities for flexible schedules while still being able to meet the community need. We've also implemented, because we have so many vacancies, we have vacancy savings that we've reinvested in our staff through hiring bonuses, retention bonuses, and salary increases where we've been able to, particularly for the people that have taken on more burden and taken on more clients, or have been in those 24/7 type services during the pandemic. So we're reinvesting those vacancy savings where we can to make sure that the people that we have on the team are well supported during this time. We're also working on advocating at the state level for a reduction in administrative burden and complexity. The level of administrative burden that mental health centers face is really unique to mental health centers across behavioral health providers. There are additional paperwork requirements, licensure requirements that end up stacking up on clinicians' plates, taking away from direct care and also burdening the clients themselves who come in to seek care and having to fill out a lot of paperwork that are requirements for our state contracts. So we're working with the state departments very closely. They are also eager to remove some of these administrative burdens, as we all know that will put more time into direct services. So we're working collaboratively with them on that. Good morning, Kara. We got started a little early. Administrative burden is a huge core of work that we are trying to resolve at the state level in partnership with state leadership. Finally, we're looking internally. How do we need to transform our care delivery models to be able to still meet the growing need, but do that with less clinical resources? And that's a real challenge. And we probably will not be as successful as we want given the number of vacancies, but we do feel hopeful that we're able to make some changes there. So that means more effective triage at the front door. So when someone is requesting services, what type of services do they really need? It might funnel people with more critical needs into urgent services right away. It may mean that people with lower levels of need are able to be supported through groups or outreach from case managers or navigators. Is someone really looking for housing or benefits assistance? And can we loop them in with our team that can support them with those basic needs? So we're trying to get very creative and innovative with our care delivery model so that we're able to meet more needs. And again, Kara will talk more about those details of how that looks in our mountain services area. I'll give you some high-level numbers in terms of our services over the past year. We have seen a fairly steady number of total services over the past several years, with fiscal year 21, just over 5,000 services, 5,093 services. Those 5,000 services were provided to 473 Clear Creek residents. The way that we're tracking this data has changed a little bit from prior years, where we used to be able to track people that came into our offices and saw our folks in Clear Creek County locations. We don't have that capacity anymore because so much of the services are provided via telehealth. So what we're looking at now is addresses. So that's the number of folks with Clear Creek County addresses. We know that that's not capturing the full extent of it because there are people with PO boxes, there are people out of county that come through Clear Creek, there are people without stable housing. So we know that that number is a bit lower than the number of people that we're really seeing. And so we're working on ways to track that, and we'll have more comprehensive reporting for you the next time we come. So on average, individuals are receiving 10 or 11 services. The number of total services that each person is receiving has increased over the past year. And that shows you just sort of the heightened acuity, the heightened intensity. We're also, as I mentioned earlier, seeing a lot more diagnoses such as PTSD, post-traumatic stress disorder, anxiety, and substance use, and depression. So those are our top 4 diagnostic categories. By and large, folks are receiving individual therapy. They're also receiving a high volume of case management, as well as prescriber and medication appointment services within those 5,000. So that's a high level. I see Commissioner Wood, you came off mute. Do you have questions?
Thanks for the update. I was just kind of curious to know if you have data about demographics, like the ages of the patients that you're treating. Is that changing here in the last couple of years with the pandemic happening? What else can you tell us kind of about who's getting the services right now?
Yeah, and I'll ask Kara, would you like to give some context around that?
The large majority of folks we see, I believe, are in the 21 to 55 range, and that's remained consistent. I do want to give some credit to Resilience 1220, who serves the 12 to 20 range, and so we've seen a little bit of a dip in that age range, but I do believe it's because we've been working well with them, and when we can and when it's suitable, we will refer people to them.
Yeah, I'm curious about that as well. I mean, I know that they rebranded themselves a couple of years ago with the ages that they serve, but I don't know that much about them other than you kind of hear them raising money around the community, and I think that they're generally pretty well regarded.
Yes.
How is it? Is their approach to behavioral health kind of similar to JCMH's? And I mean, how do you guys kind of collaborate?
It's similar. They are funded mainly through grants, and so they don't have a lot of the administrative burden that community mental health has. So there's not as much reporting, and so one of the benefits of 1220 is that clients can get in within 24 hours, and there isn't the lengthy assessment process. And so if somebody's just wanting to get in and speak with somebody a time or two, it's a really great service. You can get in quick and see folks. We work together, whereas if somebody's wanting services right away, but we say we don't have anybody available at the school, we'll recommend why don't you connect with them? It's time limited, so I think you can meet with somebody a dozen times or something. And so we suggest, why don't you start there, and then you can come back if you need more services than that. Or 1220 if they meet with somebody and realize that there are some really significant or acute, there's some real, high level needs, then they will refer back to Jefferson Center for that extensive assessment and things like that. So we take a similar approach. A lot of them, we're all licensed clinicians, so we've studied the same, and our approaches are similar. It's just a matter of how and who we report to, and I think that's about it.
Okay, thank you.
Kara, I gave kind of a high level overview of some of the challenges and how we're addressing those. Could you give a little bit more detail about the work of our team in Clear Creek County, areas that are challenges, but also ways that we're really increasing support as well, and what that looks like?
Sure. Yes. So right now we still are offering some in-person services. We have walk-in hours at the Health and Wellness Center now, Mondays and Wednesdays from 1 to 5. So whether you're a client or not, or anybody, you can walk in to see Carrie Lindbergh, who will have office hours there. So we're pretty excited to be offering that. We have senior services that are providing some in-person services. Our school-based clinicians are still in person. Colorado Spirit, and our trauma services, our TST, Trauma Services Therapy, which is an in-home intensive family program that we have. So that is still meeting in person. We've moved to virtual. We moved back to virtual for a lot of individual therapy, and that's with Omicron. And so we're looking at, how and when are we going to reintegrate after that. Group therapy is still available to everybody, and that's virtual. Our jail-based team, I believe, is going to go back next week. We also have case management available to anybody virtually, and then our navigation services, which are connections to resources. Yes, our team, along with most others, we have 8 vacancies on the mountain team, and that's over 50% of the staff that we have. All of our teams are impacted. We need 3 outpatient clinicians with different specialties. Somebody at the school, a crisis clinician, yeah, and the list goes on, and a JBBS coordinator at the jail. So we have had to get very creative. Yes. What's happening now, and the other issue I think we have right now is there's the community perception that there is absolutely no access and you can't get in, and there's no way to get any help, and that's just not accurate. Somebody can call in and meet with somebody for an assessment, and those generally take, I don't know, about a week to get in. I think 7 to 10 days is what we try to do at the very latest. And then each client is going to be presented with options, and some of the options might be, if you want to see a clinician now, you can connect with somebody virtually from our Jeffco team. If you really want to meet with somebody local or in person, there will be a bit of a wait. We're backlogged. We have 2 outpatient clinicians right now, and so if folks really want to meet with someone local and in person, then they will be put on sort of this list, and our care manager outreaches them at least monthly to check on them, to see how they're doing, connect them with resources. We have groups, and those groups can be group therapy. Sometimes people are into that. So we also have psychoeducation classes. So if people just want to learn about their disorder, we're going to be having workshops on anxiety. So people can learn a lot while they're waiting to be connected with the clinician. They can also meet with the prescriber. So there's a lot of things that are happening while waiting to meet with their local in-person clinician. And we're looking into switching to more of a real-time model called Phase Forward. And we do need at least to hire 1 more clinician in order to get it off the ground. But it's more of a walk-in model where we set up days and times where we have a whole staff available. So not only do you have just your clinician you're working with, but you have a care coordinator, you have a peer, you have a doc, and a clinician. And so you can call in anytime we're having a clinic. And so potentially when somebody is experiencing more symptoms, they can call in weekly. And if they're having a really good month, then we don't need to hear from them as often. And so we're connected with the client, but they're seeing us more often when they need it and less often when they don't. And this has been piloted in our Jeffco region, and it seems to be doing really well. And so it's seeming to care for more people more intensely when they need it. But we are excited. We just hired on 2 new people for an early child outpatient. And so definitely looking for younger children. We have a space for anybody 0 to 12. And our mobile MAT team, medicated assisted treatment, the MAT team is fully staffed and the van is functional. It hasn't broken down in a long time. So we're excited about that. So we think that one is back on track, and we're starting to try to relaunch it fully staffed and ready to go. And yes, the kiosk is still coming. It's where if anybody does not have access to the internet or they're in crisis, and they're going to be able to go to the Health and Wellness Center and check in at the Centura Clinic, and they're going to have a tablet where anybody can log on during business hours to speak with either one of our navigation specialists, which is a resource connector, or a crisis clinician. If they just need to talk something through, or if they're in true need, we can help arrange getting them to the hospital or the walk-in clinic, things like that.
Kara, how many people are on the waiting list right now?
I believe it's in the 20s.
Okay.
And so every week as patients discharge, successfully, or they decide they're finished with care, we're moving through that maybe a couple, 2 to 4 a week as they come up.
Okay. And just to reiterate that for anyone, none of those 20 are in acute need of services. So those with more acute needs have crisis resources. We're able to make sure that we're meeting those complex needs. These are individuals who have chosen, based on those options of available services and based on that thorough assessment, that they can safely wait for ongoing care. So crisis services remain those crisis walk-in hours, our local crisis responder, as well as our mobile crisis team that can be dispatched 24/7. So those are all available all the time regardless.
That raises a question in my mind, and I think I think you guys have done a good job just now of helping us better understand the efforts that you guys are going, your team is doing in order to reach people. With that said, one of the things that I've learned is that a lot of people who have the most profound needs, part of the symptoms they experience is resistance to treatment. They don't want to be helped. And that's tough because on the one hand, in some ways, you guys, your team is responsible for meeting the needs of the community. That's your funding model. I don't know if Randy, I didn't really understand what Medicaid subcapitation meant, and maybe I still don't, but my understanding is essentially the number of Medicaid eligible people within your service area are estimated, and your team is given funding related to that number, and then it's your job to go find the people who need help and help them. And so it's a little bit of a tricky spot you're in, where you're given this mandate of helping the people, some of whom don't want to be helped. Can you talk a little bit about that, and kind of, and some of this is been brought to light through some news stories that have happened recently, and I'd just be curious to hear a little comment about that dynamic.
Yeah, thank you for the question. There's a couple of things to address there. One is that the subcapitated model that Jefferson Center has with our regional accountable entity that pays Medicaid rates to us is really based on a proportion of the people that we serve directly, which right now is about 40% of the total people with Medicaid who receive behavioral health services. So CCHA is the regional accountable entity, and they have a broad network of other providers serving that other portion of folks. So it's a little bit different than it was 5 years ago when we had a different model, and we have less access to understanding the needs of the entire Medicaid population in our region than we used to. So we don't have the same degree of access to who needs our help, because there's a lot of other people also offering that assistance. That being said, we are absolutely here and available for people in crisis, for people who need us. And we do not turn people away who have Medicaid or without insurance. So even those folks on a wait list, we make sure to assess, triage, get them the appropriate level of care, knowing that for less severe needs, there may be a little wait right now due to the workforce challenges. It is always a challenge with people with complex needs, and we've done a lot to try to get out into the community so that we can be there and available when people are ready to reach out for help. So being in the schools, being in the jails, doing community-based prevention and outreach work, the mobile medication-assisted treatment. We're trying to get out into the community where people can see us and access us when they need that. There are still people with serious behavioral health concerns or serious addictions who don't want care. And it's very, very difficult because as treatment providers, we know that there are services that could really help them and support them. But it's like any healthcare. People who have diabetes or heart disease or any kind of chronic condition, it takes that person being willing to engage in their own care to be successful in it. So we go in every which way that we can to make that available in the community when people are ready, putting forth what we think could be useful and helpful to them. But it takes some of their own initiative and the right timing for them to seek that care and undergo that care. There are a few circumstances where we can force someone into care, but those are few and far between for very good reasons. People have individual rights to make choices and decisions about their care. So if someone is threatening harm to another person, if someone is imminently suicidal, or if someone is severely and gravely disabled is the language. So someone that is so not connected with reality that they're not able to function independently. Those are three circumstances where we have more ability to require a 72-hour hold, have them get them the care that they need in the hospital, do some assessments, some short-term medication assistance, and try to get their thinking a little bit more clear where we can help them engage. We do a lot of outreach. So if someone's not ready now, we'll continue to reach out and see when they might be ready. But ultimately, people have independence and rights over their treatment.
I want to take just a moment and express maybe some optimism. I think what I'm seeing is, and what I heard you say a few minutes ago, Kiara, is that the level of awareness around the need to address behavioral health is higher than it's ever been.
Mm-hmm.
And the desire for people to seek help is higher than it's ever been. And so I just want to express a little bit of optimism. I understand the challenges associated with getting money to serve people, and then, going and finding them and getting them the services. And I'm really optimistic for the future that challenge will get easier.
Yeah, I'd like to tag on to that and just say that I've had two experiences recently that helped me realize that. One is, of course, through the 2 years of COVID, there are all kinds of stress that's put on people. And I think in general, our population has more of an affinity with each other about how much they share in stress reactions and the ways that they manage it. And also things like the Boulder fire. I spent time, as I mentioned, and I think in our last meeting, well, actually just Sunday, I spent time in skiing with a friend who didn't lose her house, which was by about 2 blocks, because the fire laid down right before it got there. But her ex-husband's house about a mile away was completely leveled in one of the subdivisions that completely disappeared, and there's nothing left anywhere. All you see is an open plain, sat right on the edge of the open space when the wall of flames swept across. And all kinds of people are recognizing, and she said the outpouring of support has been tremendous. We don't wish those things on anybody, but I think those have taught people a lot. Another positive influence has been the creation of our clinic. And the whole idea over there was that it's one place for everybody, no matter how you pay for it, no matter who you're going to see. And when we had Karen McNeil Miller in for a tour recently, the president of the Colorado Health Foundation, just as she was leaving, I saw a guy in a mask there that had been filling out forms, and he recognized me and said, "Randy," and it was a guy I knew here in Empire. And he said, "This is great. I didn't know this was here." I said, "What's going on?" He said, "Well, they've got mental health help. I'm going for it." So,
Yeah.
So I think some experiences that we've had in the last couple of years, really, hopefully worldwide, as well as efforts like that, are really helping to remove that stigma to get people to get involved. And like George said, that's very hopeful for the future. That it's going to be like, it's hopefully it'll be. You'd wish it would be as easy as, going in to get that mole looked at or something like that, in terms of easy to get yourself to do it one day, to not feel that, be proud of taking care of yourself.
Absolutely. Thank you so much for those comments. You three commissioners have always done such a tremendous job in recognizing and supporting the behavioral health needs in Clear Creek. And I'm so grateful for that leadership, because that is part of what reduces that stigma and makes it possible for people to seek the care that they need. And I completely agree. This is, the awareness, the discussions around behavioral health, the discussions around the gaps, within the behavioral health system, given that growing demand. Those are all critical conversations. The challenge is that we will not solve the workforce crisis for at least 5 years. To be a behavioral health professional with licensure takes a number of years to go down that path. So we're going to have probably 5 years or so at least of really struggling to meet this increased need with a similar level of resources. But after that, I'm so hopeful that there will be enough providers and enough resources and enough awareness for people to get them help that they need when they need it.
Yeah, the only comment I would add to that is one of the things that the three of us have been looking at as well is what it looks like when COVID eventually dies off, because we have staffed up our public health function in a way that we never have before. And you mentioned a couple of chronic conditions, Kira, diabetes, heart disease, things that have a public health element to them. And I would love to see a more unified approach to public health, more from a preventive perspective than just treating people who are already down long ways down the wrong road. And I know that behavioral health is a continuum, right? And at the higher end of the continuum are people, I would say, working on their self-actualization and essentially becoming a better version of themselves. And that's, I think that there's a lot of potential there, like I said, within the public health sphere for us to be a leader in a small community. And like I said, refocus the efforts of our public health function to be a lot less focused on a particular problem like we are now.
That's an excellent point as well. And that's another part of our goals in terms of transforming how we deliver care is how do we get upstream, make more of those mental health first aid and suicide prevention trainings available. How do we do that outreach in schools, that early childhood work that's so critical to preventing those later struggles with mental health. So that's the public health perspective on that is really valuable. So we'll definitely reach out to Dr. Ryan and have those conversations about how we can support that as well. Before we wrap up, we invited Taylor Klepper here today. She's our Director of Navigation and Housing, and she's been coordinating with folks within the county on some housing ideas, because we know that is a huge need. As people are able to obtain stable housing, they're able to function better in terms of meeting their physical health needs, their behavioral health needs, and can actualize some of that more effectively. So Taylor, do you want to just give a little overview of the efforts to date?
Absolutely. Thank you all for having me and all of us today. So the basic gist of what I've been trying to do is a little exploratory work on what types of resources are available. So where we kind of started is a collaborative group that we formed throughout the Upper Arkansas Valley. For housing purposes, there are kind of weird boundaries, shall we say, in terms of how things are organized. So one of the ways that our most vulnerable folks get into housing is through something called a coordinated entry system, which is essentially a coordinated effort to serve our most vulnerable folks. So for the region that Clear Creek kind of falls within is that Upper Arkansas region through that what's called a continuum of care. So not to get too far into the weeds, but that's kind of the gist of why this group has come together and why these boundaries exist, at least in the housing world. So that being said, we have folks from Fremont County. They kind of are the seat, if you will, of some of the supportive housing efforts that are happening in this region. So there are a number of folks from the Upper Arkansas Council of Government, the Division of Housing at the state level, the Continuum of Care, which is again that kind of housing coordinated entry system, the Colorado Community Health Alliance, which again is that Medicaid oversight, who does oversee 2 regions that are encompassed within this kind of work group. And we do have folks from Clear Creek as well. We have Sally at the table, who I know works with a lot of unhoused folks in the area. So our goal is really to help connect those dots and to figure out how do we leverage the resources that are already in existence, specifically help connect Sally with some of those resources and really get the folks living in Clear Creek unhoused into stable housing options. So we're not quite there yet, but that's really what we're working on, is how do we better connect those dots? How do we better collaborate and all work together, knowing that the end goal is really to find affordable housing for individuals in this region. So again, that's very, very high level, but that's kind of where we're at, and just exploring those gaps and how we might be able to fill them as a group.
And that concludes the end of the content that we had wanted to share with you all today, but happy to take questions now as well as always. So please always feel free to reach out with questions, with needs that you're seeing in the community. We do have our quarterly partner meetings with many of the community leadership and individuals working across many, many sectors. So we meet with that group quarterly to have those brainstorming conversations, identifying the needs, conveying information about resources. And so we'll continue those throughout this calendar year and beyond. Any questions before we transition today?
I'll share some questions that are on my mind that maybe don't have a great answer, don't have a clear answer, and can be perceived as rhetorical. Maybe, well, they're not rhetorical, right? Like I want an answer, but anyway, I'm thinking about the comment you made about the administrative burden you all feel, and its impact on your workforce and your efficiency, etc. I'm kind of perplexed because in spite of that, coming from this side of the table, not being a part of the organization, it's really hard to see and understand how the resources intended for our community are being spent. And of course, that kind of accountability, we would all agree, is crucial when we're talking about public funds. So we need to find a way to figure it out. And it just kind of begs the question, if maybe is the state asking you for the right information, or how can we, if you're spending so much time collecting information and we're not seeing information that helps us understand what's going on, how do we fix that? And so I'll just kind of leave that out there unless you want to answer it, unless you have an answer.
Well, I can say broadly, I think it's an important question. And Jefferson Center and all community mental health centers submit quite an enormous amount of data to the state every year through a number of different audits. Those audits are financial, programmatic, demographic. They cover sort of the full spectrum of information that's collected. I was just looking today at our cost report that we submit every year, and it's a very thorough accounting of essentially all expenses that we operate within. So there is data that goes to the state. I think the problem has been that there hasn't been a mechanism or really a direct process for that information to then be consolidated and submitted back out to the counties. We have reporting requirements with certain funders who directly provide funding to us. So where we have cities or counties that provide direct funding, we have a reporting mechanism back to them. But there hasn't been that sort of state level reporting back out to counties, bringing together all of that information. And I think it would be incredibly helpful and incredibly valuable process. And I know that the state leadership is really committed to doing that. And in the interim, we've begun conversations on our team about how we can pull together just quarterly and annual report for you all on what all funding is used in Clear Creek County and what are the outcomes, the service level outcomes that are a result of that. Because the funding that we use for Clear Creek County comes from Medicaid, it comes from the Office of Behavioral Health, it comes from local grants, it comes from federal grants, it comes from donations and philanthropy, it comes from a lot of different sources. And so we'd like to be able to present that to you moving forward in a more regular way. So we will do that work internally, but also I know that the state is working on more clear transparency around the data that they already collect.
And that begs another question. I mean, especially talking administrative and cost and so forth that I think it's good for us to be clear on, a lot of the recent controversies surrounding CMHCs that's going on with, state legislation and stuff like that to enforce legislation. I have said for 2 or 3 years now that I don't expect, when we have difficulties trying to get people treated in a timely fashion, the old story about you need help, that kind of help you need when you need it, and you need it now. And if it isn't available right away, that's been one of our issues. And I recognize that what I've always expected to find out by having a better understanding of the information is that maybe the system and maybe the people who are allowed to be able to treat and work with those funds should be something needs to be changed in the system to help solve that problem. I don't expect to find out. I mean, there may be some, I've never had the feeling that JCMH was poorly managed or anything like that. It's more like there's a gigantic job to do, and we may not have figured out the best model yet. And I think by being able to see this in an understandable manner, it can help us maybe find some ways to add to. And I'll put it in the context, one potential solution as example. I'm going to take us completely out of this into another context for just a minute. I'm looking at buses and transit systems. And when I start talking about throwing all these, the Pegasus project and all these things out on the road, what I hear from over on the West Slope is, but we have our transit centers. I said, those small shuttles, those smaller buses could be dedicated and take people straight to their destination, just like your transit does once you get to the county, and avoid transfers. And that will get people, instead of driving their cars, to actually ride these things. And they said, well, we can't let you do that because you'll be competing with our transit system. I said, no, we'll just be adding to it. We'll be supplying the additional transit bus you would have bought in order to move those additional people we'll be putting there. So I think some innovative ideas about how we can collaborate. I don't know what they look like because I'm not in your business, but I'm sure there are ways that, because the model of, taking small counties and attaching them kind of like, Remora's on the side of the shark of Jefferson County. The issue is that you face the same problems in trying to deliver to us on a, full-time model and have somebody here all the time based on the scale of what we have if we tried to do it by ourselves. It's still a problem within your budget. And somehow there've got to be some ways we can find some collaborative ways to just help improve. And I long thought that once we do this thing, everyone's talking about, like, take a closer look and have transparency. All we're going to find out is that you're doing the best that you can within the system we've got. And so it'll help us maybe identify some ways to make the system better, even better.
Thank you, Commissioner. And one of the things that I feel really proud of our team about is coming up with those innovative models. It's not financially sustainable to have a 24/7 walk-in crisis center in Idaho Springs. It's not feasible. But what we've done is bring in someone local who has that connection with the local community, with law enforcement, who can be that liaison, and then they still have access to that 24/7 services that are dispatched to the county from our Jefferson County location. So ways that we can sort of bridge those resources. Telehealth has allowed us to expand a lot of those offerings that really take those economies of scale to provide, and has allowed the access more directly to Clear Creek residents. In addition, we have always and will continue to offer those full-time outpatient clinicians available to Clear Creek. We've always had a number of those outpatient clinicians that'll be at the resource center, and we'll continue to do that. The mobile medication assisted treatment is another innovation model, trying to get that mobile van out to where people are, in the schools, in the jail. So I've been actually very proud of the team and the collaboration around trying to understand and meet those needs. And we are always open to hearing the ideas. If there's an idea that's put forth that we can come to the table around, we jump on it. So if there's a specific request, if there's a problem that needs, a solution to, we're the first ones to say, how can we help? So please don't hesitate to bring those suggestions, concerns to us so that we fully understand the problem and can address that problem directly.
And what we may also find out of it reminds me of a cartoon that I saw once that shows 3 guys standing in a vacant lot, And they're wearing hard hats and looking at a set of plans. And one of them says, well, some guys are going to come dig a big hole, and some other guys are going to come put a building in it, and then some other guys are going to plant some flowers out front. All we need now is money. And it may be that that's all we reveal with the transparency, is that all we need now is more money, to be able to get the work done. And of course, some people that are able to be paid that money, as you talk, the available resources.
Yeah, what we need right now is actually not money. What we need right now is people. We're, like I said, we're trying to invest those vacancy savings to resource the people and incentivize the people where we can, but that's the challenge.
So we're at the end of our time. I had just one thing I wanted to add to George's comments, which I think are very good. I think in some ways we may be in a situation where it's not that we don't have enough data. It may be that we don't have a picture of the data that helps us as policymakers understand whether we're trending in the right direction and how we can help your team. And I'm even thinking of something like a dashboard. And you mentioned some statistics like people on waiting lists and things that seem like they could be good underlying pieces of data for a dashboard. But I'd love to see something that fits on one page that next time we have this meeting, or maybe that's too ambitious. Maybe it's next year, but we would have a single page that we could look at that would really give everyone on this call a good indication of whether we were doing our job and whether things were headed in, whether things were getting better or worse, and what type of help you needed from the three of us or from our team at Clear Creek. And then that's a whole other discussion. I know there's a new person associated with the governor's office, and there's a lot of changes, and we're on your team, and we want to represent the people in our county as best we can and help you do your job.
Thank you. Thank you all, commissioners. I have taken note of some of your questions. If you have some that we didn't get to today, please feel free to email those to me and we'll address them and also work towards that reporting. We can absolutely have a one-pager next time. It may evolve based on your response to that, and we're happy to iterate until we get something that's useful. Thank you so much for your time today.
Thanks, everyone. So I know we have a 9:30 agenda item. We actually have two things at 9:30, and one of them is the consent agenda, which I don't perceive is going to take us all that long to push through. Brian or Beth, is there any, or Pete, is there anything on the 3 or 6 agenda items that need to be pulled, or are we good to go on those?
I believe we're good. Oh, sorry, go on, Brian.
Yeah, I was just saying that's really up to the board, but I think we're good to go.
I'm okay. I don't have anything to pull.
George, okay, then I'll read them here. The consent agenda, item number 1, consideration approval of warrant register. Number 2, consideration approval of 2021 road inventory and road system mileage certification report for allocation of HUTF funds. And I will note that there are no changes on this document as to last year's version. Number 3, consideration approval of resolution 22-10, resolution adopting the Clear Creek County Emergency Operations Plan, which we reviewed last meeting. Number 4, consideration approval of resolution 22-14, ratifying the rescission of the Clear Creek County fire ban declared on November 19th, 2021, the sheriff touched on earlier today. Number 5, consideration approval of revocable lease agreement between Clear Creek County and AMMA Lodging Inc. And then number 6, consideration approval of resolution 22-15, resolution rescinding resolution 22-03 and adopting revised investment policy for Clear Creek County from Treasurer Lee. Do I have a motion?
Move we approve the consent agenda.
Second.
All in favor, say aye.
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 Opposed, same sign. Consent agenda passes. All right, we are on to our next item, which is the Omni Behavioral Health Assessment Update. Ms. Crow, on to you.
Hi, good morning. I'm gonna share my screen. Right, thanks for your patience as I got that set up. I also have my colleague Lauren Barrett here who worked with me on this project. First off, I have to say that I'm really excited to be sharing these results out with you this morning. This has been the culmination of a long process of looking at the behavioral health needs in the community, coming up with some recommendations, and then prioritizing those with community stakeholders. And we've narrowed it down to 6 recommendations that I'm going to be sharing with you today. So I'm going to first talk about the process of how we got here. I'm going to touch on that just real briefly. Then I'm going to spend most of the time talking about the recommendations and then have some suggestions for the future of the project, and then have some time for questions and comments. So Omni Institute contracted with Clear Creek County to conduct the behavioral health needs assessment in 2021. This was an extensive behavioral health assessment. We've looked at historical data, and then we did quite a bit of data collection, including qualitative data. And from this, we came up with a lengthy list of recommendations to address the needs in the community. And a lot of those recommendations came out of the community from people that participated in the research and are also based on the unique nuances of Clear Creek County, as well as the strengths of the county. So that list of recommendations was really long and wasn't feasible to implement all of them. And so then we did a shorter process afterwards with a behavioral health advisory group to prioritize the recommendations that came out of that report. And this group was a cross-sector group of stakeholders that included Jefferson Center for Mental Health, Rec Center, the Community Connectors, law enforcement, public health, human services, and quite a few others. We had a really engaged group, had really good conversations that dug into what is actually going to work in our community and what is going to have the biggest impact over the long term for improving the behavioral health in the community. And so from that process, we prioritized these 6 recommendations. So the first one is to hire a health navigator position. And so this is, I'm going to go into the details a little bit more, but this is actually more than just a health navigator position. It would be part-time health navigator and then also a part-time facilitator of the Behavioral Health Collaborative, which is the top one in the second column. And that's putting together a group of stakeholders and community members in the community to really foster and guide the changes around behavioral health in our community, to help coordinate services, and also to bring in funding to support these, because we know that the county can't fund all of this work alone. That's not feasible. And there's a lot of funding out there to support this work. And so that would be one of the big keys there. We also wanted to move forward with a resource directory or hub to streamline the referral process and make it really obvious in the community for anybody that's needing any type of behavioral health support where they can get support. And so we wanted to make sure that folks that had different needs and wanted to engage in the system in a different way had access to the resources. So one would be this kind of high touch personal approach from the health navigator. One would be somebody that wanted to access the services themselves could access the hub. We also talked about wanting to launch a community awareness and stigma reduction campaign. There was conversations around how some folks in our community don't access services because of the stigma around accessing services, because of the ways that they may be viewed, especially in a small community, if they're known to be getting support. And so we wanted to address both kind of the systemic barriers and then the internalized barriers that people experience to accessing the help that they need. And the last two are kind of interconnected, and the advisory group felt that these were important, but also a little bit less of a priority than the other four. And these are expanding and diversifying service hours, and then also coordinating transportation to increase access. And so we were talking a minute ago about like when people need the services, they need them right now a lot of times. And sometimes people need services and they need them when they're not at work. And so this is really about making sure that people have access to the services that already exist by expanding the hours and by coordinating that transportation so that folks can get to and from the services.
Oh no, would you prefer questions as they come up or at the end?
Go ahead.
The last two feel like they would be really big wins. They feel like very wicked problems. When you say they're low on the priority list, is that because of the complexity and likelihood of success, or is it because you think these other things will move the needle more?
And this is the, again, the recommendations of the stakeholder group. So I want to remind everybody I'm speaking on behalf of the stakeholder group, not just for myself or for Omni. But generally, the stakeholder group felt like these other ones would have a bigger impact over the long term. And that these ones maybe felt like a little bit more of the low-hanging fruit, but that really the stakeholder group wanted to focus on these other four for that long-term impact.
Okay, thank you.
Yeah, great question. So now I'm going to dive a little bit deeper into each one of the recommendations. So the first one is hiring this health navigator position. And I'll just also like offer some additional context around these. So Omni has written a job description for this and has submitted it to the county. And I believe that is in process in the HR department of getting kind of formalized into the county structure. At this point, there is no funding to hire that position, but I just want to let you know that the process towards this position is already been started. And I did include that job description in the memo that I provided. And so the health navigator position, as I said before, is really intended to kind of hold two spaces. One is the health navigator. And so being out in the community, getting to know people, and really like being the person that people in the community and the county know that like, oh, something's coming up for me, something's coming up for a friend or a family member. This is the person that I can go to and they're going to know where I can get help. And so it's that direct service component with a friendly face, with somebody that's known and trusted in the community that we think is really important to the success of the health navigator position in addressing some of those direct needs in the community, those individual needs. The other component of this is the facilitation of the behavioral health collaborative and coordination within the county. This was something that the stakeholder group really felt was important and recognized that nobody in the group that we had the capacity to run this at this time. And so that's one of the reasons why we wanted to couple that into this health navigator position, that there would be somebody that is paid to facilitate this collaborative to help move some of the projects forward. And we know that collaboratives that are volunteer run are less effective than volunteers that have a paid facilitator. And so that's one of the reasons why we're kind of interweaving some of these recommendations to support the success of them. So the desired outcomes for this position are that there's a clear point of contact in the community for community members, for emergency services, for service providers, for friends and family, to come together to know where they can find the information they need to get folks help, and to help coordinate the long-term behavioral health system in our community in a collaborative way. Yeah, and like I said, this would support a lot of the other recommendations. So really, this position is intended to kind of be the champion of behavioral health within our community, both direct with community members and then on that systemic level. Any questions on this before I pop on to the next one?
Yeah, I might as well just ask now. One of the things in my mind as I've reflected on the navigator position since the recommendation came out, it could be possible that this navigator position could be like another step that folks end up needing to take, right? So yeah, right now I call JCMH, I get scheduled for an intake at some point I do. Is the behavioral health navigator doing something other than adding another step? Can you just describe a little bit about how they'll make it easier for people to access behavioral health services?
Yeah, and this came out of one of the recommendations or one of the challenges that we found in the needs assessment is that generally folks in the community don't know what services are available and don't know how to access them. And so this might feel like an additional step, but the intention is that it takes out the step of having to like get on the internet and figure out like where all of the services are and what's available and which ones do I qualify for and who's taking patients and what does my insurance pay for? I don't have insurance. What can I access? And it's also beyond just the like very clinical treatment. And so the idea would be is that this person could connect folks to say the food pantry or some of the other services that are available in the community based on what their specific needs are. And so folks that know they need to go to JCMH can still go to JCMH. It's not a requirement to go through the Health Navigator. It's just sort of this one-stop shop for getting the help you need and having a warm handoff to a service that's actually going to provide the help that you need, instead of like trying to find all these different places, running into barriers. And so that's the intent behind this.
Thank you for that excellent answer. I've been fully evangelized.
Thanks, George. So the next recommendation is to create this resource directory and hub. And so again, this is one of the ways that we wanted to meet the need in the community for disseminating information around what's available and what folks can get. But also, if somebody doesn't want to have to go talk to a human, then they have access to this on the internet. We do know that the Rec Center has developed the Mighty Networks Hub. And so this could be integrated into that. It could be supported as part of that. But again, this idea came kind of before the Mighty Networks Hub was launched. And so that's why it's presented as its own thing rather than as part of that. And one of the things that we feel like is really important for this is that there needs to be vetted and up-to-date information in it. We know oftentimes that when you put together a resource directory or a resource list, 2 weeks later, it's out of date. And so that would, again, be part of the role of the Health Navigator is to make sure that that information stays up to date, which would be a natural part of their job if they're accessing services for folks in the community. They'll know when things are changing and they can just pop that information in there. Yeah, and so I think I've talked about all the points on the slide. So are there any questions on this one? All right. So the next one is to launch a community awareness and stigma reduction campaign. And the idea is to build off some of the behavioral health stigma awareness that has been part of the COVID-19 process of us going through this pandemic together, and to create a unified message within our community to build some positive norms around behavioral health, to help folks recognize that they can get help, and to reduce the stigma around behavioral health needs. One of the challenges of this is that campaigns are typically pretty expensive. And we talked in the stakeholder group around how we can borrow or utilize some of the existing campaigns that are coming out from the state or nationwide to help minimize the cost of this. And then also making sure that this is a multi-platform. So it's not just on social media, but that there's also like word of mouth as part of this, that there's also physical flyers, that there's these other ways that this message is getting out. Are there any questions on this one? This one is a little bit less defined than some of the other ones, but I'd be happy to answer any questions. All right. So the next one is to build a collaborative funding and coordination structure. And the idea behind this one is to get the behavioral health stake providers, community members together to really coordinate the work, to share ideas, to share information so that everybody in the community that's in the behavioral health space knows what other folks are doing. And to really kind of organize the services that are provided in the community. One of the big benefits that I think would come out of this is that with this collaborative structure, with working together, then the county, this structure, these organizations would be better aligned to get grant funding, and especially some of the larger grant funding that can only be accessed through collaborative models, to begin to bring those resources into the community to support some of these recommendations, and then whatever work the stakeholder group, this collaborative group, decides to move forward. I think that this is really key to the long-term sustainability of behavioral health needs. I know that we have a little bit of money in the county right now from ARPA and from some of the COVID relief to move some of this forward, but that the resources of the county are not unlimited, and getting additional funding in is really essential to making sure that these services that the behavioral health needs in the community are continued to be met. And so some of the ideas around this were to meet quarterly, to have a paid facilitator, and to have some really clear like goals and trajectory for this to make sure that it is successful. Any questions on this one?
My question, I don't know if we have a good answer for it today. Actually, I think it's a broader question with all the recommendations that I'll just hold.
I will add that there was, before kind of my time in the community, there was a collaborative structure around behavioral health, and that was actually successful. And that has since diminished or kind of went out of existence. And so this would be part of something that we know to have been successful in our community in the past.
And I have a kind of a specific question about a couple of things I've heard about that I think I don't fully understand, but I think I'd rather wait till the end to hit those.
Okay.
Because they don't necessarily relate to this slide.
Okay, great. I've got the two more recommendations, and then we can do sort of the broad questions. So the next recommendation is to work on expanding and diversifying service hours. And an important part of this is to make sure that when we're looking at expanding and diversifying those service hours, and when I say diversify, we're talking about like doing telehealth or doing maybe peer support or doing some like other models, but is to make sure that it's really aligning the offerings of services with the needs of the community. And so we don't want to offer therapy appointments at 10 p.m. if nobody in the community wants those. But if there's people that do shift work and 10 p.m. is the time that they need it, then that's what we would want to discover and be able to offer those services at this time. And so the intention of this is that anybody who is seeking services could access them at a convenient time for them and in a convenient format. And then the next one is the transportation. And so this isn't necessarily like adding more transportation to the community, although that might be needed. The idea would be that we would be adjusting the transportation that exists to allow for folks to get to and from the services that they're going. So like, for example, if we're doing 10 p.m. therapy appointments and the bus stops at 6 p.m. and the person needs to ride the bus to get there, that's not going to work. And so this would be to coordinate the system so that things are working together and flowing so that it eases the process of people getting to and from the services. One of the other thoughts we had was to make sure that like bus drivers, folks that are in the system are aware, so that say they drop somebody off at the JCMH offices and they're going to the support group, the bus driver can be like, yes, you're going to go in this door and take a left or take a right. And that's where your services are. So to kind of provide some more of that kind of warmer handoff and just ease the process for everybody. So I can cover the next steps real quickly. So one of the intentions when we first started the stakeholder group was that there was going to also be a community input process around these recommendations that would be outside of this particular project. I'm not sure if that's still happening, but I think that would be a good next step, is to filter these through the community and get some additional community input on these. I also, obviously, all of these are going to take some level of funding and investment. And so obtaining the funding to move these recommendations forward is a high priority to make any of them happen. So there's a potential to use the ARPA dollars to fund the health navigator position, knowing that those funds are limited. It could potentially be a contract position that has an expiration date. That could be one way to move these forward. And then you all are the experts on how the county works, but I do know that you have strategic priorities. And so one of the other ways that you could incorporate these is to include them in the strategic priorities, so then they become an official part of what the county is moving forward to. And so that's the end of my presentation. So I'll go ahead and turn off the slideshow and we can have questions.
Yeah, I had the one that I had, and it's kind of a specific, interesting problem that's arisen, and I've heard about it from one therapist and talked about it with another, and I heard it was real. And it has to do with the availability of, Medicaid funding, and then the ability to find someone. Now, I'm aware that places like JCMH and others, there are different funding sources at different times that are allowable to get different kinds of help. And then there's also specialty kinds of help, someone who deals in childhood trauma and stuff like that, so they're few and far between. And not everyone takes Medicaid because they're not part of that system. Not everyone accepts it. And so you'll have that person that someone's been working with who's funded from one source, and they're ideal for that person and they've developed a relationship, but you can't get funding because the person is on Medicaid once they come out of, for example, a judicial system type source of funding. And so then they can even find a private source of funding, another family member that's willing to pay, that's got the money to help. And they're told that you can't pay for it with your private funds, because if a person is Medicaid eligible, they don't actually get, they won't allow, the law doesn't allow them to be able to accept that patient, even if it's paid from another source. That's one of the kinds of problems that people run into. And so they have to leave that person. And then because they need to leave that therapist and go into the system that will take Medicaid. And then once they're in the system, taking up to months to find someone that can be allocated to them that can help them. And those are the kinds of things where collaborating and finding different rules around the funding are going to have to be important. And even if it means that some funding gets moved from one operation into another operation, it's critical that we don't let those kind of funding rules, which are meant to preserve what that particular rule is meant to do, is induce more people to take Medicaid, to get the providers to take Medicaid, even though they're paid at a lower rate, even they're paid at a lower rate than it might be reimbursed through a system, through the larger system it does take them. So, I mean, those are the kinds of things that maybe you can speak to that. You know, my first thought is that can't be real, but then I've understood it and heard from enough sources that it is real to know that there's a real breakdown in how that money is allocated and who they're even allowed to take any. You know, when somebody's got the money and then they're not allowed to go in because the person they're paying for can't receive the care because they also have Medicaid. There's something broken, but the Medicaid systems can't find the person to give to them. There's something broken in the system.
Yeah, I hear you, Randy. What you're talking about is like these systemic issues that create more barriers than are needed for people to get the care that they need. And I think you're spot on with like calling out the collaborative structure. I think that's one of the best ways, the best tools that we have to create that systemic change. And while our collaborative here in Clear Creek isn't necessarily going to change the federal Medicaid rules by itself, we can create workarounds, we can create creative ways to support the folks that are in those situations, as well as advocating at those higher levels for needed changes that we see in the system.
So we're 5 minutes over, and I think that's fine. I don't think that our COVID update is going to take the full 30 minutes. But with that said, I feel like we probably ought to wrap up this conversation in the next 5 minutes. And George, I know you were holding on to a comment you wanted to provide.
Yeah, thanks. Obviously, we're going to need to take this back up as a board in a future meeting to, you know, arrive at some outcomes in some direction. The question that I have that I'll just not ask for an answer for, I think it's most appropriately directed at staff and probably on your mind too, which is how do we get the work done between here and hiring somebody to do the work? And do we have confidence that we can accomplish that, or do you need something from this board in the interim? Maybe that's a question to kick off a work session in a future meeting. And then I just to share kind of my perspective on these recommendations. I welcome them. I'm grateful for the efforts of everyone in the community that participated in this process. I've got a lot of optimism about the future. I'm very interested in using ARPA money to seed this. And I think that we can find other resources to leverage as well. I know that the state has a collaborative management program that funds basically the work we've been doing. I also know there's a behavioral health disparities or just a health disparities grant that's out there that the cycle is coming up in the next couple months. And sorry, Sean, I'm kind of filibustering here. Another couple of thoughts that I wrote down. Related to the behavioral health navigation, I would really like to see if Gilpin County wants to share this service. I think we might better employ a full FTE if we take 9,000 people and add 4,500 people roughly to that in the service area. And I just think in general, there's a lot of opportunity for us to build a workable mental health system in collaboration with Gilpin. The other thing that I want us to think about is whether this behavioral health navigator position can utilize and support the community connectors program that emerged during the pandemic. This is a group of volunteers that basically try to understand the resources that are out there and help connect neighbors to those resources. I think the Boulder model is kind of very similar to what I'm talking about. They have paid staff that coordinates and utilizes local community members. And so that's the end of my thoughts on this. And thank you.
Yeah, I'll just respond two ways. One is that I'm available to continue to provide information in a work session or any in between meetings as would be helpful for you all. And the community connectors was a big part of our conversation as a stakeholder group. I didn't mention it today because there's far too many details to include from the whole process. But a big part of the health navigator position would be to partner with and support the community connectors. And so a lot of these recommendations, like I said, are really built on the strengths of our community, and I wasn't able to communicate the detail and nuance of that, but that the intention to support the community connectors is in there.
Yeah, and I'll make just a brief observation, which is I think it's always good to take a step back and to view a problem fresh, as we have done here. The thing that I'm a little bit confused about, and maybe it's just my confusion, is we just had a good conversation with JCMH, who mentioned that they have a staffing challenge and they have resources to fund positions. And it seems like a lot of what we're talking about here perhaps falls squarely in the wheelhouse of JCMH. So I'm a little bit cautious about us inventing a new role outside of existing relationships and funding sources, if there's a way to do it more efficiently and smarter. And George talked about collaborating with Gilpin. Well, we're already collaborating with Gilpin by virtue of our membership or association with JCMH. So that's one thing that I would like to understand better in the future, is to what degree are we potentially reinventing a wheel here that we don't need to? Is there
that's definitely something that we talked about in our conversation, Sean, and kind of going back and forth between where does this position live? And there were a number of reasons for housing this person at the county versus JCMH. And part of it is that there's potentially funding at the county right now, and that the perception in the community that wanting this person to be very local, and that sometimes, not necessarily saying this is actually the case, but there's a perception in the community that JCMH is outside of the community. And so having that person feel really in the community felt important, at least to begin with. We did talk about some potential models in the future, or ideas for the future, that starting with this person at the county and then eventually transitioning them to be on at JCMH for kind of the long term, and also knowing that JCMH can support Medicaid reimbursement, which could help provide some additional sustainable funding for that position. And also knowing that JCMH is a partner in all of this, and that they also don't have the capacity or the people, like you said, to run all of these things in the community as well. So I appreciate you bringing that up. And that was definitely a big part of our discussion as we came up with these recommendations.
Okay, thanks. Any final words from you, Randy or George? Or are we ready to move on to our COVID update? Okay, thank you so much for educating us and keeping us abreast of this. Like I said, I think it's always great to have a fresh look at things, and I appreciate the recommendations. And yeah, my only question is, what's the smartest way to implement them?
Yep. Awesome. Great. Well, thank you all so much. And like I said, feel free to reach out to me for any reason. I'm available.
Perfect. All right, Dr. Ryan. COVID update, part 153 or whatever we're at now.
Right, let's start with the numbers then. US trend, 74.3 plus million confirmed cases across US to date. Case rate currently is at 523, approximately 1,000 per day as a 7-day average. Hospitalizations over the last week have decreased 4% across the country as a 7-day average. Fatalities, we continue to lose Americans. 884,000 plus deaths occurred so far, a current rate of 25-26 per day. 2-week test positivity rate across the country is at 21.2%. Contributing factors to the spread are the unvaccinated and Omicron. Vaccination rate across the country, fully vaccinated, we're at 64% and 76% with 1 dose. Here in Colorado, current number of daily cases is now in excess of 8,424 per day as a 7-day average. Our 2-week cumulative incident rate is at 2,215 per 100,000. Hospitalizations, currently 63% of those hospitalized are among the unvaccinated, 90% of ICU beds currently in use. We currently have over 1,400 individuals hospitalized across the states with confirmed COVID. Our 2-week test positivity rate in the state is at 21% as well. Contributing factors to the spread, the same as nationally, the unvaccinated and Omicron, a major driver in this. Vaccine rate here in the state of Colorado, we're at 80.4% with 1 dose or more, and fully immunized at 72% across the state. Here in Clear Creek County, case counts over the last 7 days, although testing was canceled 2 of the 3 days last week. We had 48 cases in the last 7 days, 117 in the last 2 weeks. We currently have 12 active cases. Hospitalizations, we've seen 2 additional ones over the last week, we're now at 59, 10 fatalities. Our 2-week cumulative incident rate is at 1,245 per 100,000. Test positivity rate here in the county is 19.1%. Contributing factors the same as statewide and nationally. Testing updates, we have testing today and Thursday, hopefully won't get canceled due to the snow. In Idaho Springs and Georgetown was yesterday. That will continue for the next, at least through March. Vaccine update, no change on that front. Any questions on any of that? So we continue to see a steady decline, although we're coming from a very, very high point. So the decline is obviously welcome news. It may take a few weeks for us to get back to where we were even pre-Delta in a state where we can resume normal life, if you will.
Hey, Tim, I have a question came in on the chat from Sandy from the school district board. How can we frame the future for families and students in the school district, both short and long term?
Well, school districts continue to be a point of challenge. As Gilpin County just indicated, they removed their mask mandate for the county, but kept in place the mask mandate for schools and municipal buildings, primarily because it's a 5-day-a-week, 7 hours a day, very close exposure to the same cohort. We're going to continue to do what we're doing there. It has worked, and the proof is in the pudding. Over the last 2 school years, we haven't had a single day of remote learning other than the 2 prescribed weeks that we've had last year. The primary goal for the schools is to keep kids in school, to keep them educated. They learn the best while they're in school. And, you know, what does the future look like? I wish I could tell you. I don't know that there's anybody on planet Earth who could tell you that beyond the next several weeks. So I am hopeful. I'm hopeful that the spring, both for the county and for the school district, looks a little bit different. It's hard to say at this point what that's going to look like.
Sandy has another question down there, Sean, I see. Maybe we can guess.
Myself. Yeah, her following question is, can we maybe guess, since it's now endemic, that we can have a level of seasonality? I assume she means with COVID, of course.
Yeah. I don't think it is endemic. The basic definition of endemacy is that it is not disruptive to society. I don't think we're there yet. I think we're headed there for certain. When you combine both the vaccine rate in this country along with the rate of infection, in particular with Omicron, we're now reaching that level of herd immunity or community immunity that's necessary to provide us that endemic state of being. We're not quite there yet. I wish I could say that we were. It isn't my opinion, it is the opinion of the scientific community, epidemiologists and public health officials across the entire country. We're not quite to that point yet. When we reach that point, to Sandy's question, yes, we will return to a level of normalcy. Children will not need to wear masks anymore. But remember, in order to go to school now, there is a whole host and series of vaccines that are required for you to go to school. That's the endemic state in which we live, right? Measles, mumps, rubella, varicella, the list goes on and on. Those vaccines are required to maintain that level of endemic state of those diseases. If we don't collectively get there as a society that is the same for COVID, COVID will continue to be incredibly disruptive, not only to our business community, but also to schools moving forward.
Yeah, and then I'm seeing a question about the mask mandate, and maybe now is a good time to just, Dr. Ryan, get your thoughts. I know some of our neighbors are allowing their mask mandates to expire. When we put our mask mandate in place, we did not put an expiration date on it. And I know that we, for everyone out there, we're not going to be able to take any action today, even if we wanted to. There's a period of 24 hours that we need to notice a special meeting in order to put a different public health order in place. So with all that said, Dr. Ryan, would you mind commenting on your thoughts around our mask mandate and its continued appropriateness or inappropriateness going forward?
Yeah, absolutely. So obviously, as I stated in the numbers, we continue to see steady declines across not only this country, but the state in our community. I think that's a good indication of where we're headed. Mask mandate was intended to slow the transmission of what we knew as a highly transmissible virus and variant in the form of Omicron. I think we were successful in that. Hospitalizations did not exceed capacity, which is good for all of us. And we're approaching that level where that risk is no longer real, meaning even if the remaining 20 or 30% of the community and state were to get COVID in the next several weeks, it wouldn't push it past that hospital threshold that we've been concerned about for quite some time. Having said that, those who wear masks are going to continue to wear masks, public health order or not. Those who are interested in their own protection are going to continue to do that. And those who don't wear masks, public health order or not, aren't going to wear masks and have shown that to be true over the last several weeks and months. So having said that, do I think the mask mandate was effective? I do. Do I think it's losing its effectiveness? I also think that as well for reasons I just stated. So that decision is really up to the three of you. I think waiting a week or two would be best from a public health perspective, but I also understand the need for sort of moving on and for individuals to be able to make their own decision in public places. I have spoken both to the leadership team in this county and the school district as well, and they are both interested in maintaining a mandate within those two entities for reasons that we can talk about. But I think from a broader perspective in the public and the business realm, I think, as I said, the mask mandate is losing its effectiveness in terms of slowing transmission and preventing what we were most concerned about.
Randy, George, do you guys have any questions?
Yeah, can you clarify, you said that the county leadership team would like to see a mask order. Was that for county buildings? Was that for general public in county buildings, or is that more of like an HR policy for our staff?
That was a internal policy for how we operate in our county facilities, in our county buildings. We just had one of our very public facing offices have a positive test that potentially, and then interacting with staff and with the public just last Friday, that potentially could have shut down that entire office. Luckily, it has not. So I think for the next couple of weeks, we will keep the mask requirement for being indoors, not unable to social distance, providing services inside county facilities, et cetera. The leadership team had a pretty extensive conversation about that, and there was no objection. They're actually they are advocating for keeping the masks.
And is that with respect to the public as well?
No, it's just for staff. We've not been enforcing that for public. I think most of the public sees us in masks and they put one on, but we've not been proactively enforcing it for the public, only for staff.
Okay, thank you.
So no signage for public or anything like that, so.
Well, we have signage up right now due to the mask mandate that's in place. But at the same time, you know,
Yeah.
as Dr. Ryan indicated, not everyone's following the policy.
Right, right. Most people wear them. I know when we do have a mask mandate and the signs are up, obviously more people wear masks than don't. Which tells me that I seldom have I seldom have disagreement with Tim about anything. The only thing I would say is that to say the people that will wear masks will keep wearing them and those that don't. The fact that I see that change with mask mandates and signs tells me there's some flex in between those two numbers, but generally I agree with you.
Sure. Yeah, I would agree with that. I don't, it's not a 1-for-1.
You can see it in the buildings and it goes up and down without the mask. I was surprised that for a while there's Safeway. I went into Safeway several times and it was almost 100%. Like I'd see like 30 or 40 people in there and everyone had a mask on. I was kind of shocked. Not too long
Anymore.
but our ordering place, but it was not every day. That's for sure.
I'm also sensitive to the difficulty that businesses are having with enforcement at this point. It's sort of a diminishing return rapidly. Clearly businesses, I would advocate that businesses continue to wear masks and their employees wear masks. To Brian's point, one case among employees if there's only 3 or 4 employees, suddenly you have no employees because they're all out sick. I would strongly encourage that. But as far as enforcement of patrons who come into a restaurant or store or whatever, I know it's increasingly difficult to do that, particularly at the ski resorts where it's beginning to get to a free for all and.
Yeah, and particularly I think I know that Loveland has actually been actively enforcing. They go around and tell people to put their mask on, but they're one of the few employers in the county that does. And I certainly understand the difficulty, and I'm surprised to almost see them tackling that, and taking it on. But they've been really good players throughout this thing. Whatever they're supposed to do, they do. Yeah, I think. Well, anyway, I don't know what I had something else, but it slipped.
Tim, could you give us a quick overview of, I know Tri-County, Denver, Jeffco, I'm not sure what Summit County is up to, but my understanding is that most of these, or at least some of them, are expiring on Thursday, right? February 3rd.
Jeffco's taking it up on Thursday, and Summit actually canceled their mask order last week.
Yeah, Denver's expires on the 3rd, I think, Wednesday. Jeffco has not done anything yet. Gilpin just rescinded theirs yesterday, but kept in place schools and municipal buildings, but rescinded it otherwise. So we'll see what comes of Jeffco. I've reached out to the public health director there and haven't heard back from her yet, but.
Okay, so I think, that's the other piece of this, right? Which is that we can't be effective with a mask order as the only ones doing it. But the broader, that's not my motivation. My motivation is the same motivation. We have access to the same data that those other public health departments have. We've seen that hospital rates are declining. We saw in the news that hospital systems had asked for increased crisis of care standards and then rescinded that ask in the last couple of weeks, saying perhaps we've gone through the crisis now. And then the CU School of Public Health released their modeling, and everybody's citing this as their reason. The modeling basically states that even in the worst scenarios of transmission control, which is a measure of how many people are wearing masks and how far they're traveling around, even in those worst case scenarios, the modeling does not show that we will overwhelm hospitals. And so in that case, I know that on this board, we've always said that we want to make sure that our people have access to high quality medical care when they need it. I know we're still currently in a crisis standards of care for staffing in hospitals, and we're still in a crisis standards of care for EMS. And I'd love to hear about how that's affecting our EMS department. So it's not like we're out of the woods. And one of my fears is we drop the mask mandate and we see behavior change, and we do worse on transmission control than the model thinks, right? So my message to anyone listening is I do support removing the mask mandate. I support getting on a calendar to do it sometime this week. And I hope that comes along, that people hear that along with an exhortation to, play it careful over at least the next couple of weeks, because we still are at a very high infection rate.
Absolutely. I couldn't agree more. That's why I started by saying I think it is a little premature, but understanding all of the other variables that go into this, it is what it is. But to your point, yes, I will be obviously watching the numbers carefully. As quick as we go down, we can go right back up. There is still a large segment of the population who is neither vaccinated nor has had a prior diagnosis of COVID. So there is still plenty of people out there for the virus to transmit and to be replicating in, but we'll keep an eye on that, obviously.
Thanks. We're coming up on the bottom of the hour, and I'll just say that I agree with George. I think it's time for us to lift the mask mandate. I'm interested to talk more about what's happening in our school district, but I don't think that we necessarily have time for that right now, or we need to. But Randy, are you in agreement that we?
I think so.
could
I don't,
possibly
when I saw that Jeffco was taking it up, and when I saw Denver and Douglas and I think, they were already down, Arapahoe and Adams. That had some impact, but I thought about our contiguous neighbors, and so I checked on Jeffco and Summit and saw what was going on. Summit had already slipped by me without me noticing, and Jeffco was taking it up Thursday. I don't see much point in going on beyond that. I think the admonition is the same. Smart people will wear masks when they go in a public place, unless they're putting something in their mouth and eating. And particularly, a person that goes into a place and is in there for a while and leaves is one thing, and sits at a table socially distanced from everyone else. Waitrons and people that are in a building serving others for several hours or a lot of hours sometimes, and have potentially up to a few hundred people through that building, are a totally different thing. And you can lose your workforce in a heartbeat, like Tim said. You're much more likely to catch it coming in contact with that many people, and that's with the workforce is really challenged as it is right now, the supply.
Yeah. So, Brian, is it possible for us to get this on the calendar? I mean, we don't necessarily need to do the calendar conversation in terms of figuring out the times, but we can maybe do that at some point today to potentially carve off a half hour on Thursday.
Sure.
The only benefit, Sean, and it's your prerogative, the only benefit of figuring out a time right now is that anybody that's listening will know that time.
Yeah, I'm fine with that. Let me just look at my own calendar while we're having this conversation. I'm pretty much available anytime except between 1 and 2 on Thursday, February 3rd.
That's funny.
Can I just clarify what the board is looking to do in terms of, is this going to be a special Board of Health meeting to consider a resolution rescinding the mask mandate?
I believe so.
Correct.
Are there any elements that we wish to keep for any reason? That's the only thing I thought.
What we would do is similar to the last time we rescinded the face coverings requirement, was to leave in place the requirement that businesses cooperate with contact tracing. I don't know that our division is currently able to even handle contact tracing in light of all the other things that they're doing, although I believe that the nursing staff is doing that. But we were going to leave that in place if Dr. Ryan recommends it.
Yeah, and I see that the expectation is that I just received a message that said the expectation for Jeffco is that they're probably going to follow Denver and Tri-County and drop the overall mask order, but keep it for schools is what they're doing.
Yeah, as Gilpin did yesterday.
So what I wanted to just make sure is that we have a resolution ready so that it can be placed on an agenda within 24 hours of the meeting.
Yep.
Does Thursday give you enough time, Peter and Tim?
It does.
Yeah.
Thursday for me, I'm open until 11 a.m. and I am open from about 1:30 to 3:30, which doesn't work quite as well for Sean. You said 1 to 2. Is that 1 to 2?
Yeah. I mean, can we just do it at 8:30 or 9, or kind of when we generally start meetings, and just get it out of the way, get it done?
How about 9 o'clock, since I know that Brian and I have a different related meeting from 8 to 9. So if we could do 9, that would be great.
Does that work for you, Tim?
Yeah. I'm up at 5, so.
Okay.
I don't go to bed.
All right. Well, thanks, Tim. Thanks, everybody. I see we've got Brian Banks from the Forest Service. We can just roll into our next agenda item a couple minutes late.
Sean, just real quick before we get off of that, since you said it, you said you're interested in talking about schools. I am as well. I'm interested in just looking at the testing and the masking and trying to understand what we're getting out of it, and just taking a look at how the context has changed in a more transmissible, less deadly variant.
Yep. Perfect.
Is the board
Would that-
expected to take any action?
Would that be something that we would want to amend to add if the surrounding counties do that?
I was not asking to put that on the agenda on Thursday.
Okay.
I'm asking that we proceed with that conversation in a future meeting.
Yeah, no, I agree with that. I'm wondering about the effectiveness of the testing mandates, but we can talk about that sometime soon. All right. Now it's really on to you, Mr. Banks.
Good morning. Good to see you all. It's been a little while since I visited with all of you. For those of you who don't know me, my name is Brian Banks. I'm the district ranger on the South Platte Ranger District. I understand I'm on a bit of a compressed time frame, so I'm going to go through this pretty quick. Sounds like you all have a lot on your plate. So
nice to see you, Brian, by the way.
Thank you, Randy. You as well.
Yeah,
is it possible?
11.
Is it possible for me to share my screen? Okay,
Mhm.
cool. Let me see if I can find the right one. Okay, I think this is it. Okay, I'm going to go through this quick, folks. Can you all see that?
Mhm.
Excellent. Okay. So for a little bit of background, this is the Pike National Forest, and the South Platte Ranger District is in pink here, the upper right quadrant. And that little sliver of blue at the very north end is Clear Creek County. So we have a very small footprint in terms of geographic area, but the area that you all share with me is very, very busy. This is a recent article that was published that analyzed who was recreating, who stopped, and who continued to participate in outdoor recreation during the COVID-19 pandemic. I don't think I need to tell you all what you've already observed, I'm sure, which is we have had a huge increase in the amount of outdoor recreation due to the pandemic. This particular study likened it to a 135% increase in hiking. That's not to say that that was the effect everywhere, but certainly I can think of places on your county where that is absolutely true. It also went on to kind of break down some of the geographic and socioeconomic characteristics of those users. And the study, found that this new increase in users tended to be more females, generally younger, and near urban areas. They also talked a little bit more about some of the barriers to access in some of those underserved lower socioeconomic brackets, and talked about some strategies on how land managers like myself can really reach out to those underserved populations. The reason I am bringing this up, though, is sort of a precursor to the discussion of this area on Clear Creek County, that on my district, Mount Bierstadt. And I know I've talked to you all about this before. This is a zoom in of that portion of Clear Creek County that is on South Platte. And as you can see, you know, we have Guanella Pass going over there, the pass there. It's interesting because the forest boundary between the Arapahoe Roosevelt and the PSICC is right on that top boundary as well. And so the Arapahoe Roosevelt actually manages the parking areas for Mount Bierstadt, but the South Platte manages the mountain itself. So it takes a lot of coordination with both the Clear Creek Ranger District and the South Platte Ranger District to manage this area because it is somewhat fractured in an inconvenient way. We've actually even talked about possibly adjusting the forest boundary. And I would give Scott Mount Evans and he would give me the top of the pass and we would just do a swap. So we'll see how far that conversation goes because that would essentially need an act of Congress. But for this conversation, the reason I'm bringing this up is, you know, this has always been a struggle for us to manage the numbers of visitation. You know, these are some of the estimates in visitor use that we have been tracking over the last several years. And in 2020, we almost eclipsed 40,000 visitors. And, you know, this is a problem that is not unique to Mount Bierstadt. I know you're struggling with the same issue on grazing Tories and other 14ers. What makes Bierstadt a little bit different, though, is that it's in wilderness. And so the number of people are not only creating a significant amount of resource damage, but it's also affecting the wilderness character, which is something that I, as a land manager, am bound to preserve. So we've had conversations in the past over some potential ideas of how we might, you know, skin this cat, if you will. I'm not really interested in getting into those details on this meeting, but what I wanted to bring to your awareness is one of the tools that I'm considering using in my tool belt this year is we have a district-wide mud season closure order that we use every year. The intent of it is to preserve trails by closing them when it's inappropriate to be hiking on them. When trails are wet, that is when they are most susceptible to soil compaction, damage, as well as widening. The idea is, you know, if you have a muddy trail, you're supposed to walk through the puddle. Most people, A, don't know that, and B, don't want to do that. So they step around the puddle. And the next thing you know, you have a 2-foot wide trail that turns into a 60-foot wide trail, which is what we are seeing in some sections of the Mount Bierstadt Trail. So this is, you know, we included Bierstadt this year in our list of mud season closure trails for the forest order. I have yet to actually do the closure, but I did include it in that list of trails on South Platte. And so I'm reaching out to you all today to let you know that first and foremost, and B, to also kind of update you. This is just in concept right now. It's something that I should be managing better, that I would like to implement at some point, but I have not yet figured out an enforcement plan that would allow me to actually do it on the ground. But mostly just broaching the conversation with you all. So if I were to figure out a way to enforce this, it would not come to a surprise, because I don't like giving surprises or being surprised. And I'm sure you are in the same boat. So just on that note, do any of you have any questions regarding that?
I have 2 questions. One of them is, what are the proposed dates of the mud closure? And then the second one is, are you considering tools such as essentially closing the parking lots as a way to, I mean, what are you thinking about in terms of, because if the trails are closed, it would seem like there would be no real legitimate premise for parking your car up there.
There are other trails that can be accessed from those parking
like square
lots.
tops.
Yeah, square tops, exactly.
Okay.
And you know, there is something to be said just for being up there and enjoying the views if you wanted to go on a Sunday drive. Again, I haven't gotten that far. Those are good questions. I would seriously doubt we would close the parking lots, just to be honest, but I haven't figured that part out. In terms of the dates, the way the forest order reads is it's condition based. And so it really depends on if the trails are wet. And typically what we do is, for instance, the whole Rampart Range, we use this order to keep closed until the conditions are right to preserve the roads and the trails. So it would really be a matter of whenever the trail dried out to our satisfaction, and that's when we would open it up. We don't flip flop. It's not one of those things where we're going to close it for a week and then reopen it. It's really just opening it for the start of the season and potentially delaying that opening until the conditions would be right, such that we wouldn't be creating more damage. Does that help?
It does. And are you imagining delaying the opening until past Memorial Day, when the road will be accessible from Clear Creek's side, when Guanella Pass will be plowed and open?
If we were to go this route, I think yes, because right now, when the gates are closed, there's not enough of volume of people for it to be an issue. It's when we open the gates and folks are up there, and if it's a muddy mess and we decide we want to keep it closed for an extra week to let things dry out, that's kind of how I see it playing out. But again, without an enforcement plan, I don't foresee this. I would be surprised if we were able to pull it off this season. I'll just put it that way. I'm not ruling it out, but I would be surprised. And what I would commit to you is, if we did find it some sort of mechanism to have a presence up there to, dissuade the public from accessing the trail and to really educate them on why it was closed, I would certainly come to you and share that with you before we move forward with any plans.
Okay. Well, I mean, just speaking for myself, I think that sounds reasonable, and I think I personally would want to cooperate with the Forest Service in helping you accomplish your mission. But with that said, maybe George and Randy want to weigh in or have some questions for you, Brian.
Well, the collaborative side of it is going to be pretty important. Obviously, I'm sure you'll be talking even more with Scott than you will be with us, and that's understood. We have, as you know, frequent collaboration with them through NOCO. And I know that the problem on Bierstadt is the geology there is not great for being able to, it's almost like to harden trails and get past that. The problem that you're talking about, you pretty well have to import the material to do that. And that's pretty tough in a wilderness area. I have a question about your biggest day, and then another comment, or then another question that follows that. What's the, I know that I see, 40,000 a year. What do you think is the biggest day you've seen up there?
In terms of numbers per day?
In one day?
I think our estimates are around 1,000.
That's kind of what I expected on your biggest days. Because it's a week, that's obviously weekends, and there's only so many weekend days, and spreading 40,000 over that, although you see a lot of people during the week. With regard to the parking lot, the problem I can see is that we know what happens when you build parking lots, the unintended consequences of that, which is you incentivize behavior, and once that behavior begins, and closing the park, we have more parking on the road than we had before we built the parking lots. And that happened very quickly, because once people learned there were parking lots, more people came up. And once they drove that far, they weren't going to drive back down. So we ended up with more people immediately on the road as soon as the parking lots opened. And it was just that behavior. So closing the parking lot now we've conditioned a whole lot of people to expect what's up there. So that would probably just force even more people onto the road, is my guess, is why that would be difficult. The discussions we've been having in NOCO with Scott and Aaron and Monty, Aaron said recently, the experiences that we've had, one of our pilots is a timed entry pilot, and we're really putting timed entry reservation together because, the idea of the pilots is to learn enough from Rocky Mountain National Park and Mount Evans and the different places to figure some ways to scale them down as we begin to bring them down to point load hotspots in different places, and come down to an area where the county and Forest Service can collaborate on a certain spot they agree on that we want to do something. And we move reservation in with timed entry, because obviously timed entry systems are a little more technical in nature and require more there's just a lot more administration and maintenance to running them than just a straight reservation system on an honor system. Because when, enforcement, if you don't have a gate on a timed entry system, is almost impossible. Aaron said recently, and Aaron Mayville is the deputy director of the ARP under Monty. He said at one of our exec committee meetings that the work that we had done and what we've seen in the last few years studying it, that he felt that for our region along the Front Range, that timed entry reservation was really the wave of the future, and it will only increase. It's impossible for that not to happen in the near future. Bierstadt, between Bierstadt, Grays, Torreys, and Quandary, I think those are the four most heavily visited mountains in the state, if you don't count Mount Evans and all the people in the cars. And I think Quandary only took over from Bierstadt probably because we had a closure on Guanella that lasted longer than usual. And I think that's the reason Quandary moved up. So with Bierstadt being the most heavily traveled mountain in the state with such geological instability to the resources there, the trail, the infrastructure, and with that being the wave of the future for the Front Range around the metro area, do you perceive, obviously that's not happening this year, but do you perceive that in the fairly near future?
I do. Yeah, I think you're talking long-term solution, Randy, which I'm all about, and we need to be tracking that direction. Like you said, the parking lots that were originally intended with the numbers that we thought were sustainable in mind. And the problem, as you so poignantly pointed out, is that people park on the road, which is illegal. The other issue is that we don't have the capacity to enforce that parking. And that is another area that we could focus potentially resources, but I understand that, resources are thin universally. And we even, proposed a few years ago, I don't know if you remember, Randy, the idea of the county taking over the lots as a concessionaire and potentially charging a fee that would then pay for officers to enforce the parking. But, I really don't care how we come about. My desire is a sustainable in-state, right? That's my goal. And so I think what you're talking about and Aaron is talking about, and he has a ton of experience in this arena, sounds fantastic to me. And that is definitely something I'd be interested in. And so, in short, I think we need multiple irons in the fire. This mud season closure may help with some of the short-term stuff till we get through that process. That would be a environmental assessment at the least that we would have to go through, which could take a couple of years. But certainly, I think that given the numbers and given the amount of growth we've sustained the last 2 years, the time has never been more urgent than right now for us to start thinking about that longer term solution.
I saw George unmuted. I would just say really quickly that I think that I say it as a joke and it's a made up number, but it's just kind of a guesstimate from looking at what we saw happen there once those parking lot were opened and the road was improved and it was all, that capacity was set there. It was like we had almost no parking and X number of people on the road. So we built a parking lot equal to X number of people, and we ended up with X number of people in the parking lot and 2X number of people on the road immediately, just because of that attraction. You laid out the welcome mat and they don't want to turn around when they get there.
Yeah.
Randy, you did a really good job. Well, and Brian, just describing why we need to do this, what the challenges we face are. I'm in support of this. It's unfortunate. And maybe I apologize if you already stated this and I missed it. Does anything in this decision give you options to make closures due to weather events in season? Like if I'm just remembering, it was actually on Guanella Pass where we had the ground became so saturated that it caused a retaining wall of ours to fail. And so is that part of what you're thinking or part of your intention here?
It wasn't, but certainly I would have the authority with the order, the way it reads, to do that because it is condition based. So if we can demonstrate that in fact the soils are saturated and unstable, we could absolutely implement it using the forest order as it's written. So we could. Typically, we don't do it that way because, you know, it takes a lot for the, you know, to swing gates and to do all the things you need to do and to get the public on board. And, you know, but in the example you cited, and some sort of, you know, big event, yeah, we absolutely could use it for that purpose.
I appreciate the restraint you're expressing. I don't think that would be, that's a much heavier decision than like a pre-announced seasonal closure, right?
Yeah, it's not like, oh, we're getting rain on Wednesday, let's shut her down. But yeah, so no, this is great discussion. I'm really impressed, first of all, Randy, with your summary, because you know, we've been talking about this for a number of years, and some of the strategies that you've laid out are really on the cutting edge of ideas that we have been kind of kicking around for this problem. And so I'm really encouraged to hear that you are all as up to speed as you are, and that you would support, you know, moving forward with both short-term and long-term steps to, you know, to restore the environment, but also to protect the investment that's already up there, that's unraveling, quite frankly.
Yeah, I think I'm old and I forget a lot, but as we've been sitting in NOCO now for about 3 years, and we went through our core topic series, and George attended a bunch of that. Amy Saxon attended most of them as well, and she's been involved on some of the subcommittees on our staff, and we're planning to engage pretty soon on our recreational outdoor management plan, and it's to be informed by NOCO is really a tremendous, I think, I'm really proud of it, has been a tremendous force. One of the first questions I asked is, why aren't we bringing Pike in? And it became to that size of the room kind of a thing, you know, where you bring in all these stakeholders for such a much larger area. And we thought we were tackling such a gigantic thing, and it has been. It's because of COVID, it's moved a little slower, and because we added in. It's really interesting. There's only a few minutes left here, but one of the really interesting things that came out of NOCO at the beginning was when we got in the room and started arguing about things we disagreed on, we immediately began to educate each other, both locally and user groups, industry, and Forest Service managers and CPW, and suddenly realized that we all had a lot to learn, and went into a year of these core topics of talking about everything from fire danger to climate change to forest health to equity, diversity, and inclusivity in the woods, you know, that's kind of pointed out in one of your slides, and really taught us a lot. And I think we're getting ready to embark on a few pilots and see it start to kick into gear over the next couple of years. And certainly we should be collaborating with you and sharing all of that and hearing your thoughts too about what we're doing at some interchange, even though it wasn't officially, you know, we decided that was too large of a landscape to try to pull it, you know, Wyoming all the way down to, you know, Pueblo almost or something, you know, it was just getting too large. So we decided to focus on that area on the eastern slope, which surrounds Denver. And it's been an unbelievably rewarding and educational. It was kind of like I went back to college or something for me to hang out with a bunch of Forest Service people for the last 3 years on that.
Well, the way you talk, if I had to guess, I thought you'd be bleeding green right now, Randy. So good on you for listening. Real quick, if I may switch gears really fast, I also just wanted to give you a heads up. You may have seen the announcement, but recently the Department of Agriculture announced that they were going to be investing $3 billion in wildfire mitigation. And they cited 4 different geographic areas: one, the Pacific Northwest, the Sierra Nevadas, the Southwest, and then Colorado Front Range, which is, you know, squarely on South Platte. We are really having some conversations internally. What are we going to do to ramp up to meet this challenge? I know the ARP is having those same conversations. But just so you know, we're really looking to increase the pace and scale of our forest restoration activities, which is going to include every tool in the toolbox, from mechanical thinning to prescribed fire. And on the South Platte, not only are we moving forward with several treatments that aren't on Clear Creek, but are in the neighborhood, if you will. We have fuels work we're doing in Harris Park, which is just down the hill a little ways, Bailey area. I'm also having some conversations with the Colorado State Forest Service about doing some good neighbor agreements in Staunton State Park, which is right on the edge there, as well as in the Deer Creek near Harris Park. So we are really looking for opportunities where we can do those cross-boundary treatments, treating on both private and federal side. And I was working with Nate Beckman quite closely until he took another position, but I'll be tying in with his replacement and really looking at getting some projects that are going to be on that, right on that boundary between Clear Creek Ranger District, South Platte, and with the intent of creating landscape scale restoration treatments that are going to actually make a meaningful difference in fire behavior. That's the goal. More to come. Good news. We've been saying for years we needed more help, and well, it's here. So now it's time for us to act. And so I'd be happy to talk more, maybe at a later date. I could talk a little bit about the landscape scale NEPA that I'm planning on to take advantage of some of this stuff. But just know that, there's a lot of work and conversations on the restoration piece of this too.
Brian, something for us to follow up on the side since we're out of time. I have a goal for us to, and I know I'm not the only one, for us to ask the voters about having local revenues to do wildfire mitigation and planning. I would be really interested to hear from you how you think the presence of a local partner with resources helps your efforts at the landscape level. I don't know that now is the right time to answer that, but it's a question on my mind.
In short, it would be tremendous. So we have been working with what's called the Upper South Platte Partnership for quite some time. It's a collaboration of federal, state, local agencies. And for the last 5 years, the majority of the treatments we've been able to do have been on federal land because we just cannot find the funding for the state. NRCS has Good Neighbor, or not Good Neighbor, excuse me, the EQIP program. There are limited pots of money for those types of activities, but they are so few and far between. Recently, this co-swap that's being put on by DNR is a tremendous opportunity that is going to bear some fruit, but we need more of that. And yes, answer, it would be amazing to have a voter referendum to create some revenue to help offset the costs on private lands, because the private lands that's where we need these fire adaptive communities, right? We used to talk defensible space. That's 1990s language. Now we need fire adaptive communities where everybody is putting their defensible spaces together to create fire adapted communities. And we've all seen what happened in Paradise and now in Marshall Fire. It's terrifying, and we really need to treat it like the problem that it is, which is it should be number one on all of our priorities.
I know that state and I believe federal funds are beginning to look at, everything from building codes, fire preventive building codes, a different type of preventive, defensive space, seeing, there's lessons learned from the Marshall Fire on that, where things happened nobody thought they'd ever see. But I know at the state level, there's a lot of talk about creating legislation to help those who help themselves. And what it means is those places that are willing to make the changes in their regulations and willing to put a few bucks up locally, even as little as they can afford, through some kind of a measure to fund local efforts. Locally funded efforts are those that may be more likely to receive the state aid, which is so limited and can't hit all the places. There were great grants that came in about 3 years ago that didn't get funded simply because you can only do so much. And anyway, so I think and I imagine the federal government is going to do a lot in the same direction as far as helping those because if they can't get the communities to defend themselves through logical things and a little bit of money into it, then it's difficult to think that they can do a force prevention that can really protect those communities.
Yeah, and the knee-jerk reaction when people think about this problem is thinking about treating individual homes or individual pieces of ground. But there are so many opportunities for investment that could make this restoration cheaper and more doable for everyone, like, investing in a sawmill, or, the biomass issue, like someone tackling that problem. What can we do with all this material? Those are the kind of things on a larger scale, like the state or someone else, if they wanted to invest a big pot of money into one thing, it would make meaningful differences and changes to the whole system, which would benefit everyone. And that's what we really need, is someone looking at those big picture tickets. Like, what do we do with the biomass? How do we entice more industry into Colorado so we have more competition to drive the cost down? Those are the type of things that are going to quickly become bottlenecks for us. Even with all the money that's coming our way, we still only have so much capacity, and you're only as strong as the weakest link. And so we need to start breaking down what those weak links are and creating more capacity.
Yeah, well, we're a little bit over time now. I just wanted to make a really brief comment and applaud your efforts in Jeffco at the Buffalo Creek trailheads. I'm a mountain biker, and seeing what you were able to do partnering with Jefferson County, with Team Evergreen, and with the Buffalo Creek Neighborhood Association. I can't remember what they're called, but you guys installed those permanent vault toilets, which is awesome. And what it makes me think of is some other forests and communities such as Gunnison, with the sustainable tourism and outdoor recreation program they have, that I believe was funded by the Forest Foundation. It's a nonprofit. And I think about Guinella Pass and that resource up there. If there's a way for us to invite in other interested parties who are mission aligned with what we want to do, to be able to kind of build capacity, kind of like you've done in the Buffalo Creek area, to bring other people in to help accomplish our mission. So I think that I would love to circle back on that.
Yeah, Sean, absolutely. Thank you. I agree. The toilets are so nice. And yeah, we've already been talking with NFF on how they might be able to help us tackle this problem.
Awesome.
Great. Well, thank you all so much for your time. And thank you, Beth, for getting me a seat in the room. And it's great catching up. And I'll make it a point to schedule some time and not wait so long this next time around. So everyone be well. Thank you.
You too. Thanks, Brian. Okay, so our next agenda item, we're on to talk about childcare. Becky Dancer, Karen, and Cameron. Presentation of employee-based early care center grant. Take it away. And I noticed your presentation is pretty long and involved, so let's get going.
Awesome. I will briefly frame it. I hope Becky's okay with that, along with the other teamies, even though I'm not officially part of the early care team, but I have taken a while to understand the context, and I think it's really important. We have a pretty interesting opportunity in front of us that will take some decisions from 3 of the employers. The county is one of them, school district's another, and CCMRD, the rec district, is the third. So as I've kind of wrapped my head around what this means, the opportunity is to address, I think, what we all acknowledge to be a daycare desert in our area, and really impact the economy through workforce support with daycare, childcare, and that's huge. It's interesting in that we've got it in front of us right now. It's unique, it's collaborative. We've got some grants that are available that they'll talk about. They may be available in the future, but really we've got to make some decisions as a group of 3 employers in the next couple of weeks. And so again, they'll talk further about what that means. I think you're going to hear from Becky as well as from CCMRD, Cameron and Caitlin. And probably the biggest challenge, and then I'll be quiet and let them take it away, is there's not any one entity or any one person who is solely tasked with this. I think we've all come together and said, eek, we need childcare to help our employees and our people who live in the county. And yet no one is tasked with that. And so this group has come together and gone over and above their regular day jobs to really dig into a design and solicit some potential grants. So that's a pretty cool opportunity, but also a really big decision because it means people, money, or time for each one of us. And with that, I will mute and hand it over to Becky.
Hi, thanks so much for having us today and being willing to listen to what we'd like to share with you. And Beth, if you would project the slides. We are not going to go through every slide. You have them in front of you and can take an opportunity to dig in a little deeper. The other thing I wanted to mention as far as the childcare desert, you may already know that the folks that own Barely Tall are considering retirement and selling their business and their building. So that is another opening that can impact our county as well if that does not sell. So that is something, if you aren't aware of, you need to know that as we continue forward. So the thing we wanted to start with essentially is on slide 3, Beth, is why did we go with an employer-based design lab? An opportunity came up through EPIC around establishing a grant potential, a possibility for communities that were seeking to expand or develop early care. You've heard from our stakeholder group before. It's a group of people from licensing specialists, community members, the district. Beth has been involved from the county, and Caitlin and Cameron from CCMRD. And one way for us to be able to access a very large amount of grant money was through this employer-based application for a grant that could award us up to $800,000 for a project that will cost us about $1.2 million is one estimate for the cost for the project. It's provided by the state of Colorado through the Early Childhood Office. There were multiple applicants, 10 selected, and the Clear Creek group was one group that was selected for this. We do need to have 25% as government entities, 25% match for this project, $200,000. The awards become available in 2022 with a spend down in 23. We're going to apply. We were intending to apply for the second round. One round has already gone through. We think that it will occur at the end of February, although the RFP has not been put out yet. We've heard it may be delayed just a little bit. One other grant application that we had been thinking about was through the Buell Foundation. This was one way for us to look at some funds in order to get the center started. So we decided that perhaps as a group, if we applied with 3 of the main employers of the county, that this would be a way for us to secure funds in order to get a center open. So the design lab, which we're participating in, is so helpful and informative in helping us know what our processes need to be, how to think about all of the details of getting a center open. That being said, let's move to the next one. The next couple slides are all about how we came about needing to knowing what our needs are for a center. So we did the study, the needs assessment study in 2019. We've also put out some surveys. The county has not sent the survey out to survey your employees. You have it. Brian and Beth have a survey that we use for other employers if you choose to share that with your own staff to see what capacity there might be for a need for early care among the county staff. And then we have, with our licensing specialists, we have slides that tell you how much space is needed, how much square footage we need. And then we have also looked at what our timeline might be. Beth, if you'll move us to the timeline. I'm moving pretty fast because I want to make sure you have time for questions and that you hear from other folks as well. So all of this information is in here, and you'll continue again. for you to think about and know that we have used appropriate staff, people from the licensing office to support us. You know, this is not guesses on our parts. There's definitely research, and all of the licensing requirements and things have been studied and put into this proposal. So we just want to make you aware of that. And so a project timeline like this can take anywhere from 12 months to 2 years for us to do this. Right now, we're in the very first phases of funding and development, identifying where a building might be and the governance structures we would use for that, as well as getting our schematic design of what it would look like within the square footage that we're asking for. Eventually, at least 6 months out, you would want to have a director and start identifying your center staff and training, and then ensuring your staff have licensing, and all of those things would fall in different areas of governance of the early care center. Let's go ahead, unless you have questions about that timeline. One of our asks of the school district is that we consider putting the early care center in the building 103 along with the elementary school renovation. So this building is currently licensed for childcare use. The asbestos mitigation in that building would be considered part of an in-kind match for our $200,000 match. So that work being done would count towards that. We like the idea of using that building as a one-stop for our families in the community. So starting at infants and working our way into our school system. It's a way for us to increase our enrollment and also potentially increase families relocating into our county. So the estimated opening for the elementary school is 2024, which would also most likely include an opening for the early care, if not, and with the potential that it could start open earlier. But anyway, at this moment, the Board of Education is considering this location as an option with a long-term lease of potentially 25 years at $1 per year. The lease can be used as part of the matching funds. So we would calculate out it's $12 per square foot, and that would be how we would calculate out the potential cost for renting the location. So our board will be moving forward with their final decision on that location. This is just about the governance and what it could look like, a combination of several employers, the center director, and then developing some sort of governing entity, which could be a combination of employees from each of the employers using the employer model. Just an example here of a governance model. No decisions about that have been made at this point. We'll continue. Again, just a little bit more information about governance. What the operating model we did determine would be most effective for us, if you'll go to the next one, Beth, sorry, keep moving you right along here, is one that is an operating partnership. We have a separate operator, someone who runs the day-to-day activities, hiring, training, staffing, and obviously providing service. So we would have a separate operator, and yet we would share the governance with the employers. So we're not looking for us as employers to operate it. The school district doesn't want to operate the early care center. It was nor do we want to bring in someone who's completely on their own, or we have no input whatsoever. So if we hired, say, a for-profit group to run the early care center, we're not involved at all as a community in how our centers run, and we want to make sure that we have a very high quality center. And so as a stakeholder group, we felt that the operating partnership was the best model for us to use. we did send out RFIs throughout the state. We used multiple avenues just to put out information about our center and ask people to consider responding with their interest in running the operations of the center. We did get one formal response from CCMRD. The stakeholder group needs to meet and make decisions about that so that it is a shared decision making, and that will be happening shortly. But we do have a local group that would like to be the operator for this early care center. So now I'm going to turn it over to Cameron and Caitlin from CCMRD and have them talk through about their interest in applying for the operator.
Awesome, Becky. Thank you so much. So we did respond to the RFI request, and so I'm just excited to have an opportunity to speak to you all about why we feel CCMRD would be the perfect partner to collaborate with the school district on this and to be within that operator partnership. So the first point there is alignment with our mission statement, and we can all agree that a strong community requires childcare. And so we feel as though this is in direct alignment with our intent and the service that we provide to this community. Not only do we feel it's important for Clear Creek County as a community, but we think it's got some really great benefits to CCMRD as an organization as well. And so I have kind of spelled out what I think this pipeline could look like. You know, in theory, we could have a relationship with an infant that goes all the way through forever and ever. And what if that infant then ends up loving recreation? And this is a strong connection to place. And, you know, there's just a lot of benefits and extrinsic value that would come from CCMRD being the operator for an infant and toddler care facility. Obviously, we are really happy and proud with what we have going with Kids Corner. And so we don't necessarily want to compete with another provider, and that we feel as though this could be a really great opportunity for a win-win for everybody. And then young families can come here and have somewhere for their children to go. I think that sums up this slide. Beth, if you wouldn't mind advancing to the second one. So just I'm very happy about the research that I've done so far around what this would look like for CCMRD. And so I've learned a lot about the process of our original service plan and how this is related, but to do what would be best practice would to request a material modification of our original service plan and submit that to you all. And if the Board of County Commissioners would prefer a public hearing to discuss that, we are on board all the way. And I think that it could be a really great fit, and we could solve a lot of really big problems that Clear Creek County faces. That's all I have to say. Caitlin, I want to invite you to add anything if you would so choose. But with that, I'm gonna zip it. Thank you so much.
I think that pretty much covered it all, Cameron. Thank you.
One thing, we put this particular information in here just to give you an idea of what it costs and how early care can be paid for, because you know, we could take advantage of our real estate and use existing facilities, but one thing that we would not have access to is tax abatements and ability to write off a loss. So there is a potential for operating in a loss. We need to be transparent about that. And as we move forward, we need to think about how we would be sustaining the early care center over time. So we just felt like that we needed to be clear that this is a potential. Then as far as I've talked a bit about the matching funds, right now, this is some of the things that are available to us for potential funding. So again, we need to look at $200,000. Some of it can be in kind, but Epic recommends that 100,000 of that be more of a cash option. It doesn't mean that we have to have $100,000 in cash. It means that we have to be looking at other funding sources. So grants and donations are one way to look at that. To look at the cash option. I'm sorry, I'm not very clear on that. But if you go to the next slide, this is where I want to talk about a potential for one of those cash options. So right now, in order for us to move forward with this application, we need to have letters of commitment from each of our employer groups that we are willing to invest in this for at least 5 years. Right now, the district, I've mentioned this before, the board is considering the feasibility of building 103 as a site. CCMRD is committed to the operations of the early care center. And thinking about the county and how the county could support with the matching funds and being directly involved in the process. One, this is just an idea. This is Becky Dancer thought about this and shared with our group, what if? And so what if you would consider supporting a coordinator position moving forward until we're ready to put a director in place. A coordinator right now, we have Ulrika Johnson, who has been working with us as a volunteer. Mostly, she's gotten a little bit of compensation, but not near enough for what the amount of time and energy she's put into this project. She's been an amazing community supporter, but we will lose her support once the grant application passes at this point here in February. And so one option to keep someone who's so involved in this process and who really understands this, to keep her involved would be to consider putting her on maybe as a temporary coordinator position to get the early care center started. And then eventually we would need to, as an entity, hire a director who would then oversee getting the operations of the center going. And that's usually about a six month process when you're opening a new center. So that's just a proposed idea, but it would be one way that the county could participate and be able to offset some of the matching funds. So that's just a thought. And then finally, what I wanted to throw out there in the last slide is just some of the requirements and recommendations that we need for our grant application. So as I mentioned before, we need a 5-year commitment from all the parties in the project and their role in the project. We have to address that. There are lots of other things that go along with it, but the main things are commitment from the partners and what will our matching funds look like. So these are just some cash possibilities, along with, we have a lot of other data if you would like it on where our in-kind could come in place. So like, for example, if we put together a schematic for the child care center, that the cost for that would be included in our cash donation. So very high level, but our ask is really, would you consider being a partner in this application? And what might your support be in helping us secure the matching funds? So that's really our ask before you today. We have so much more information we can share with you if you need more details. We just didn't want to do it today in this very short meeting that we had. So what I'd like to do, if any of my other partners on the call want to add anything else to this, or we can just take questions at this point.
So before anybody responds on our end, I just wanted to make sure Peter had a chance to weigh in. I think that this has the potential for us to be wading into quasi-judicial matters. And also this is a work session where we're not going to be making any decisions today also. So I just wanted to make sure that I gave Peter that opportunity, and then I'll turn it back over to you, Becky, and then George and Randy can comment as they wish.
Thank you. I appreciate that. And Sean did give a really good recap of what I wanted to say to you all. Because one, this is a work session, the board can't take any action. They can give direction to staff if they want to, but they cannot take any action at this point concerning your request. The other thing is because the requests and what you laid out here may relate to possible land use issues that could come before the board, I think it's unlikely. I don't know that the board's going to ultimately have to make a land use decision here. I do want to caution the board just to be careful in the event that this is something that would ultimately need to go to the planning commission or something like that. Again, I don't see that being the issue. I just want to make sure that nobody offers an opinion on exactly, for example, the use of building 103 or something like that until the matter is actually submitted and goes forward. That's it. Thank you.
Yeah, and thank you so much for the presentation. And it's obvious that you guys have been busy and a lot of work and effort went into that. I guess one question I have, maybe I'm just a little bit confused. I know Lori Beckel had been one of the spokespersons for this group in the past. I assume this is the same group, and maybe Lori's interest has moved on to something else, or how is it that she's not part of this conversation today?
Lori is one member of our stakeholder group, and so her early involvement was as a sub-team lead on looking into building locations and financial supports. So she's still part of our stakeholder group. And you know, there are some other things that are going on in the county. They've developed a nonprofit for early care and learning. However, I'm not involved in that directly. But yes, Lori is still part of our stakeholder team, but she has since stepped down from her role as the lead for our finance and fiscal team.
Okay, thanks. That makes sense.
Mm-hmm.
Yeah, one I guess observation that I have, I know in the past I've asked a few pointed questions about business plans and about kind of a sustainable approach and sort of like what the long-term financial commitment might look like. And I don't feel any smarter about that after this presentation than I did the last time I asked about this too.
So we definitely have, Ula Corinne has definitely put together financials for what it would cost for us to operate at capacity, and then what it would take to sustain over time. We just didn't put all that in here. However, we can send that to you. We do need to do a little tweaking on that, and you see, let me know if I'm way off base here. But we have put together some financials on that. We have not written a business plan for at this point because moving forward, to have that in prepared prior to having funding to support what we're doing, we just haven't done it. We do know that the operator will have a big portion of what that plan would look like. And then by going through an employer group, then we would want the employers to together to be developing that plan with each group's roles and responsibilities as far as governance and development of the early care center. So that would be a next step, but we're not there yet. And that's pretty intensive to develop a business plan as a suggestion and not involve all the entities together. And this is just one idea. Let me just say this. The employer-based opportunity was really, we really dove into that. So we would have an opportunity for some very substantial funding to get this off the ground. It is just one way that we wanted to approach this. It doesn't have to be through this grant round. There is a potential for $5.5 million next year to go after. We could go after it as a employer group. We could add more employers to it. It just delays the opening of the center, really, essentially. This doesn't mean that this is do or die right now. We can move forward. It takes a lot of work. It will take a lot of writing and work on our part to get this grant submitted for this round. We're willing to do it if we have the partnership of the three, at least these three employers. If we decide we want to slow down the train and we want to look at maybe submitting next year, which Epic is aware that that's a possibility for Clear Creek. This won't be a surprise to that team. We can do that as well. It may mean that we need other players. I may not be able to sustain the role that I have right now with the level of involvement I have right now. We would need some other players at the table to really help us get this going forward. I know that our community is really, we are all so committed to this, and we know we need it desperately. I live on Floyd Hill. My neighbors are all like this. Where are we going to get daycare? Can you share your nanny? I mean, we have fights over nannies on Floyd Hill. So we're really desperate for some early care. We know you know that. So honestly, this was one way. There are other things we can do, but we just have to, I just feel like we need to come together as a group and really determine how we're going to move forward if we don't go with this round of application. If I could just be transparent and blunt about that.
And I'm not at all wanting to give a negative opinion of the employer-based plan. I mean, I think that at some point we're going to need resources in all of our communities, right? Not just Idaho Springs. And
right.
I guess I'm a little, and so I think anchoring it with employers to me makes a lot of sense, but it also asks a couple of questions. And I think you said 3 employers. One of them is the recreation district. One of them is a school district. So I'm curious to hear what the third one is. And then the other thing is if I'm a self-employed person living on Floyd Hill, would I be able to put my child in there even though my employer is not one of those 3 listed employers? And
so, yes, good questions. The third employer is the county, because you have some of the largest employer. You're one of the largest employers for the county. So we looked at, and Henderson was set aside for a reason, and I can explain why for now. And so yes, you can, as a community member, you would be able to enroll your child in the early care center as well. We as so far as a community would not fill it as employers. And so we would look to, and we want to ensure that community members would have access as well, who are not part of the employer-based group. We know that it's essential to get our folks back to work, and we have to have early care, available to really do that. So it is not closed off to the community. But we would really be looking to make sure our employees, for our employee retention and recruitment, have access to early care.
And I mean, as last question, George, as leadership in the county, I mean, it seems like this is potentially a key benefit to help us attract a better workforce, to say, hey, you can bring your kid to work with you and drop them off at this center, and maybe there's an element of subsidization that happens. Do those parents essentially come first in line versus somebody who's not associated with one of the 3 employers who's potentially underwriting some of the costs? And then, I'm sorry, George, you can take it over from there.
So that is all things that can be established. We haven't determined what a process would be for, is it first come first serve, or is it prioritization? That hasn't been determined. Right now, we just know that based on the data we currently have, we would not be at capacity with the 3 main employer groups. So down the road, I don't know, but that's definitely something that would have to be determined. Sorry, I'm at the high school and the bells are ringing.
Randy, I've got some questions and some comments. I bet you do too. Would you like to go first?
Well, I think one of them is, Sean said it well a minute ago, and he said is, trying to provide governance for the community and reflecting all of our citizens' needs. We have childcare, we have our childcare needs assessment, excuse me. And that's given us some data to work with. But we also know that about 70% of our population that works in this county, about 70% go outside the county to work, usually to be able to afford to live here. And of the people who work in the county, about 70% of them are imported into the county. And so one of my questions is about the likelihood the accuracy of our projections of a business model that's likely to be able to accommodate all of those. Because the people who have kids and live in the county are part of the school district. And that's a support to the school district. I mean, we try to get enrollment up and make sure kids are in our schools. And so knowing that those people that are leaving the community to go work so they can afford to live here and raise their kids here would have, that this model is projecting a capacity, a business model that projects capacity that would, realistically achieve all of those needs. For me, it would be very important to see, to know that we're really, and I think it's addressing the same thing Sean just talked about, wanting to know that I like the idea of having it an employer-based system. And I like the idea of using it as a way to attract people to drive up here to work, even if they can't live here, so that we have enough employees. At the same time, I think it's equally important to prioritize having the capacity for the children that are growing up in our community, because that's one of the key elements of the CCMRD enthusiasm for the project. The pipeline idea that was mentioned there. So that would be a real important one for me is just to know that capacity is anticipated and is a goal to achieve in real time.
Oh, absolutely. One way for us to help determine capacity is to survey the county employees. So that gives us a little bit more information about projected need and what our current need is. So one way to get more information would be to send that out through your employee base, which we did in the district. CCMRD did as well. And we also had access to some community members who completed the survey. So that data point would be really crucial. And I know that we have some preliminary work done, but we could submit more detailed information to help answer those questions and maybe help us see, is this really going to meet the mark of what we're after?
Right. And I think one other thing, a third element of it is to project kind of like latent travel demand. When you're designing a transportation system, you realize that when you expand the system, the people that had reached the pain point and no longer came weren't coming. If that incentivization and subsidization, as Sean mentioned, involved involved an increase overall at people, that it attracts more employees, so we have a better employee base to understand that what's our expectation of growth. If there's some way to project that at all, it would be helpful also in designing that plan.
One thing we have talked about is down the road, looking at, obviously, to address some of the growth, is looking at opportunities for hubs. Where might we put another hub of an early care center? So we have an operator already available. So looking at additional sites, perhaps West Evergreen, perhaps further west into the county could be an option down the road. So we're definitely had that in mind. And then, I'll stop there.
All right, thank you. That's all I had. George, sorry.
I just wanted, I don't know if my voice can carry, but the needs assessment that was done in 2019, they predicted that we had about 50 slots that are lacking right now. And in the coming 10 years, there would be 60 lacking childcare slots. And we are planning for about 60. So the need, as it was determined 2019, that we are covering all of that, not for the employers only, but for everyone in the Clear Creek County. Sorry, I can't speak.
Thank you, UC. I forgot about that. That study did project out to 2030, capacity for 60, and that's what we established our design around, with 60.
Yeah, and I think, Ula, I was kind of thinking along the same lines as you. Pretty sure that the methodology of that study was to look at who the employers are to kind of build a demand model. And so this helps me kind of answer a question I had written down and that we've heard Sean and Randy both express as well, which is, are there community slots? Is there space for community slots? I think at this point we can presume the answer is yes, just based on they estimated 50 slots and they did so in the knowledge that we have 230 employees. and we still have 230 employees. I know as it relates to us as employers, the average age of our staff is 50. And so I'm not sure the survey will find that we have a lot of current employees that are interested. I also know one of the things I hear from the employees, including those who are above the average age of our staff of 50, is that they'd love to see some more young faces around. So I could think about this as a sort of future recruitment kind of thing. So that's just wanted to share kind of how I'm thinking about that conversation. My initial response was much like Sean and Randy, which is, well, what about the community? Knowing that we want to promote economic development and all of that stuff. I want to ask, do you have a ballpark? You need a $200,000 match. It looks like you've got some kind of rough numbers, but maybe we need to really kind of like add them up so that we kind of know like what is the value of the asbestos contribution that we're assuming, you know, and what is the ask in dollar terms of the county. I don't know if we have an answer to that today, or if we don't, that's probably an answer we need before we can really move forward.
I can get the asbestos estimate. The slide deck's been sent to our Board of Ed, as I know they'll be wrestling with similar decisions, and Rachel Rubenstein from Jacobs, as well as Justin Watanabe, can help us with that. So when we finish this, I'll make sure that they're on top of that.
Okay.
I'm not going to ask UC to speak, but I know that we have some of that information that would be helpful for decision making. As far as how much, I don't have off the top of my head the specific answer, but I will get it to you because I know it's important. Let's do this real quick. We were thinking that for the lease was 55,000. So if you do $12 per square foot, and we have 4,600 square feet in mind, we know that we would have that lease amount for annually. So that was a chunk. And then we knew we would also have the asbestos abatement, which we don't have data on right now. We do have some in-kind with volunteer hours, some other funding that came through early on. So there was some funding from Henderson and CCEDC to do some initial feasibility studies. The district has supported UC with some financial support during this process. There are a couple others. So most of that is under $50,000 or less. We also know that the Buell Foundation is another grant. We haven't applied for it, but right now we would have to really figure out how we would cover the whole 200,000 prior.
Hey, Becky, I'm gonna jump in for a sec, because I know I can see you're processing.
I am sorry. That's
no, I think it's good. And I know my board's gonna ask the same question. We've had similar conversations, you guys. And I feel like I saw somewhere, and it was probably in something UC had shared, and this is what we need to send to both of actually all three of the boards, CCMRD, CCSD, and BOCC. Here's exactly what the ask would be from each of the employers. Here's what we can confidently say we know we have if we get this grant, and here's exactly what it would take. What gets a little bit confusing, and I think we may need to specify it in whatever we send to the different boards, what's in kind,
right?
What's cash, what's for sure, and then what's possible. And again, I'll just elevate, what we said before. This is, I think for everyone here, now UC included, this is happening on almost volunteer time. And so I think we're in this like final place of, can we pull this together as a group of 3? And it's okay. I mean, I think it'd be fantastic if we could. If not, and I saw a question in the chat, probably the 3 of us as employers, if you guys are interested in this, need to then maybe come together and scratch our heads and say, is there a way to fund a position to continue to research this and or go after future grants? That's where I'm probably going to guide my board, because it feels like we've got decisions in front of us now with some grants that are available now. And we all have to say, does this work or not for what we can or can't commit to? If yes, awesome, takes all 3 of us. If no, that's okay too. But we need someone, we need a leader to carry it forward, I think, if I'm understanding it correctly.
Yeah, and I'll just note, while I'm asking for that kind of precision, that express some gratefulness that this school district is bringing some resources to the table here. Maybe I'll just ask staff, do you have thoughts on this?
I didn't know if Brian was going to jump in, but I'll jump in. You know, let's see, I've been sitting here a long time with the commissioners, and this issue has come before, and we haven't put our foot forward. And this is a unique opportunity that's before you right now. We've never had these 3 employers come together like this, and then also have the backup of Henderson and EDC at the same time. And you see, I can't even tell you how much work she's been doing since last year on this project. And we did actually put out a request of solicitation to some of the municipalities to ask for some funding to support her to keep going and get us through this epic grant, which designs kind of our business approach to the big giant grant that we want from the state. And so, I mean, Empire's put in money, Georgetown has put in money, Idaho Springs is putting in money, the Board of Education putting in money. And, you know, they're all ready to donate money to keep Ula Karin going. I mean, that kind of just shows you the, you know, support that you have across the community, that, you know, childcare is an important issue. And I think it's probably one of the biggest hurdles to us growing young families in our community. And we know those young families bring contribution and vitality, and they build our school district and make us stronger. And I helped as much as I could with this group, but, you know, I'm buried like everybody else. And Brian's going to yell at me after this, but you know what, it's really important, you guys, and we've never made it this far before. And I really hate to see, you know, us fall back. And Becky, I know your deadline for this grant is soon. And I just, you know, and George, I thought the same thing as you. I thought our average age was 50. And guess what? Yesterday I was wrong. Kate said, you know what, our ages are dropping. And I was surprised to see more people raise their hands in support of childcare, you know, needs for their employees. I mean, just in my 3 teams that I supervise, I'm starting to get young people with young kids, and it's coming. And, you know, I think it would be nice to have some young faces around here, you know. So anyway, I'll be quiet.
Well, I think that, first of all, I mean, just as my personal reaction to the childcare proposals that I've seen floating by us so far this year is that one of our primary things we want to do was wait until we saw the school bond pass so we'd understand more about what's going on there. And I'm, without getting too far into the weeds and having Peter like throw his shoe at me or something like that, because I've gone too far, you know, generally I think that it's strategically childcare at the school makes the first thing I thought while we were looking at other places was, well, why not the school at the elementary school passes, because then it's one-stop shopping for parents driving through. All of that said, 2 things: we can't make any decisions today or even imply we're incredibly close to those decisions, and I forgot what the second one was already. That's just I didn't get enough sleep last night, so I'm good.
Is there a possibility of other employers joining this consortium in the future?
If there is a grants coming out next year, it will probably be the same. For government and nonprofit, you have a 25% match for 200,000. If you have a for-profit company in the group, the demand for matching goes to 50%, so 400,000. That's the only difference.
Okay, Brian, did you have any comments from the county's perspective?
Yeah, kudos to all the hard work that's gone into this. I know a tremendous amount of work has gone into it. I met with Becky and Ula before right before the holidays. This can be a recruitment tool for us, but if it's only if there are guaranteed slots, right? I got to be able to use it as a recruitment tool. So if it's a first come first served situation, I can't then use this as a benefit to go out and recruit potential young families or young kids to come work for us, right? That have kids. So there's got to be some guaranteed slots so we can then use it as a benefit to recruit. And I get that there needs to be a champion for this, but I have to say this, we have so much internal need in our organization right now, and it's staffing related. And if we're going to fund a coordinator to go out and staff this, I don't know how I look my department heads in the eye and say this became our number one priority. That's just the challenge. And that's not to say anything against all the hard work that's gone into this. But for us and for me, it's how do you prioritize all the internal need that we have as a county? A lot of it's staffing related. This is the second FTE you've been requested today alone from outside entities. So it's just we are in a hard spot, right, in terms of how you prioritize all this need, recognizing that this is certainly a need that exists in the county for sure.
What's the deadline of this particular grant application that is in the presentation today?
February, was it?
If we're ready to go this year, it would be the end of this month and possibly the first week of March. So very quick turnaround.
Yeah, so it kind of seems like maybe there's a way to quickly focus on whether we collectively think that this is realistic. And based on what I've heard, I kind of suspect maybe it is realistic. And then only speaking for myself, I'm always very hesitant to make any type of a long-term commitment if I don't really fully understand it. So I think it would be unlikely that I personally would want to put forth any sort of a financial commitment before I really understood what the whole picture looked like. And Brian, I think, raises a great question. I think the school district probably feels the same way, that, you know, if they're going to be spending public dollars on this, that there needs to be a public benefit specifically to the school district and to the county and to our employees. But with all that said, I don't necessarily feel personally that I need to have all those answers before I would feel good about an application going forward. And I would imagine that the grant provider is going to be doing their own underwriting and, you know, basically evaluating the feasibility of this project as well. And then I guess I personally feel like we could kind of wait and see whether we receive the grant before we invest a lot of other resources or decide who's going to come up with a paid coordinator position or any of that things. And I guess maybe my question at the end of this, and I'm noting we're already a half hour over our time slot for this, is what do we need? What do you need from us, if anything, in order to do the grant application?
So we would need a commitment, a letter of commitment moving forward that you would be engaged in this early care center for 5 years. We would also need financial support to meet the $200,000 matching funds.
So that's what I was seeing. I see a comment from Mitch down here that says, I'm not sure I heard a county FTE request up on one of the slides. In fact, 2 of the different slides mentioned that the county would provide a director or coordinator. And then you mentioned that $100,000 cash. How much are you asking of that to come from the county? That's a question about a number. Are you asking us for 100,000 or a portion of 100,000, or what are you asking for? That wasn't clear to me.
Yes, and maybe not. We definitely need in some way, shape or form around $100,000.
So to turn in the grant, you need an actual letter of commitment to agree to
Yes.
that financial commitment.
Yes, and commitment to the center itself being part of the employer group.
Sure.
Yeah. Mhm.
Is that 100 on top of the contribution to the coordinator position, or is that separate?
No,
Okay.
that would include that. So hiring a person to do this would be cash, considered cash.
It seems to me like we have, presuming that we want to keep moving forward on this. And I'll just speak for myself. We've made a lot of progress. I'm very motivated by what Beth had to say. We have an opportunity to get something done here. And my apologies to literally every department in Clear Creek County that wants staff too. But I do think I want to find a way to move forward. It seems like we have two options. One is to commit to matching the grant. And within that would be the resources to have the coordination to keep moving forward. The other one would be to commit to hiring or contracting with someone, sharing the cost with some of our partners or whatever that looks like, so that we can keep the process going and in the pipeline for a future grant. Am I missing an alternative other than saying we should stop?
George, I was kind of thinking the same thing. I like how you delineated it, because again, I've got to get my board to that kind of that same decision point. Are we moving forward now in the current configuration and concept that we've heard? And if so, what's the specific ask of each employer? If not, are we willing to partially fund a position to keep this going? I think. Becky or UC, is there anything you guys want to add to that? And I know UC's kind of been the keeper of the dollars in the business plan, and bless her heart, she's not able to speak a ton. So I'm also hoping for some follow-up information, because I know she's probably chomping at the bit to share that.
I think George framed it well. I guess the last question I have related to that, I believe, is when do you need some kind of a response from the county in order to meet the timelines of this grant application? Knowing that you're not going to get it today for the reasons that we.
Oh, sure. I would say within a couple of weeks, because UC and I will need to start generating what we know that the grant application will be asking for. So we have a lot of writing and preparation ahead of us. So the sooner we know, the sooner we can get at that. But, you know, a couple of weeks maybe would be about all we could spare.
And in terms of CCSD's timeline, because I'm hoping I've got some board members who are listening, I will recommend that they wrestle with it potentially at the study session February 10th. And like you guys, they can't take formal action until business meeting, and that's February 15th. So mid-February, if that helps. That's kind of what I had in my mind. And I'm not sure about CCMRD's timeline or process.
George and Randy, do you feel like you'll have an informed opinion by the time we meet 2 weeks from today?
I think it could become more informed with some discussion about the ask seems to be somewhat flexible. And as I look at what's being asked of each partner, and we're supposed to be partners in it, I think there might be some massaging of that a little bit as I compare the ask of the county to the commitments, who's making which commitment. And so I think we need to discuss that among ourselves in another setting that's appropriate. It's business plan related and not real estate, anything that could at all pertain to a quasi judicial issue. And in order to figure out what that means and then come back and I would like to find, my answer is I'd like to find a way And I think we might be able to do that, but we're not prepared nor authorized to do that today.
Right. Okay, and I said I wasn't gonna ask any more questions, and I'm gonna ask one more. Cameron and Karen, can you foresee a scenario where the school district or the rec district comes up with cash alongside the county?
We've not talked about that with the board yet, and it would depend on the amount. I had put a note in the chat that may or may not be helpful as we think through this. You know, we've got one-time ESSER dollars right now that potentially could be used to support something. They're not ongoing, but that may be something that we could tap into. Let's say if we're looking ahead to fund a joint position to write more grants or what have you. I could see that being something that I recommend and the board would potentially be okay with. Other than that, it would just depend on the number. And just like Brian said, the competing priorities. So. And Cameron, I'll mute now.
No worries. Thank you. It's hard for me to answer that question without talking to the board, but my initial thoughts are that we didn't budget for this and we are operating at a loss for this year. So it would be a challenge to commit funds. But for what it's worth, myself and Caitlin are fully committed and, you know, we'll continue to volunteer our time as an in-kind contribution. But we could explore the possibility of making some contribution. I just can't commit knowing we're already at a loss.
Yeah, and I know that Brian's probably thinking that the county didn't budget for this either, and that would be a correct observation for all of us.
And just something to be aware, likely we would need an intergovernmental agreement with the entities here. It seems very premature since nobody's really committing to exactly how funds are going to be spent, who's going to be supervising expense of the funds, exactly who the entities are that are being contracted with. I think there's a lot here that we cannot decide in a 2-week time frame, even if we came back. So I would think that we would need a lot more information that would likely probably go through the county manager's office first to make sure it's in some sort of packet of information that can go to the board so we can reasonably make some decisions and move forward, and we staff can receive direction from the board on how to proceed. So just something in terms of timing, because I heard that there was some mention of coming back in 2 weeks. I'm not sure what we would be coming back to in 2 weeks exactly.
And if I can follow up on that, that was going to be my question, is if we are coming back in 2 weeks, what is it that we can bring to you that's going to help you make a better informed decision?
The part of the answer to that, and I don't know where we're at with this, would be, I think the obvious elephant in the room funding source from the county would be ARPA. I don't know that staff is ready to, prepare that ARPA analysis in 2 weeks. I know it's been sort of in the works, but that context and then just other funding sources would be helpful.
Potentially is the COVID relief money we've gotten back, or I don't know if we've gotten any, I know we haven't gotten any FEMA money back yet, but some of the COVID relief money potentially could be used.
Possibly. I kind of view those as general fund reserve, but
it's all coming out of reserves at this point because it wasn't budgeted. So it's either coming out of that ARPA pod or.
Right. It's kind of like that. All we need now is money story I told earlier. What I would expect was the opportunity to have a discussion in another setting and think about that. The opportunity to maybe find out and get some kind of a ballpark estimate or some kind of an analysis done on ARPA COVID funding and then be ready to decide whether or not we can come back with a proposal or an agreement or a counter proposal or something ourselves that we thought could work for us. And then it's a matter of, can everybody else figure it out? And then my other question is, based on the idea that the school is expected to be open and that building actually usable by 2024, how often does this grant come through and what's the next grant deadline? if we're too strapped right now, if what's happening, this is coming in too fast, it's too rushed, there isn't time to prepare a really solid grant application because, we can rush into something and try to do all the things Peter talked about and then end up as a result having a rushed grant application that doesn't make a lot of sense or doesn't meet muster. Sometimes it's better to turn in a good grant application on the next round. But what is the next, how often does this cycle through?
And I think Becky's I think next year, but the funds are not guaranteed. I think they anticipate a smaller amount being available next year. And yeah,
5.5 million has been put forward as a potential for the next round. There's still some things that have to be figured out even among the grantors because of there's so many things at play that are impacting openings and use of funds by certain dates because of supply challenges and costs of materials right now. There's a lot of stuff in the background. So here, I would like to offer this. I would, UC and I, maybe in a day after she's feeling a little better, we'll put together what we do know so far about what's in kind, what's in cash, and share with you that information specifically. We can also share with you all of the attachments and things that we need to submit to the grant so you can see what's required at the time of application and what could be established after the application. So that may help with decision making as well. Whatever other questions you have, if you want to send them to Beth or however that works with your organization, we're happy to address those at any time. So pile the questions on, let us help you get the information you need to help make a more informed decision. We're very happy to do that.
Okay, well, I think my understanding is a little bit greater than it was before. I do think probably there's an element of I don't know if when you throw out the words business plan, you get this idea that it's going to be something really overwhelming. And I think for my own personal needs, maybe it's more just like a financial pro forma and some kind of a visual about how many kids are being served, what we're going to charge. I mean, just kind of like the very basic things that I would imagine that the grant provider is going to demand anyway. But with that said, we're more than out of time. So I don't know that, I guess I'm kind of confused about maybe what our next steps are.
Who would, well, our next steps would be for us to receive something that is more of a summary that really gets into the, the business plan a little bit, pro forma like Sean suggested. I think Sean's thinking in terms of the 1 to 2 page summary or something like that, but that has enough numbers that add up to a bottom line that, if we got our pencil out and checked it really quick, it would add up. And then I know on our end, and a good description that's involved with it also, as you said, a little bit of a functional description of how it works. And then we would probably look into trying to get the best information we can on ARPA funding within that 2-week period, also to get an idea about what we think we can tolerate, and then be able to come back and say, do we have something where we're all sharing funding it's a sustainable thing and we can pull this off and roll for this grant?
Yeah, no, I agree with that. And the one thing I would add is I view our funding sources as fairly fungible. So I don't necessarily consider the ARPA dollars any less dear than I do the general fund dollars or any other dollars, because we have profound needs around the coroner's office and, in pretty much every direction you look at the county. So those dollars it's going to be a very competitive process when we figure out where they're going to go.
Yeah, just some final thoughts from me related to ARPA. I do perceive a need for us to think about those dollars in terms of addressing COVID impacts. I'm not saying that we have to do that about every single dollar that's in ARPA. And obviously one of the impacts of COVID is our ability to provide services, and we owe it to our community to think about our own ability to provide the services we're directly responsible for today. I think a good next step for the county team would be for us to not wait 2 weeks to discuss this internally.
Right.
I think that we could do so in executive session. I think we're sort of being presented with a negotiation here. And I would really like the opportunity for us to do that.
That's exactly what I was thinking. If not today, then depending on Peter's take on that, then on another day where we convene for that purpose. For example, in a couple of days, we're convening for another purpose. So if Peter's uncomfortable with an executive session for that purpose today, we could do it when we convened on Thursday also. So either way for me. And this is not pizza on my beard. It seems to be some lint off of this thing that won't come.
Yeah. Well, thank you. Thank you so much, Cameron and Becky, Karen, and your teams. Yeah, this is there's a good reason why no one's cracked the code on this one yet. I mean, this is a difficult problem, and your efforts are appreciated. And
right.
I'm hopeful that something positive will come out of this. But yeah, there's a lot of moving parts and a lot of work to be done before we can get to the point where I think we have a plan that's funded that we all feel confident in.
Well, thank you so much, all of you, for the opportunity to be able to share this with you. And I have a potential partnership in the future. So really appreciate you all.
Thanks. Peter, do you think it makes sense to do a 15-minute executive session, or do you think it makes sense to have a little lunch break before the EMS topic and then do the executive session following the agenda today?
So there was a time constraint with the sheriff and the undersheriff being able to attend in the afternoon. So that is why we had set it at 11:30.
Sheriff is on.
The sheriff is on and I sent out the Zoom link for the executive session earlier. And I know Bruce already joined that. So
okay, let's go.
We can at least have part of it now. I do want to just get a clarification from the board before we move on to the executive session. So is the board asking for an executive session to discuss negotiating some sort of an agreement on childcare? Because I still think it's premature until we have more specifics and ideas. So I just want to make sure I'm given the correct direction on what the board's expectation is. I don't think anything is ready for Thursday.
Well, yeah, well, it depends on what, there may be a couple of discussions we need to have if we, you get done what you tried to get done. And so if there's anything that can be helpful by having a discussion that's, if we had time on, by simply putting it on the agenda, then at least we can kick some concepts around and get a little more detailed about what we're thinking and saying right now. And maybe there's some, I don't know if anything can be done at all to look at the availability of ARPA funds for this or just to determine their appropriateness, but either that or we do it next week, call a meeting next week, but we can't like wait 2 weeks and come in and try to figure it out then, so.
Yeah, I agree with that. I mean, my take is if there's a legal premise to speak about it, even today at the end of the agenda, I'd like to have 15 or 20 minutes where we can talk about it. If there's, like I said, if there's a legal premise for us to do so.
And then that might lead to some more concise and definitive and helpful staff direction for staff as well.
Okay, so what I will actually do is just notice an executive session for Thursday. We cannot do it today. It has not been noticed, and even though in certain times we can do an executive session without the 24-hour notice, you can generally do that. It's not a practice that I would prefer to do. I'd rather give the 24 hours notice and have it written and put on an agenda. So since we're putting an agenda together for Thursday for the Board of Health issue, we can add an executive session at that time, if that works for everybody.
Yeah, you must not have been listening earlier. We talked about that. That was a great idea.
Yep. So perfect.
No,
I think we're running out of time. Should we just go into our executive session with the sheriff and Bruce, and then come back at 12:30?
Yes.
Yeah.
Yes.
So then the board moves into executive session to discuss the following matters.
Pursuant to CRS 246402-4B for the Board of County Commissioners to meet with the county attorney for the purposes of receiving legal advice on specific legal questions relating to the Clear Creek County Jail. I'll see you all over there.
Second. All in favor, say aye. Aye.
Aye.
Opposed, same motion. The board will now move into executive session. No written minutes will be kept. No decisions will be made. See you guys.
Hey, brother. Let's see, hold on. Okay, can you hear me now?
Oh, hi,
Yeah,
Beth.
I got you.
Okay, so if you could move over Alec and phone number 1862 ending in 1862 in the panel, if you can. I don't know.
Well, I can. But what are the chances they're available at
Oh,
2:15? Brian just came in here and I guess they're
grumpy. They need lunch. I understand.
they're deep into conversations.
Oh, yeah. Okay, 2:15.
I won't be there.
Who can't be there?
Clark or that's fine. Clark or Aaron, but I know what they're going to talk about, so I'll just paraphrase for them. So
You sure?
it is what it is, you know.
Sorry. All right. So who all are you? You're going to have you and Alec and Clark and Aaron are not coming. Is that right?
No, Alec and I will be the only ones there, I believe, and I'll talk with Aaron and see if he's home by then. So either just the three of us or just the two of us, which is fine.
I'm so sorry. I'll let Brian know.
Well, that's okay. Clark's doing something that the BOCC is going to have, some questions about, but I'll do the best I can.
Okay. Well, yeah. Is he going on shift somewhere else so he can't be here?
No, he's actually going on a community paramedicine meeting over in Evergreen that needs to be done. So
Right on.
yeah,
Awesome.
it's all about Clark.
You got yourself a bunch of superstars.
We'll see you at 2:15. Give me a call if it's pushed back later.
Okay. Thank you so much.
Bye-bye.
Hey, Diana crossed over Chris Pettit. I know he's on our list today, so I just want to let you know he'll go first.
Can you hear me?
Okay.
Yes, we hear you, Chris. Give us just a minute for the commissioners to come back into session, and then we'll call on you here shortly.
Okay.
Thank you. Diane, tell me if you see some more on the list that I'm not seeing.
Probably the other two, I have talked to them in person and
Okay.
email, so they probably will not be here. They're both personal properties, so I don't think they'll call in. But I could be wrong.
I know, I see the number at the, do you see the phone number at the top? The 939-4000?
Oh,
Yeah, that's me.
Oh, that's Chris. Okay, got it.
I was gonna say no.
All right, we're good. I'm like, that sounds like a company. It's probably one of Diane's. Okay.
I'm not sure how to get rid of the echo.
While we're waiting for Randy to come back in, let me just say that the board has returned from our executive session. No written minutes were kept in that session and no decisions were made in that session. And we are back in our normal session, regular session. It's 1 o'clock and our next agenda item is the is Ms. Settle.
For the abatement hearings. So Diane, it's your turn.
Yeah, okay. Are we gonna wait for Randy or do you want me to just go?
Give them another 60 seconds. I have a question, Diane, for you in the meantime. I got my own tax assessment for 2021 in the mail last week. And I noticed in my case, my total taxes, property taxes have gone up roughly 1/3 over the last few years. Is that pretty typical countywide? And are you kind of hearing some rumblings about that since that communication just went out to all the county property owners last week?
I've heard from some people, we heard from a lot of people when our notices of value went out last May. And actually, I saw in the Sunday paper that they're talking that property values in Colorado have increased by 1/3 in the last few years.
Yeah.
And they are still going up. Okay, it looks like we're all here. So Mr. Pettit, you're first. This is a lot in Saddleback Ridge Estates and vacant lot. And I had it valued at 100 and let's see, I think I had it valued at 114,090 for 2020. I'm recommending he paid 70,000 for it in 19. So I'm recommending adjusting it to 71,290 with a refund of $835.46 for 2020.
Okay, by me.
Okay. Randy, George, do you have any questions?
Now, are we on 2216? Which one are we on?
I don't know which one it is.
2217.
17.
Yeah, R22-17.
Okay.
All right, well, if there's agreement with the taxpayer and the assessor, I guess I would be ready to entertain a motion.
Move we approve the assessor's recommendation for partial approval of the petition for abatement with reference to case 2217.
Second.
Have a motion and a second. All in favor, say aye. Aye.
Aye. Thanks, Chris.
A super majority has weighed in on this one, so that one passes. Thank you. Dan, which one do you want to do next?
Okay,
So before, can I ask just one question? So does that come back as a check or a credit?
That'll be from the treasurer, and she can credit your taxes if that's what you want to do. You would need to call her about this, but don't do it
Okay.
today because she won't have it yet.
Okay, that'll be fine.
Okay.
Thank you very much.
You're welcome.
Bye. Yeah, that was easy.
Okay, 2216. He doesn't realize he's still in the air. This is a piece of personal property that they reported on their personal property deck, but also had an SMM tag for, which is a special mobile equipment. And what they do with the special mobile equipment tags is they kind of move those properties around the state. So we don't have to track them. They get an SMM tag, but they kind of turned it in here plus the SMM tag. So that's what I'm recommending, is to refund them from 84,210 to 15,130, and taxes of $1,382.24.
What year is that, Diane? Is that?
Oh, that is for 2020.
Thanks.
Pretty straightforward.
Have you communicated with the homeowner or the property owner, Diane?
Yes, this is a personal property account for Wells Fargo. And they turned in a piece of equipment with us that they should not have done, returned on their personal property declaration to us. It should have just, because they had the special mobile equipment tag for it.
What was the equipment?
Well, it's movable equipment, special mobile machinery, and they do that through the Department of Revenue. And so they didn't need to turn it in to me also, but so they basically got double taxed on it. But I don't know that equipment's in or not in county, so.
Yeah, okay. Are they in agreement with your recommendation?
Yes.
Yeah.
Okay. George, Randy, do you have any questions about this one? If not,
No.
promotion.
Yeah, I move that we approve case 22-16 and accept the assessor's recommendation for a full refund of $1,372.48.
Second.
We have a motion and a second. All in favor? Aye.
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 Opposed, same sign. Motion carries. I think we've only got one more today.
And this is for a property here in Georgetown, a gas station, and they had a Subway in there. And the Subway is closed and not operational. They've scrapped all the equipment. And so they came in and talked to me about it. And so we adjusted it based on the equipment that is no longer there. And we had a value of $73,150, and this is personal property. And we're adjusting it to $61,600 with a refund of $253.04 for 2021.
And is the property owner in agreement with your recommendation, Diane?
Yes.
Okay, George, Randy, any questions for Diane?
I move we approve case 22-18 for the partial abatement due to the removal of the personal property from this property.
Did you second that, George?
Yeah, did it not come through? Second.
All right, got it that time. Okay. We have a motion and a second. All in favor, say aye. Aye.
Aye.
Aye.
Opposed, same sign. Motion carries. Anything else for us today, Diane?
That's it.
Perfect. Brian, were you able to get other Brian rescheduled to do our EMS update?
Thank you very much.
Thanks, Diane.
2:15 for EMS.
Yeah, after housing.
Sorry, I'm on my little Chromebook today. It's kind of hard to look at the agenda and people's faces at the same time. So our next item is at 1:15 and it's 1:10. Amy, would you like to get started or do you want to wait a couple minutes?
I would eat the other half of my granola bar that I got in the last 3 minutes I had if I had 3 more minutes.
Okay, I think that we can accommodate that. So yeah, let's take that one up in 240 seconds.
Is anybody else joining? Will Matt be joining?
I believe it is just me today.
Okay.
I will text Matt to double check, but there's a big funding application due the end of the close of business today. So
Okay, just checking to see if there's anybody else we needed to move over. So
yeah, thank you.
yeah.
Sean, you are on it today.
You feeling better, George?
Did I come off a little cranky a minute ago?
You sounded like there was some kind of a blood sugar crisis going on.
No, I take that time to just like meditate a little bit and try to come back in a more peaceful state of mind.
I had the worst waking up thing. Some of you heard this earlier. I went to bed at 11 o'clock, woke up at 12:30 a.m. and never went back to sleep. And then tried this new stand-up desk that George has loaned me and stood on tile floor for 4.5 hours and didn't put any shoes on when I ran down here. It was killer.
I'm not sure that will be considered a successful experiment. Maybe wait and see how you feel next meeting.
My back doesn't hurt. Everything else does.
Yeah. Okay. All righty. Amy, this is your agenda item related to the housing recommendation. So take it away.
Yes, thank you. Thank you very much, commissioners. Today, you will hear a presentation from our consultants. One member of our consultant team, Willa Williford, is here, and she'll present the final draft of the Clear Creek Housing Strategy Report. This is a document that's the result of about 6 to 8 months of work. Several different elements went into this that Willa will go over in her presentation. And just as you know, this is a background. The background is that the county's been at this for the better part of a decade or more to try to get to a place where we are ready to act with confidence to advance housing in Clear Creek County. And this document will provide us with the foundation to do so. And we're hoping that you will adopt this. There's also a resolution in the packet that is before you for action today. And that will provide staff with the direction and the foundation to build some tactics and projects and proposals that are born of this document. And that will help us advance and improve housing in the county for all our residents. So that's what we're aiming to be able to position ourselves to take action on today. And with that, I will hand it over to Willa Williford.
Thank you, Amy. Good to see you, commissioners, and thanks for the opportunity to bring this report for your consideration today. So in terms of agenda, we kept it pretty simple. We thought we'd share the process and what we've learned from community and stakeholders since we last were before you in October. We'll share what we changed and how the document evolved based on that feedback. And then we'll have plenty of time for your feedback and discussion if there's anything, policy-wise that needs consideration, or if there's anything we missed around things you hope the document to accomplish. So as Amy mentioned, this work has been going on for more than half a year at this point, and we're now here on the very final step. And the work has always hinged on these two questions about how do we go from understanding the housing needs in Clear Creek to addressing them, and what should the county's role be in housing solutions and moving towards action. So our hope is that this document creates that very clear framework for you with roles and tasks and financial components and capacity considerations, but that it still gives you and the other elected leaders within the other jurisdictions quite a bit of discretion about the nitty-gritty of many of the tools and tactics and land use regulations, but that all of that then is happening within this strategic framework that that everyone has had quite a lot of opportunity to craft, and that as the consultant team, we've been the listeners and reflecting back and bringing our expertise from working in these areas in other communities, but that this has really been driven by people who are engaged in the work locally, elected, appointed, staff member, nonprofit, business community, and so forth. So, since we saw you in October, we completed phase 3 of the work. And that was really this iterative process around bringing our rough draft into the final document you see today, and testing and ground truthing a lot of the things that we had recommended in the report, and bringing some more nuance to how the report was put together. So we gathered that information by posting the draft on the forum. We conducted 2 online workshops in November. A total of 33 stakeholders participated in those. And then we had a virtual open house on December 8th with a broad invitation, publicized through various different media forums and social media, inviting the public at large. And about 31 members attended that discussion. I would say all 3 of these forums had really good dialogue and comments associated with them, and we were able to combine all those comments that were over 100 different pieces of feedback, and then really sift through them and understand the themes, and where there was sort of a critical mass of things that need to be addressed, as well as the community really helping us just ground truth and fact check a number of things. So we did follow up, or we do have follow up in process with some specific individuals and organizations, particularly where the comments were really in depth, and where we may have picked up an element of them in their revisions, but maybe not address everything point by point. So that's ongoing with Sally and Amy and the consultant team supporting. So the big themes in terms of what we heard, and this is so aligned with everything, the work that had come in phases 1 and 2, is just that need for deep affordability and addressing the missing middle. And all of that really relating back to retaining our community character and who we are, the identity of who we are as a community in Clear Creek, and the tension around the feeling that that's slipping away as the market is getting so crazy. There was a desire for more senior housing choices, which we feel is woven throughout actually many of our recommendations. And so particularly around making sure there's affordable opportunities for people to downsize, both in the rent and the for sale space. We also, and this was sort of a aha, like we should have done this earlier, but having a clear definition of affordable, and so that we're helping us speak the same language. So we've incorporated that as an appendix in the plan to make sure we're all like kind of ground truthing back to that. Aesthetics and the need to preserve our community character. This is so important, and it goes back to that, there's the character of the people in Clear Creek, and there's the character of the place. And those are very linked together and important. And I think concern about growth and change impacting community character and the rural character was really aligned with our recommendations about, let's make sure we're placing our housing efforts in areas that are already developed, already have services, are close to transportation and schools and so forth, and that our steep, beautiful mountainscapes remain intact. And then preserving and improving what we have, because certainly if we're building new is an important component of this plan, but we cannot lose sight of if we're building new without taking care of what we have, we're treading water. So kind of continuing to elevate those 2 things side by side is important. And then finally, we really took a deep dive, and this was extensive conversations about this, about mobile home parks and the tactics and strategies that could be used there, because there was a real sense in the community that we've talked about this and acknowledged it for a long, long time, and that we need more help with the specifics of what can be done and what the challenges are. So just continuing in the space of what we heard, we got some feedback on capacity and roles. that note about common language, kind of linking back to what is affordable and how do we talk about housing in our community in a way that's holistic and is about lifting everyone up. And then, I felt it was interesting around how people felt like we can't just this is such an urgent problem if we sort of put the brakes on and try to address a lot of the things in the strategic plan to build our capacity, we might lose out on some opportunities. So how do we keep momentum even as we're trying to sort of build the ship as we're sailing it? And so we try to address that in the report, just being really clear about these are the things that are immediately at hand that can progress. So the collective impact, I mean, this was a really palatable thing through the listening sessions and the discussions around how together we can do this better. We can't all grow this expertise. It's too complex, it's too thorny a problem. But if we are rowing in the same direction, we can really make a difference across the county. And then the importance of the private sector. And I think this is where this has always been well known and understood by the consultant team, and I think the practitioners in the area, but we needed to elevate it more in the report and make it more obvious because we had this specific direction that we were looking at publicly owned sites. And yet there are many privately owned sites that can also come to the table and be part of this solution. And we had some really excellent participation from developers and private landowners in those forums and workshops. And so that was reflected back to us as something we needed to make better in the report. And so we did. There was a few, in terms of the process, there were some voices just kind of challenging the premise that we needed to do this work. And, I think that's something that the county was very clear on from the start. And so, that we tried to link our work back to the 2018 needs assessment and the, it's not unanimous, but certainly the strong direction in the community that, yes, this is a problem that we want to address together. And then a lot of gratitude about hey, that we're all in the same room talking about this. This is sort of modeling how we hope we could go forward. And so I think that's a bright spot in the process around, these are the right people at the table who are really committed to this work. They've been working on it for a long time. They want to continue to work on it in better and more creative and more collaborative ways. And then we did compile, there is a themes of the public feedback in Appendix D of the report, if you want to delve into even more of sort of the specifics of what people were providing. So how this impacted the document, I've kind of previewed some of that already, but it resulted in a pretty major reorg. The document is significantly different from the draft you saw in October. And I think it's been strengthened by this process in robust ways. One of the things is that we made the organization of it more clear and concise. And so I think that when you go to look for the recommendations and the answers to those two guiding questions, they're very clear now. And that was in large part thanks to Sally and Amy in giving us feedback about how to make this really user-friendly on their end. We added a preparing a report section so that there is the background of the process and people can appreciate the integrity of all the community involvement and the business leaders and employers at the table. We added an Empire-specific section. This was an error or an omission that was brought to our attention, and I think the report is strengthened with that. Certainly a community that's doing quite a bit and has even more potential, and we want to make sure that that was clear. Addressing the comments just that, and including those as an addendum. Our myths and facts addendum was again sort of to this theme about the common language and when we speak about housing, what do we really mean, and what are the things where when we're finding we're having a miscommunication or that we're not in alignment, what are some fundamental aspects of why we might be having that. So hopefully that can be a useful tool with community and engagement and outreach going forward. We also, this was a good one, just to make sure that we were using 100% Clear Creek photos where we'd had some stock photos before, and the team took some really nice photos and updated the document with those, which I think just ties it together. We made a stronger connection to the 2018 assessments that we were building upon. So there's literal links to those documents now, as well as page number references. And then we just cleaned up the, any places where we had typos, fact checking, cleaning up some wording and language. So that is the multitude of ways in which the document you're seeing now is different. And then we had one additional change since we published the packet, which was the recommendation that the site assessments portion begin with a map showing where those sites are located. So if it is the commissioner's pleasure, this new map would be inserted at page 28 in the adopted plan. And then finally, just to the strategies themselves. So, those are organized under what should Clear Creek County's role be in supporting and advancing housing in the county. And our two, there's quite a bit of substance to this, but the two steps there are the collaborative leadership and establishing the multi-jurisdictional housing authority. So all the whys and wherefores of that are included in the document. And again, that's intended to be framing a framework that's actionable, while still creating that space for local discretion around, what exactly is the composition of the board, and how do we allocate resources across us in a way that's equitable and so forth. And then in the space of how do we move from understanding to addressing housing, so laying the groundwork for development, we had, this is a two parts. It's around your zoning code and your infrastructure. And it's, again, to that piece about preserving rural character and being really clear. Here are the areas where we can accommodate housing and growth, and there's proximity to jobs and transportation. And here are the areas where that is not the case, and where are the places where our zoning or our infrastructure investments are can be better aligned to accomplish our goals. And then prioritizing government and institutionally owned land. This is where we got into the site-specific assessments and kind of giving some parameters around the degree of difficulty of some of those parcels. We do think you have some parcels that are ready to act on quickly, and we'd love to see that as some of those sooner wins that the community could achieve. And then that preserve and improve your existing housing, and nested within that is the mobile home piece. So, I think there's quite a lot here, but I also think that, I hope that it's very responsive to the capacity that's possible within your community, and as well as being, really reflecting back what stakeholders desired. So that really brings me to the end of my talking, and I'd love to give you all the mic now, just for a discussion around, any feedback you have for us, anything you think may be missing, anything you'd like further explained. I can absolutely pull up the report itself if that's helpful to look at any particular pages. But this is, your time now to make sure we're on the same page, and take advantage of Amy, Sally, or myself, who can provide further clarification or background.
Thanks, Willa. George, Randy, who wants to go first?
Not me. That's my first contribution. Yeah, well, I would say this, in looking through it and not having read every word of the revised document, I think it's pretty nice. Let me just say that right off the bat. And thank you for responding to the comments and taking care of some stuff.
I agree with those comments. I think it's a report that really helps us see a path forward with a lot more clarity. and want to compliment you all on, I think, incorporating some pretty diverse feedback with a lot of fidelity.
Right.
So I have some questions that arose when I went through the document. Go through them one by one. So let's see here on page 20, where you list what can we do now. You write, have the current housing authority continue to act as a limited partner if a LIHTC project is identified. And then you write, use consultants to advance tasks that are not within the current capacity. It seems like we can combine those two recommendations to infer that we might need to use a consultant to advance the search for a LIHTC project. And I'm curious if you think that I'm not just walking off a cliff if I'm on solid footing still. What areas of expertise should we be looking for to have a consultant come and help us identify and advance projects?
That actually, I like your logical dot connecting there. I think that's totally does make some sense, although I hadn't actually conceived of it that way. And so so I know when we had when we'd been on site visits, one of the sites that really jumped out as potentially being suitable for rent. And when we talk about LIHTC for others on the call, this is low income housing tax credits. It's a very powerful tool to bring money to build rental housing. And so, I think we had looked at the mill site and thought, wow, that looks like a really great home ownership opportunity. And then when we were looking at I think it's the Argentine Street site, we're like, well, maybe maybe some rental could go there because we know both strategies are needed. And if we could start moving them forward together, that would be wonderful. So I think that, if that's the will of the town of Georgetown, then yes, there's consultant teams can absolutely help you craft a request for proposals for a developer, package that in a way that the development community will be responsive to, and then also have those relationships with developers to say, hey, come look at this. This is a really serious opportunity that might be a match for you. So I do think that's a space where a developer could very much help you. A consultant could help you. Another example in that space is you don't always have to attach that to land. I've seen other communities say, hey, we have this funding for infrastructure and this desire in our community, and we have this housing authority that could be your partner. Please come to our community. So when you attach it to land, you will get a bigger, better response, but it's not the only way you could go about it. And I definitely encourage, I would say along that vein, I definitely encourage because there's a long lead time on, kind of going from site identification to having a project under construction. So I think starting that soon is really good. It's been a couple of years since the Riverbend project leased up. Certainly a theme we heard in the feedback were some things people really love about that and some things that we could do better. So like capturing those and then moving forward with that, we would love to see happen soon. Did that address it, George?
Yeah, I think so. Thank you.
George, I can just offer too. I think what happens with like this box of, and this whole concept of what we do now kind of thing, what we do immediately, is a question, right? We need to make a decision about that. And so it's related, right? Our capacity, what we do, what projects present themselves, what our what the timelines are, what exactly we decide to do from here will all sort of tell us what we might need to do with the current housing authority on the short term or the long term or the intermediate term. And it will also depend on what projects emerge. But what I liked about this box and the message and recommendations that Willa provided was that the recommendations provided short-term direction and guidance, but didn't preclude short-term action, and helped us also be better able to make good decisions with a stronger contextual framework in the short term when we come up with forks in the road right now. But how and what tools apply, we still are going to have to navigate that, because we don't necessarily know exactly. But the current housing authority may well play a role in that. We just are going to have to figure out how to make it work.
I think it's a really good comment, an excellent one, because it every once in a while we get caught up in the idea that we're going to build that perfect future, whether we're talking about, there's any number of times that this has come up. And actually on this subject, an example, and I'm not criticizing the decision at all or trying to backpedal on it or anything like that, but just to show it as an example, one of the things we brought up about, for example, DLD was, well, first we have to accomplish this entire thing. And I think it is important to get a DLD study done. That said, we can't, when we have the opportunity for action and our need is so severe and we see something that looks like, sometimes you can get enough information to be able to shoot from the hip and say, no, it's not, we don't need to wait for a master plan or a sub-area plan for this. This is a pretty obvious thing. Not discounting that and not trying to get that done and letting that inform everything we do. But every once in a while, if an opportunity provides, it's, come to the fork in the road and you have to take it. So.
Yeah, I mean, there's certain, and I think the development readiness of the sites we looked at kind of plays into that, because there's certain sites where it felt like, oh, you could really, you could hit the ground running and have something come to fruition quickly in development terms. That's 2 or 3, that might be 2 or 3 years, but it still is quick.
Right.
Versus,
because you want to do good planning when you do that. You want to do a good DLD sub-area plan, and to do that is going to take some time. And in the meantime, we have to act on the good opportunities that we see that we do agree on, that we feel fit the mode we're looking at. And I'm not saying run all over the residents or something like that. I'm just saying, so that might have been a bad example, but just when we see them and we can achieve general agreement, I think acting while we can. And that's the reason you want the existing, organization to continue to act and function until the other one's in place, because that takes time too. Same thing.
Absolutely. George, did you have it sounded like you might have had a laundry list of questions.
Yeah, but I also don't want to Sean, don't let me dominate this time.
Go ahead.
I don't think you have yet at all. We'll let you know.
Okay, so then I see kind of 2 things. We have sort of a midterm goal. I think we can define it as midterm, couple years, get a multi-jurisdictional housing authority. I think I agree with that recommendation. And the way you describe it just makes a lot of sense. Everybody's looking for space to collaborate in, and we all want to be equal partners at the table. And the multi-jurisdictional housing authority is the model that gets us there. And I'm talking about is the county and the municipalities. I also see, a need for us to tackle near-term opportunities. And I'm curious to hear if you think, I see you recommend that we hire a person who could be an executive director of the multi-jurisdictional housing authority, with the intent that their first task is sort of to build it. I wonder if you think that a single FTE could handle both the construction of the multi-jurisdictional housing authority and the pursuit of these near-term goals.
Depends on how many you want to take on and how good your executive director is. But I do think, one FTE is a good starting place. And then I often see, so right now, recently I've been working with Teton County, Idaho, where they're bringing a multi-jurisdictional housing authority to fruition. And they've actually been able to accomplish an incredible amount with a high functioning board, where they've gotten to the point that they have a strategic plan, a whole governance structure and funding in place, as well as and now they're hiring an executive director, and they're able to say, your first steps are X, hit the ground running. That I find is unusual that a volunteer board got as far as they did, and that either whether it's an executive director or consultant support, you usually need some kind of capacity that's able to implement the direction of the board in between those meetings. So I think. And I guess maybe your question is going a bit more towards, do you need more than one FTE? And I think that that's going to really hinge on how much responsibility for the improving existing inventory and that like third goal around preservation, how much you task that person with the day-to-day of that. Because I think that can become an all-consuming full-time job, whereas the organizational capacity development and the public-private partnerships and some of the other pieces could very, very well kind of be contained within the same skill set and job description. But that if you kind of look for someone who can do absolutely everything in this plan, that's may end up being too much for one person. I also think that, and this has been a tricky dynamic of writing this action plan, because many of these strategies do reside within the leadership of the jurisdictions. And so that infrastructure alignment and zoning code piece really is, it's the role of a multi-jurisdictional housing authority leader to help bump those along and create a forum in which they can be discussed and best practices brought forward, but the implementation must be with the jurisdictions that have that land use control. So that, I guess, my way of saying that is I don't think that's a very time-consuming task for this leadership role at the MGHA, but I do think that the organizational development, initiating a development project could be an executive director role, and I think that if you want to elevate and move forward on the preservation and improving mobile home park strategy soon, that's probably a second half-time person or full-time person.
Thank you.
I have a question for Peter. I appreciate this effort that we've gone to. I think it was kind of my idea, or one of my ideas, to spend the money and get better informed. And I feel like this has been a success. My question is, what are the legal ramifications of us signing this today? What does it mean, if anything?
It's just an intent document saying that this is the view, that this is what the county wants to promote and move forward with. It's not legally binding. It's not going to say that we are now committing any money in particular or committing to doing an IGA or an MOU with various other municipalities. It's basically aspirational, and it's saying we're adopting this as our view.
If I could add to that, it provides direction to staff that you concur with the results of this assessment with its recommendations. And it would affirm that and would provide direction to staff to move forward with respect to the various recommendations in the report.
Perfect. That's kind of what I suspected. And yeah, I've been kind of waiting to weigh in, and I don't have much to say about this other than I think this is an excellent work product. To me, it kind of maybe makes sense for us to focus on the very first recommendation, which is in front of us right here: establish the multi-jurisdictional housing authority. And I guess I'm kind of curious to know if there have been any even informal conversations about who would be the parties to that authority and what they're thinking, because it seems like maybe this is a two-step process, and step one is actually creating the authority. And I don't think that would preclude us from taking any action independently as the county if there was some sort of phenomenal opportunity that dropped in our laps. I'm not currently aware of any of those type of opportunities other than maybe the possibility of getting a little more aggressive with Department of Local Affairs housing dollars that I may or may not have some expiration dates on them. But anyway, with that said, and maybe this question is for, well, it's for whoever wants to take it, I guess, Willa or Amy. Like what are the more specific plans, or how have you seen other counties collaborate with their towns and other potential parties to a multi-jurisdictional housing authority? How would that actually work, and how would we create it, and what's the timeline associated with that?
Great question, and I think I'd love to have Amy tag team this one with me.
That too.
So, I think that through the process of the meetings we'd had over the, prior to the holidays, we did get a lot of, we've surfaced this idea and started to, and I think got some pretty good reception from the other jurisdictions on it as an idea. And so I think that formalizing that a little bit in a specific sort of roadshow of like, here's what we're asking of you, and that looks like, X amount of staff time and Y amount of dollars, and here's kind of how we're going to set this up to be a working group that implements, would be the recommended next step. We talked about it, the composition, we recommended the composition being staff members from participating jurisdictions, as well as some at-large members, because so much of this hinged on that whole idea that George kind of summarized about sort of equitable representation. And we had seen another housing authority down in La Plata, a multi-jurisdictional housing authority down in La Plata County, really struggle with the turnover in elected officials because they were having elected officials serve on their board. I'll give a couple other examples. That Driggs one, or it's Teton, Idaho, so it's Driggs, Victor, and Teutonia are the jurisdictions within the county, and then the county is kind of, it's actually quite similar in terms of county staff created, really did the administrative support as the housing authority is being propped up. And then they had mostly sort of planner types as their jurisdictional representatives on the board, but then they had at-large members from the business community and some people with retired people with real estate expertise, which I think you may have in Clear Creek County as well, who were able to really do some sharp, impressive work. Just to the north of you in Grand County, they're currently in this process as well. And the steering committee, so it's interesting there because they already have a county housing authority and a Winter Park housing authority. And I'm like, you're going for a third one, really? But they have specific ideas about how they want it to cover the Fraser Valley. So they have, it's Fraser, Winter Park, and Granby sitting as municipal representatives, staff level, and then the manager of the Grand County Housing Authority. So she ends up with kind of two hats. That one is, jury's out on that. They're literally meeting next month to do their legal documents. And then the final, now I'm like inundating you with examples. But I really do think the work in Chaffee County has been impressive, and they've really coalesced a lot of community support and had a lot of opportunities come out of the woodwork based on their structure. It's a little overly formal and large in my opinion, but it has, I think it's too big for Clear Creek is exactly, I guess what I'm trying to say, because they have 2 reps and this alternate from each jurisdiction. And then there's this whole process of adoption where they have to kind of ping pong back and forth between the jurisdictions. And that looked tedious to me. I think that something simpler is better. So anyway, that's just a little bit of color commentary on that. And maybe I could hand it to Amy to help us zoom back out to the big picture.
We have not had any, I haven't had any direct conversations or anything. We've had some indications from different towns of what some of their concerns might be, or what some of the things they might think are good about this idea. Like Willa indicated, there's just, there's the acknowledgement that the pooling of resources is a good idea. There's some skepticism and concern about how this structure would, whether or not it would genuinely provide a voice for all the members, particularly the smaller municipalities. So, I think that the roadshow that Willa described would include, really frank conversations to try to understand the perspectives and concerns of the different municipalities, what their specific situations and details are. I would imagine the basic tension is how much money do you want and how much voice do we get, and how this works. And that again comes back to sort of the delicacy of the county being the broker of this deal, and how do we manage that in a way that still genuinely creates a round table for this process, that we do have equal voices and equal parties, that we have equity and equalness, both things, fairness and balance in the way that we build if there's monetary contributions, for example, to support this effort, which there will have to be at some point. How do we go about doing that? And that, I think, has to be an iterative process. And I think we just have to kind of tiptoe towards that and learn what we hear and use that to inform the systems that are built, and continue to be inclusive and let it happen in a way that makes it genuinely an independent, freestanding entity that can exist and function on its own.
I think that's generally good. The only thing that I would maybe that we could vary a little bit from that is to be, one thing is to be delicate so that you don't let anybody think you're trying to be heavy-handed. And the other thing to do, the other way to go at that is to be a little bit heavy-handed about equality. In other words, build a system that is intentional, kind of like when you're in some kinds of meetings, we've learned that we have to literally call on the people around the table and bring their voice out, because sometimes they almost expect to be, they almost come in, if they come in fearful that they won't be heard, sometimes they're there kind of meeting their own expectation, a self-fulfilling prophecy. So being careful to bring those voices out, give them that voice, and then reflect that voice back to them. And I think to be at the outset, while you're doing it, to make it clear that this isn't even a meaningful thing to try to do without giving them large voices and having a real consensus type organization like we've done in some of our collaboratives where we're the small voice, our county's the small voice. And the reason is because the thing about infrastructure and within municipal boundaries where possible, unless you've got all the infrastructure and needs and it's, close enough to be good. That's really one of the charges that's one of the things we're charged with, is making sure that happens. So without them in there. And so to articulate that up front and say, we're just trying to be a clearinghouse for ideas and help get the organization going and provide the firepower to do that. But the municipalities are, we can articulate that they're the most important players in the game.
Mm-hmm.
Could you page down a little bit? I see the first line of funding needed. I'd like to see a little bit, whatever the continuation of that is. Okay. I guess I have a question too. I think we created our housing authority because we wanted a housing authority. And I'm not going to make an argument for or against that right now, but I guess what I'm wondering is we are in a unique, a not enviable position that I don't think that this is necessarily budgeted, or if it is, there's plenty of other unbudgeted things around the county that we've been talking about. How do we determine whether or not this is successful? Let's say we go ahead and do this, and 3 years down the road, what sort of metrics would indicate to us that this has been a good investment? And then on the flip side of that kind of coin, what sort of indications might tell us that this was an interesting experiment and it's something that we should shut down?
Love that question. So, initially, I think I think actually developing those metrics would be a great part of the roadshow. And I think there's tools within this document that you could pin that to, because we did not disrupt the existing recommendation of 300 units over 10 years that EPS had created. So that's a very tangible metric. If you can, and we counted, your housing authority helped to create 48 units at Riverbend, and Habitat has created an additional, I think it's 10. And so you are making progress on that goal. And if this multi-jurisdictional housing authority was able to add momentum to that progress, that would be very tangible. But I think there's lesser things within that as well around, checking in with the jurisdictions around, are they getting their needs met? Some of those might be more qualitative, but so anyhow, I think this is an excellent next step in thinking about this multi-jurisdictional housing authority development. Is like 3 years out, success would look like X, and we could start to put some bullet points to that.
Mm-hmm. Yeah, other elements of the most recent needs assessment could also be a part of it, but again, exactly, Willa, the formation throughout the formation of the MJHA could be part of that process of identifying what those would be.
And I'm wondering sort of what are the other possible, and this, I'm just seeking to understand, is it possible that the municipalities, one or more of them, may say, you know what, this is a cool idea, we're just going to go create our own housing authority? Is there any, I guess they would have complete control over it in that case? I mean, what are some different ways that this conversation could go?
Yes, so there are, I'll give the example of Mesa County. They currently have, Grand Junction has an incredibly strong housing authority, very mature, sophisticated, does their own development work, really respected in the industry. Mesa County has a paper housing authority that nobody can find a board member for, and they haven't been active since they were formed 30 years ago. And now the town of Fruita wants to do a development where they could really use a housing authority. And we had this jurisdictional problem of like, well, okay, so Fruita is their own municipality. Grand Junction can't hop over to Fruita because there's sort of this nascent Mesa County thing in the way. And so they ended up electing to make their own. And so they're forming that. I would say that, my hope for Clear Creek is that you have a single housing authority that everyone participates in. I think that's the gold standard. But if there's, in Chaffee, for example, they had participation from all the jurisdictions except for Poncha Springs. But Poncha has the opportunity to join later if they want to, if they see value in it. To date, they haven't gone off and created their own. They just don't see the need for a housing authority right now. So that's an outcome you could have, is where you had most of the participation. I think if you had, there'd be some threshold at which you're like, I'm not getting traction. If it's just like the county and one other player or something. But it might, I think it's still worth, if you came to that point, I think it would be worth stopping and evaluating, sort of, well, what are the benefits of doing it this way? Or was this just not the right idea?
Yeah, and I mean, we've looked at Chaffee County's EMS operation as best practices when we did our own EMS evaluation, whatever that was, in 2017. So I think their county we're a little bit similar to each other. How has theirs worked out? I mean, in terms of the county versus Salida versus Buena Vista, I mean, who are kind of the primary financial underwriters of their authority? How did that play out for them?
Yeah, so certainly the county was the fiscal agent to begin with, and I think that they have had really strong. I don't know the actual numbers, like how they split it out, but they have had strong representation across the different jurisdictions, and strong and like I said before, sort of like projects getting catalyzed and momentum from that. They helped us with these initial numbers about what it took to prop up the housing authority, but I didn't ask how those were broken down behind the scenes. I know that they did get some, it was not all locally funded. They did get some support from the Colorado Health Foundation and some other grant funders. To one other thing, well, we're talking about sort of how do different people do it behind the scenes. I do know for the Teton, Idaho example that they had even participation. Driggs and Victor had the same amount that they were contributing, and Teutonia, which is a much smaller community, did a half portion. And then the county provided everything in kind. So they didn't actually make a financial contribution, but they provided staff time, legal support, IT, HR, and that was, what was needed in the beginning.
Right, and that's right at the border of Wyoming and Idaho, and that authority only is in Idaho, is that right?
That's correct, yep. So they are, yes, they're over the pass though from Jackson, and so
Sure.
they have a lot of struggle.
And Brian, what are we spending now on our housing authority, and how does that compare to the numbers that we're seeing right here?
I'm hoping Amy might be able to answer that. We're not spending a lot at all.
No, we're not really spending anything on our housing authority.
Actually, I have the budget open here. I can find it in a moment.
Yeah, well, I think whatever costs are attributed to Sally probably fit in that bucket, right?
Well, that would be our housing department, which is a different budget. Sorry to split hairs with you. The housing authority is one budget, and then our housing department is another budget.
It's an important distinction for us to kind of think through. Not written on my list of questions is what are the needs for an internal county housing department in the context where we have a multi-jurisdictional housing authority?
I'm wondering the same thing. Yeah.
So Amy, when you did the budget this year, I know you and I had talked about how the housing authority is delineated. For some reason in the back of my mind, I don't know why, I remember 140,000 as a number. Am I making that up, or was that the line item?
There's $10,000 in the housing authority budget.
So
that's all we budgeted in 22.
Okay, and what about our housing department then?
The housing department budget is around $50,000.
Okay.
It was a little higher in 2021 with the consultant expenses in.
What are the next steps when it comes to like the roadshow or sort of finding some indication from the other elected officials and the other potential partners of a multi-jurisdictional housing authority?
I think the next steps would be to start laying out some ideas for how we might structure the initial, like basically funding the next 12 months. Do we want to approach it? What approach do we want to take? Would we want to put out, look for a basically a contracted executive director to bring on board to start up the MJHA? Do we want to, what kind of straw dog do we want to create to present to the, to share with the municipalities as a scenario for them to explore? We would just have to really just put pen to paper to try to talk about what kind of scenarios we could look at, figure out what the county's contribution could be. Maybe the county says we're in for the first year at 100%, and then we go forward with another proposal, or maybe we want to say we're looking for this type of, these are the startup expenses for year one, but we have a long ways to go to really be able to get clear about what that would look like. But basically we need to see what our potential partners in this would be willing to do, and what their interest is. We need to have a little bit of something to talk to them about, to be able to explain to them what we would be asking of them, what they would need to come up with as far as funding, and see if we can hopefully get this so we're focusing on everybody's 2023 budgets kind of thing.
And I think, I mean, there's a lot of information that we're looking at right here. So I feel like we have a pretty good start.
We do. We do. And I think I'm just talking about like in terms of how we would structure the relationships between the municipalities and entities for the multi-jurisdictional housing authority specifically.
Yeah, I think if I'm putting myself in their shoes for a second, I would probably ask the same question I asked before, which is how is Chaffey County handling this, right? Who's paying for what and what are they getting for it? And
yeah,
what level of autonomy does Buena Vista have for something that's inside of their boundaries, or what is the level of competition, right? I mean, is Salida and BB competing for common resources? You know, those are probably the sort of things that I would be wondering if, again, if I were in their shoes.
Mm-hmm.
I think another important piece here is engaging legal, which we had, outlined as one of the line items. And I think, so there's a couple different avenues there because you have, a strong county attorney who could be helpful. You also, Ben Doyle was involved in creating the original housing authority, and we consulted him a little bit about these recommendations. And then you have a firm that does a lot of housing work, Holland and Hart. They are doing the Grand County one. And then we could add, to the mix, whoever did Chaffey. But I think that having those template documents about how that was created can also help get our gears turning about, okay, these are the questions we need to ask and get input from the communities. Because, we get the privilege of kind of crafting the art of how this will work, but ultimately it will be codified. And so looking at some sample documents could also be helpful.
Okay, just like a quick time check. So it's 2:13. I know I see Clear Creek EMS team has already joined the meeting. I'm personally fine with us approving the resolution. I'm wondering what else do we need to accomplish before we close down this conversation today, if anything.
I guess I would, assuming approval today, which I shouldn't assume, but I think maybe next steps is Amy and I sitting down and kind of crafting out what the next steps should be, and maybe coming back to you in a work session relatively quickly, so we can plot out how to start, checking the boxes on the recommendations and where to start. And so I think maybe a work session quickly after we have a chance to sit down and talk about next steps might make the most sense.
I agree with that. I think in looking at that, the one obvious one is there's a long range goal. So the sooner you start it, the sooner you get done, which is starting to think about doing the groundwork for the authority. And I'm guessing, so just throwing some thoughts out, public outreach. So there's that. Then there's the scan across the board and the list of possible recommendations on the page of what can we do? What can we do first? And it's think about, in your mind, scan the county and think about all the different things we've talked about in recent times and say, where's the low hanging fruit? Is there any low hanging fruit to do that other part, which is don't let the long range goal, stop you from looking for short range accomplishments. And you probably would have thought of that and done exactly what I said. So not trying to explain
that's
it.
Good.
That's where my head went instantly.
Yeah, I think that sounds like a reasonable next step. Something that I think a part of the conversation we'll want to focus on is the recommendation that the housing authority be composed of staff. I think it makes a lot of sense for a lot of reasons and introduces some complexities I'll want to think through. And the other thing that might be helpful is some feedback from the board. I don't think we have time to do it in this meeting, but some feedback from the board about the need is urgent list and which ones we kind of, how we would prioritize those. So I think probably the best way to do that, and I think this is maybe just comes down to individual prerogative, is I intend to share my thoughts with staff on that.
Right, same. I was thinking the same thing, and that's really the page I was thinking of a second ago when
we could discuss those in our one-on-ones, and then Amy and I could be prepared at the work session to discuss that list.
Right.
Yeah, and I mean, I still need to get my head around who should be doing what and how. And I think that the primary opportunities are going to be within the boundaries of the towns. I don't think any of us are going to have any illusions about that. And so in some respects, I think that the primary benefits are going to be conferred to the towns themselves as well. And with that said, having county do the heavy lifting financially may not make perfect sense to me.
I tend to take a little bit more of a holistic view about our community. And I'll just kind of leave that statement out there.
Yeah, I think, I mean, I understand what you're saying, Sean, and I respect it. I think, though, that since housing for the county and the economy for the county benefits in terms of services, both the county and the municipalities, and the greatest gain to be had in creating workforce by creating housing and creating property values by creating housing is to be in the different ranges of housing. Since we acknowledge it's to be done within the municipalities, I think we're all on the same team together to try to get it done. And so, and there may be some great opportunities, for example, and some great input to come from a couple of smaller municipalities that can barely drag their weight now. So to have them come in with that voice while we subsidize some of those efforts to a greater degree is probably going to be necessary, because there could be some, like Solar Plume and Empire may provide some opportunities that we like and would justify our involvement and help in getting the authority going a little more than our share.
Yeah, I mean, again, I think I've always taken a pretty holistic view of our responsibilities, and
I agree.
And there are many, and housing is only one part of it, right? And so I'm a little sensitive to biting off more management headache and brain damage if there's other paths available. So I'm probably going to be not wanting to have my first instinct to let the municipalities off the hook from square one.
Yeah, and I don't think I wasn't trying to suggest that myself in my comments. I was just trying to say that there may be, there might have to be a sliding scale of some sort, in order to accommodate opportunities that fall in places of less, there may be good opportunities in places, good land opportunities, infrastructure opportunities in places that are more poorly funded now. And I'm not trying to be opportunistic when I say that. I'm just saying I'm thinking it from that larger umbrella look too.
Okay.
I just, Sean, I know we're over, but just want to make an observation. I want to just define another facet of the urgency that we feel. And it's around the story of the folks who had a truck run into their house. This is a person who was a member of our community who had a home, who was stable and had that home go away. The last I heard was that the victim's advocates could put him in a hotel room for 5 days or so. There was no identified vacancy anywhere in the county. And the next option for them was the emergency homeless shelter in Evergreen. This is a neighbor and a friend of ours. And so I just want to kind of express another way to get at the urgency and how this housing shortage is affecting people who are stable today. And we know life is never guarantees stability for any of us.
Thanks for adding that. Is there anybody want to make any final comments before we take up the resolution that's in front of us?
I think some smart people helped produce this. We should let them know, run with it.
I move we approve resolution 22-19 to adopt the 2022 Clear Creek County Housing Strategy.
Second.
We have a motion and a second. Is there any further / final discussion around this one? Hearing none, all in favor signify with aye. Aye.
Aye.
Aye.
Motion passes. Thanks again, Amy and Willa. I think, like I said before, this is a very high quality artifact that we've created, and it's some exciting progress, something that I know we've been talking about ever since I've been here, 2017, Renee, I've been here, and I think that we can feel good about the progress that we made today, and I look forward to where this leads.
Thank you, commissioners.
Thank you all so much. It was exciting to see you already moving into the implementation conversation at the end, and I look forward to seeing what all you accomplish. Take care.
Thanks. All right, Brian, thank you first off for and Alec, thank you for your flexibility and getting jerked around a little bit on our agenda today, but I believe you are our last official agenda item, and look forward to hearing the update.
Nice. That's being last is good. I'm sure everyone's ready for that after a long day. So we're just going to do, Alex is going to share his screen with you. We're just going to go over some numbers from last year and talk about the big projects we're working on right now for this year. So as always, good to see all you commissioners. We'll just go over, we'll start with call volume this year. You know, COVID hit us the last 2 years. People started getting out, people started having a good time. So call volumes popped right up, one shy of 1,700, which is, I think, going to be our busiest year ever. It's good. Our matrix handles this just fine. We'll have to see in the coming years what that number does. A lot of people were inside and wanted to get out, and when they got out, they had some accidents and stuff. So it's just good to see that a lot of people are up here enjoying themselves. We also had an increase, you know, because of the COVID and the medical calls also. But most of the injury increase this year was traumatic injury. Like I said, people just getting out and doing stuff finally, and having kind of a bad day, having a good time. So we'll go on to the next screen with that. And thanks, Alec, for doing this. Just give you a, you know, just kind of a view into our collection rate. I think we do pretty well. Lisa is a contractor with us. She does the billing. After 2019, I started taking advantage of the Medicaid, Medicare, Colorado EMS supplemental program, and it's done pretty well. It brings in another additional about $112,000 a year. That comes from the federal level. What we found is we were just getting state level reimbursement for Medicaid, Medicare. Now we're getting both state and federal. Much like anything from the feds, we don't know how long this will last. Hopefully, I've already done the paperwork for this year. Hopefully we'll get a similar response, but we're not going to spend the money until we have it. And hopefully it just continues going on with them reimbursing us. It really helps us out with the percentage of the collection rate, you know, 7%. And as you know, every year we seem to lose some revenue fields, or it gets cut from us. So that just goes to show that's a really good program that the feds are giving us right now. You can go ahead, Alec, and move on. Sean, I remember last year talking with you, and I think Randy and George too. This is just the payer mix for the county to be, you know, used to see over time if that changes and what that actually means for us. But that's a breakdown of where we got our money coming back from billed services in the county. Go ahead, Al. So before I move on to this here, and this is an Alec thing, Clark and Aaron, the other two captains, were going to meet us in the meeting earlier, but they had prior obligations as the time moved later. So it's just going to be Alec now to give you a little update, and then I'll go in and give you an update on what Aaron and Clark are working with. Just a little reminder, since I took the director position, we also have 3 captains that work each shift, and a captain that's continuously here 24/7. So that's what Alec, Clark, and Aaron are. And just to let you know, these guys are incredible individuals. They are already leaders. They will be the people that we watch turn into the leaders of not only this community, but this state as far as healthcare is concerned. I can't say enough about what they bring to this county and how much work they really do. They are very intelligent young individuals, and they're really superstars. And they've really just shown how important it is and what they do over the last couple of years being with this agency. So at that, if you guys have any questions about last year, that was kind of a quick rundown. Does anyone have any questions about anything that went down last year or any of those numbers I showed you?
I've got two quick questions, Brian. How's the payer mix changing over time, or is it changing over time?
Well, I'm really going to have to start and go back and look and see how that's happening. I know for a fact that the auto insurance is dropping and what they end up doing. But to be completely honest with you, I haven't taken that information and really looked into what that's trying to tell us over the last, say, 5 years. So something that I will do.
Thanks. And the other question I have is related to CPHE's grant program. I assume that you're going to be applying for something. The deadline, I'm sure you know, is a week from today for the pre-application. I think it's 2 weeks for the real one. But a question that often gets asked of agencies is, and I'm going to ask it of you guys, how do you feel about the rates that you're charging for mileage and for the variety of different services that you provide as compared to other communities in the state similar to Clear Creek?
I think that we revisit that every year. I've had discussions with Dave over in Evergreen and also with what Gilpin County does. I want to look into it more. It's been since 2000, I believe 18, since we've really done a comprehensive study on that. I know that coming up to this year, I feel like we were in a pretty good position to be in that sweet spot where we could basically get our highest rate of return, without going higher, because then you'll start, even though you're getting more money back, at the same time, you'll get less people that are actually paying that. So it's something that Lisa and I are going to do, and probably with the help from the free TAC, go in and do, make sure that we're right, on par with everyone around us. And like I said, that's what we're looking for, is that sweet spot between how much you can charge and how much people are willing to pay. So yeah, that is something that we're going to spend, quite a bit of time here in the first few months, going over that again to make sure that we're at the right spot.
And then what are you planning on applying for on the CPHE's grant cycle?
Well, we have at this point right now, we are going to do a remount again on an ambulance. We're also, which I'll talk to you, this will make more sense after I tell you what Aaron's up to. We're also gonna get some new equipment for some extended protocols for some training that we're doing, a pump and also a ventilator. And basically that's it for this year. The remount is a little bit more expensive. And then next year is going to be a really big year for us, because we're going to have to replace all of our cardiac monitors that go in the ambulance, and that'll bump it up to about asking for almost $300,000. So more of the same this year. Hopefully we'll get a new ambulance. Hopefully they're actually manufacturing new chassis by the end of the year, and that's what we're going to go for.
Yeah, perfect. And George, Randy, what questions might you have now?
None right now.
Brian, I know I sent you an email about this and we didn't find time to talk about it during the COVID update. So at a point that it works for you to fit this in, I'd love just to hear about how the crisis standards of care that were established for EMS are changing your operations. Anything the community needs to know about that?
So basically, medical direction gave us an opportunity to do, paramedic initiated refusals when it comes to COVID. That just means that through markers with what we find in our assessment with pre-existing health conditions, some people's age, and also vital signs, if we could tell them that transport to the hospital shouldn't be facilitated at the time or not. And they also gave us some help with when the hospitals were starting to go on divert and not have room for patients to become part of a system where they could help us figure out where to take patients. We didn't use that much, and it's in fact we kind of do that up here already. We're very being rural and being as far as ways we are. We always have to have resource management. That was always a part of it. I think we ended up telling a few people that interestingly enough, we're not from this community, but we're driving through that felt like they needed to go to the hospital immediately after they stopped their car, that they didn't fit the criterion for us to transport them to the hospital, and then basically give them a list of what they could do to help themselves and get back down there. So it didn't really help us that much. What did help us was with Dr. Ryan and Brian Mossert, about 2 weeks ago when Omicron, 3 weeks ago when that peak started coming through, we went ahead and put on an extra ambulance 24/7 for a 2-week period of time. It didn't hit us as much as for patient care to come in, or for more patients. What hurt us was that between Evergreen and Gilpin and ourselves, we lost almost all of our staff all at once. So we were able to help each other out with that. But as far as now goes with where we're at in the surge, it's gone through Clear Creek EMS. I think 10 out of 16 were sick, some of them for the second time. Now we're doing good. We're back down to normal staffing, and the hospitals haven't been going on divert. So of course the patient number is going down there too. So it was a good move. It really, was a nice gesture to help us out. I think better times are ahead unless another variant comes around now. So that's kind of a long-winded answer and some information you didn't ask for there. But we're looking pretty good now. Everyone's back. We have one still sick on day 5. As soon as they test negative, they'll be back also. So we're looking pretty good.
Thank you.
Mm-hmm.
That's all for me right now.
Okay, I'm going to let Alec go ahead and talk about the program he's working on, and that's what this next slide has to do with. So go ahead, Alec.
Thanks, Brian. So last time we were talking, I was telling you about we were going to get AEDs, revamp the AEDs in our county as they're aging, and we're in desperate need of revamping our AEDs and getting new AEDs into our county. Something else that we discussed is getting AEDs onto our law enforcement vehicles. There's more law enforcement vehicles out and about in just different areas of the county. So they usually beat any other responder to most of the calls that happen. And so for cardiac arrest, them arriving with an AED will increase the chance of survival for those patients. So this right here is our quote from Stryker, looking at the physio AED here. This will be integrated with what we already use cardiac monitor wise. As you can see here, you have our overall price for everything, and then kind of our trade back of our current aging devices that they pay back kind of like a used car. Unfortunately, they don't keep their value just like a car, but get some money back. And then that bottom is our kind of our grand total of how much it's going to cost. And this is, so we're looking at about 73,460 for 45 of those units to replace across the county. Any questions on that real fast before any further?
Alec, is there any opportunity to go after grant money for some of that?
We've tried to look around. There's not a whole lot. So I've talked to Jillian Moore, who works with Starting Hearts and does the CARES program. And her main job is for cardiac arrest for our state. She said that the state has talked about getting grant funding to help kind of with the rural communities with these AEDs. I also talked to Linda and with some of the people at the Free TAC to try to get some funding there. There's no really good unfortunately straight grant funding for AEDs, and I'm still trying to look around and see what we can do to try to help with this.
You know, unfortunately, the antiquated AEDs in this county, we kind of came to a point where, you know, we were a little bit ahead of when everyone else around us bought their AEDs also. So this is problems that they're going to run into over the next few years. And probably we will see some more opportunities for grants. But for right now, we're in a pretty good position with projected in our budget. And that's another thing that's different. I think, you know, we see this program as something that Clear Creek EMS should spearhead, because it is actual medical care that we could use other agencies to administer and for positive outcomes to happen. So I really feel like this is a Clear Creek EMS thing, and we need to manage it. These new AEDs are nice because we could sit here and we'll know which ones need new batteries, which ones have pads that need to be replaced. And it's a way to organize it and get everyone trained up on them and be a really good resource for this county. And I believe that when people gave us the tax money and voted it in, they wanted to increase you know, coverage of medical you know, coverage in the county. I think this is a great example of how to do that. I think Alec will tell you of a couple opportunities this year, one being up at Loveland, Sean, that you're aware of, that if we had an AED in a law enforcement vehicle, we probably might have had a much different outcome than what we saw. So I really think it's important to get Clear Creek EMS fingers into these other agencies that sometimes beat us, to get this life-saving maneuver out there for the citizens and visitors of this county.
Yeah, no, I totally agree with that. And yeah, I mean, Evergreen with Montesi's leadership, I mean, they actually went to the extent of creating a nonprofit, but it used to be almost unheard of to have a cardiac save. And it's happened many times now at Evergreen since that program was in place. And that program can't, EPAD I'm talking about, can't take full credit for it, but it was a key component in, you know, early electrical treatment of the patients who need it. So I think this is awesome.
Absolutely, and that's kind of the goal. And unfortunately, like for the grant funding and such, you know, looking around, I know that Mile High RETAC does a like a fundraiser just to try to get a few AEDs. Unfortunately, you know, as we're trying to replace all these AEDs and we're kind of behind the ball as our AEDs have aged, the price of that, and I know that with their fundraisers, they only get like 6, I think the Mile High RETAC gets with their fundraisers for those AEDs. So it's looking out into the future, maybe talking with Linda and the Free TAC to see doing fundraisers for the Free TAC to help kind of do a continuum of keeping on it, so that way we don't get behind the ball of getting these AEDs and doing away for like a nonprofit. The other thing too is once next project after this AED project and getting these AEDs is making sure, just like you said, Sean, of the community. So it's not just having the AEDs, it's making sure that the community is aware of where the AEDs are. Making the best result is having a community that is trained and knows that how to use an AED and how efficient CPR is for saving a life. And some of the stuff I pulled up just to show you guys how important this is. I mean, it's something, you know, I'm passionate about is this is the CARES data. Now they haven't come out with the 2021. CARES data is a database across the nation for cardiac arrest. It's where about 1,700, I think, EMS agencies are involved across the nation, and they enter in data from all their cardiac arrests. We're involved in it. And we've entered our data in. So this is the 2020 data. Things I just want to kind of point out is represents kind of the percentage of, so I'm going to scroll down here. The main one we'll look at is the early defibrillation. So what we're looking at is percentage of survival from bystander AED to first responder to responding EMS. And so as we look at the graph, your best chance of getting ROSC is 56% by bystander AED there. And then the next one being first responder, and then by responding EMS. And that's because the sooner you can get defibrillation onto someone or start compressions, the better chance that they have for survival. One of the data I pulled from one of the calls cardiac arrest that we ran this year, Chief Randy with Georgetown PD has an AED, and we've restocked his pads and made sure his AED was still functional. And he used it on one of the calls back in the fall, where he got there before EMS arrival, applied the pads, shocked the patient with the AED, and this person ended up, we ended up getting pulses back and getting transported to the hospital. So it kind of just shows, having first responders and having our community have these AEDs is a huge help for visitors and for our community. So next thing I want to look at, because I know starting this project, our AEDs in the county are kind of hidden. It's like when I first started this project, it was really hard to kind of get an idea of where is our AEDs located. So the next thing that I want to look at is making it easy for the public to know, if you're in Idaho Springs, you have an idea of, okay, that's where the AED is in Idaho Springs. Any questions?
I just just a comment. I mean, not having just the ride along a few years ago that I got to do when nothing ever happens, when you go on ride alongs as commissioners, and then all of a sudden there was that guy down by the, I want to say he was down by the visitor center, I think in Georgetown, and no vital signs at all. And then just to see the crew satisfaction, to see, to be able to get somebody back and get them down to the hospital and get them through to discharge even is, it's a pretty big deal. It's a wholly different outcome. And it's, I mean, I could see the satisfaction with the folks that were on the crew on the call. It's pretty rewarding.
Yeah, and it is rewarding, especially, that's the true time that you really save someone's life, because they go from literally dead to, now they have a pulse and you got them back. And their best chance of survival is definitely with the AED and kind of the knowledge to the community. So next steps going forward is how can we educate the community? We started doing CPR classes. We just did a CPR class for all the sheriff patrol deputies at the beginning of this month. I think we have some other classes coming up for some of the county workers, but my next step is kind of how can we get the public more educated and getting this out to the public.
Yeah, and I mean, I think you can presume I love this idea as well, or just this need. I think in the past you've all heard, so I'll just say it in one sentence. My uncle had his life saved by a bystander AED. Got to enjoy a few more years of his life, and it was worth $76,000. So my question really is, I support the effort, all of that stuff. Are we talking about a budgeted expense, or are we talking about an unbudgeted expense?
Well, this one right here is unbudgeted, but all projections say that we're going to have a surplus in the budget thanks to the tax that will more than cover this expense. I think it's an important enough thing for this community that we go ahead and do that. But there is also if for some reason, after meeting with Maria and getting, that one of the things that I'm trying to do is to make it easier to budget forward with the money that we're getting from that tax. So we're in the process of doing that right now. Another thing that was budgeted into our budget was a remount ambulance for this year that we got grant funding on, and we're going to try and get that ambulance. But it is kind of a backup plan if we don't have the projected overage on our budget that I believe we do. That funding for that ambulance that we're probably not going to end up getting, because it's going to be a year or two before they have a chassis for an ambulance to get. I will use that already budgeted money for the AEDs. But like I said, I am 90% sure that we have enough money in overage and surplus, and this is enough of a, this is as important as it gets, I think, as far as a life-saving maneuver for in the county. So one way or the other, we will have the funding for it. Okay. Thank you, Alec. Anything else about that?
No, that's all I have, unless anyone has any other questions.
I have a quick question. I think having our first responders, i.e. our law enforcement team, being knowledgeable makes all the sense in the world. And I know from personal experience, the protocols have changed. And a few years ago, the Denver protocol was such that breaths were not essentially required, or else they kind of came in later in the protocol. The ski patrol is doing one thing. I know Evergreen Fire Rescue is doing a different thing. What are you guys doing in terms of your CPR and kind of teaching? Because I think the next step is probably teaching the public, making sure for sure the staff at the rec center are all qualified, and probably other places, the workers at Safeway, places where people are likely to need that type of help.
Yeah, that's a really good point. So the ski patrol, most of them are already, they do their own training. And actually we had an incident last week where lucky for this gentleman, he went into cardiac arrest like right outside of the ski patrol, and within 30 seconds he had an AED applied, and I think within a minute they had got pulses back on the gentleman. And that's what I mean is we going through that community and kind of reaching out to the businesses. I've had the Hot Springs reach out to me. The Hot Springs reached out about doing classes for them and doing CPR classes. So it's going to be kind of just reaching out to all these businesses, and especially kind of the recreational in the summertime, as we have the rafting companies and all the recreation that goes on, and educating those, what they need to do. One of the things we did this past summer is we educated the trail crew on this, and also on just first aid stuff, because they're out there deep in the wilderness and not, close to quick response. So we help them and educate them on what they can do if an incident happens. So that is definitely something we're going to be attacking next, is how can we get the areas where, I think out of this population group this is a population of 292,000, 15% happened in a public space. So it's going to be going and talking to all these businesses and educating on them, because that's what saves the lives.
Sean, that they still showing that, quick defibrillation and continuous CPR with or without any kind of ventilation is the way to go. And every year it just points more and more to that. There are still simple pocket masks for some that want to use that, but they still just passive oxygenation through just nonstop CPR. And the quicker you can get that defibrillator on, the quicker good things are going to happen. So just really push that.
Yeah, that makes sense. I think it also really lowers a barrier for the public, which is, you're not going to have to do mouth to mouth with anybody, right? If you just do this protocol and make sure that somebody's going after the AED, you're like 95% effective. And, the other stuff that you don't feel comfortable doing, that's probably okay.
Yep. They've shown that just those two things really help the outcome of the patient. And of course, now with the advent of smartphones and apps and stuff, and these new AEDs, if you are CPR certified or have any knowledge, there's apps where it'll show you where the AEDs are in the community, and really just give people the best chance that they could have up here. It's just pretty neat. The fact that we don't have to go around and check them anymore, and we could just look on our app to see if the batteries are good or if the pads are all right. It's going to save a lot of effort and time, and I think it'll start paying for itself immediately.
Yeah. And there might, The last thing I'll say about it is, and this is probably toward you, Brian Bosshart, I don't know if there's an opportunity for us as an employer to be a little more proactive in terms of making sure our teams that are out, besides our trails team, that was really good to hear, but like, what about Road and Bridge? What about other teams, what about other employees who are out in the community, or even at the courthouse in Georgetown? Because that's another place where this sort of thing can happen.
Absolutely. I know we've done, I worked with Beth. We did CPR classes for the bus employees, the bus drivers. So we did first aid and we did CPR classes for them. And I believe right now, I think Brian just told me the other day is Road and Bridge is looking at us doing a class for them.
Yeah. One of the main topics of the leadership team was to, figure out how we can get everyone, through this CPR class, and get everyone, really acquainted with these AEDs. So it's definitely on the top of our priority list to get everyone going. And we get on a good schedule and we just do it every year. And that's good because it's pretty easy to forget how and where those AEDs are located and just stay on top of it, Yeah. All right. Anything else, Alec?
That's all I have. And I just pulled up real fast, John. I just was showing you the bystander. This graph right here just shows out of this population group of for the bystander witness cardiac arrest, only 48% actually performed CPR versus 52% did not. And so that's why the push will be especially in a time of COVID, no one wants to get close to anyone's mouth. So just drive that compressions in the AED, and the AED that we got, I made sure it was a very simple operational AED to where, it'll be very kind of straightforward and easy for most people to understand and doesn't get out of hand.
All right, just a quick couple other things. I know we're pushing it too. Captain Clark Church, he was here earlier. He's actually over in a meeting right now with Annie and Dave Montesi and Dr. Smith. He's doing the community paramedicine program and getting that going. He gave me an update. He was going to update you guys today on it. It's they initially hoped for a start date for the first of the year. The state had to figure out how they were going to license us as a community more than just as a group on our own. So that application is due by March 1st. And I think that probably they'll let Evergreen, Clear Creek EMS, Center Canyon, Elk Creek, Indian Hills, and Highlands Rescue all work under the same license. That way we could help each other out and train with each other and kind of have it as a mountain community thing. We have here at Clear Creek, we have Clark right now, and then we're also putting 2 other paramedics through community paramedics training to get it up off the ground. We also have the public health nurses that want to be an integral part of what we're going to do. The funding this year is good. We have basically people that are already here that are going to do it. We did get $2,500 from the Elks Lodge, thanks Troy, and helping us get off the ground with some specialized equipment that we're going to use doing that. So they're meeting today with Dr. Smith to refine the protocols and standard operating guidelines. And then he'll be meeting with Dr. Ben Trott next week to figure out exactly how they want it to look here. It's going to look like, I think I talked to George about this, it's going to look like a tractor without any kind of implements on it at first. But we needed to make the vehicle to put things that could go on the tractor, and we could use it as that vehicle to start doing things for the community. It's going to be simple at first. It's going to be helping people with their sutures, making sure they know if they come back from the hospital, they're good with their medications, checking on their wound sites. At the same time, use that as a excuse to make sure that their smoke alarms work and there's no slip, trip, falls in their house. See if we can get them, in communication with any of the other resources that Clear Creek has to offer. And then I figure we'll just continue to reassess and see where that takes us. And, Evergreen right now, I only think does about maybe 100 patient contacts a year, if that. I don't expect we'll have that many, but as the need for things, as we figure out what this tool can do, I'm sure we're going to make the most out of it, and we'll reevaluate constantly the need, if we have the resources to do it, if we need more resources, if it's worth doing, that kind of stuff. So I know there's a lot to talk about with that. We'll know a lot more here in the next week or two when Dr. Bentrott basically gets us on our direction on that. So the other, Aaron is working on, so when we first got here, when I first started, it seems like we were trying to be paramedics that ranked up with city paramedics down in Denver, and we needed to do a lot of training to get up to there. Things have changed up here in Clear Creek. We have gone from the need for Denver metro area protocols to the need for Clear Creek specific protocols. We are pushing our protocols with Denver metro protocols to do some expanded protocols, including rapid sequence intubation with trauma patients and some different kind of pressure drugs to start off with. To do that, we have to go to school. All full-time medics at Clear Creek are going to be critical care endorsed in the state of Colorado. We're starting that school next week. It's about 3 months of school. And at that point, Clear Creek EMS will not only be one of the highest trained EMS systems in the state, but close to the highest trained one of them in the nation. Basically, what we're going to have through the captains, we're going to have basically a flight team that's a part of Clear Creek EMS that's on staff 24/7 up here, and we're going to really start pushing what we can do. We're going to turn instead of doing what's good when you're 5 minutes away from the hospital, we're going to start bringing on protocols that make sense for us being in this geological place that we're at, how far away we are from help and the hospital. And St. Anthony's is going to be with us along the way on this, but we're going to really start pushing what normal agencies closer to Denver can do, and adding on new things. I'm really excited about it. It makes sense. We needed to customize our medicine up here for quite a few years. Once we got good paramedics up here, thanks a lot to Mr. Bob Marlin, it's time for us to start getting a specific group of people that runs calls up here that is catered to the needs of Clear Creek County, and that's what we're going to do. So far, St. Anthony seems to be a part of it, but to get the extra, education is going to take some time and effort, but people up here are into it, and I think it'll be incredibly fun to watch how this pans out, and it's incredibly good for the visitors and the locals up here also. So more to come on that. School starts next week, and everyone's going to be hitting that pretty hard for 3 months. Any questions?
I've got one really tactical question. I know one of the tools that got removed from the pre-hospital setting was ketamine for use again treating excited delirium. Was that something that affects us, or is that more of like you were saying, more of a metro protocol that gets used more down the hill than up here?
Oh no, it affects us up here. You could argue much like sugar and Narcan. That was one of the tools that we had, and the only good tool that we had to take care of these folks that are, in a what we call a sympathomimetic crisis, which is basically, can't be called excited delirium anymore. What do they call it now, Alec?
It's just using just very aggressive and just combative terms is what we use now.
Anyway, that's the only medication that we use that actually, made these people plateau out, not just continually, go to the point where they would be in cardiac arrest just from having too much, basically uppers on them. So it affected us greatly. We haven't had one of those patients. We're trying to figure out what drugs to use in those situations right now. And I think the whole Denver metro area group is trying to do that. Not as much luck as what that medication did. We could still use it for pain medication, but they really took away something that was a life-saving maneuver for us. So it did affect us, and it did affect people down the hill. It's too bad that that whole situation happened. I think it wasn't it was a no-win for everyone at that point, but they took away a pretty big piece of our life-saving ability by taking that away from us. Yeah.
Okay. Yeah. Well, thanks. I'm sad to hear that. And I know Semtech wrote a letter to the legislature asking them to reconsider what they did, which, you know, a lot of people think caused more harm than created good. But with all that said, I just wanted to say I really appreciate your leadership, Brian. I appreciate you, Alec, and the other captains. And I know one of the things that we're remiss, I talked to Linda Underbrink, and I passed this on to George and Randy too. I know that you, Alec, have been essentially acting as a member of the Free TAC, and I'd like to have us formalize that sometime soon, because of what Linda said, you're already attending and being a very valuable member. But just beyond that, you know, I think to how these conversations went in 2017 when I showed up, and they weren't. I was always frustrated after having these meetings, and I didn't feel good, and I feel really good, and I feel like you guys are creating a great environment for someone to create an EMS career and providing wonderful care for our community, and really seeking to improve yourselves and to deliver a higher level of care. And I just commend you for it. And I'm proud to have any role in this at all. So thank you.
John, I couldn't say it any better.
Same.
Thank you so very much, commissioners. We very well, we appreciate that. Thank you very much.
Yeah, please pass it on to your team.
Will do. You guys all have a good day. It's been a long one, I think.
Thank you, guys.
Oh, and I do have a quick update. We actually did appoint you, Alec, in our reso in January, so you're official.
Well, I appreciate that. Thank you guys very much.
Okay, perfect. I think we're done for the day, other than one more executive session. Is that right, Peter?
We have two more subjects for executive session.
Okay.
Does the board want to take a break or need to take a break? Before we go into it, it's up to you guys. I just want to make sure everybody's good.
What's your estimate of how long it's going to take, and then add 25% to it?
An hour and a half.
Is it?
I mean,
it'll take probably at least an hour, and if you add 25%,
2 minutes.
I was going to say that I had the smell of the barn until you said an hour and a half, and now maybe I want to meet you there.
You want to take 5? You want to take 5 and then end this meeting, say the magic words, and then 5 minutes convene on the other side?
That's great. I did send out a new Zoom link, just so you know.
With that said, then I move the board move into executive session to discuss the following matters.
Pursuant to CRS 246402-4B and E, for the Board of County Commissioners to meet with the county attorney for the purposes of receiving legal advice on specific legal questions relating to claims and litigation against the county, and 2, determining positions relative to matters that may be subject to negotiations, developing strategy for negotiations, and instructing negotiators with regard to those claims and litigation matters. And pursuant to CRS 246402-4A and B, for the county attorney to meet with the Board of County Commissioners for the purposes of discussing the purchase, acquisition, lease, transfer, or sale of any real, personal, or other property interest relating to certain omitted property on Jones Plaza or along Trail Creek Road, and 2, having a conference to receive legal advice on specific legal questions concerning the aforementioned omitted property.
Second.
We have a motion and a second. All in favor, say aye. Aye.
Aye.
All right, the motion passes. We will move into executive session. No decisions will be made and no minutes will be kept. See you there. I see you at 3:10.
I'm always the slowest one to find the link. Thank you for staying with me. I was lonely. See you later.